if it's consistent. Yeah. Well, and we do have, I guess I
Google that, right?
there you go. Yeah.
It's
It's actually not showing that's what we're talking about. Yeah. So that's why I kind of stood up and showed you this. Long bones, it's actually the humerus. It does state that. I don't have full understanding why. We should probably all write and say, no.
Yeah, it's getting you close. And remember, this is a, what did he call it? A compendium, which is brief, concise, boom, boom, boom. But if we look right here, we don't make white blood cells here in the clavicle. It's here at the top of the humerus. You can make it at the top of the. Sure. And do you want to try the mirror? Okay. All right. Let's hear if anyone wants it.
You know, I was told there's a flat bone that creates a marrow. Yeah, this is a round bone.
They call them long bones. It's the marrow of the bone on the long bone, so we won't make it in every bone. The clavicle, I believe, is considered a flat bone, so I'm not. So I'm not.
It's not one of the sites.
Well, what was on the flat bones?
With the marrow. That's why when you have a backache and you have a little leukemia. If you pull out everything else,
Right. Yeah. I've always known the long bones to have the marrow. I wasn't aware. Sure. Well, and maybe we know they know more, today. Let's see. And it could be that those do the same, and one does it better. Tell me what was the, you're welcome to grab one. Go ahead. Am I demonstrating?
Because you started the day two, it's not, you're no longer dosing, you're starting at the right hip joint and work down behind the right knee. So you're actually painting that.
So bones with epiphysis are the long bones of the limbs, the femur, the tibia, the humerus, the radius. Phalanges. Actually, ribs have epiphysis as well. Epiphyseal plates, yeah. Which are tight. Okay, so which bones have epiphysis that generate? Yes. Oh, certainly. Okay. Tell her, Mary, I'm on a search right now. We've got some questions, so we're going to see if we can't answer them. That's FaceTime. So go to Zoom. Share. Sorry about that. Sharing is not turned on. Send a request. Can you see me now? Can you see me, Mary?
I see you, just not the screen.
Okay. So I'm now going to go where I was. Let's try this. How's that?
I see the screen behind you.
So I need to share your Zoom. I'm on the Zoom, so go to.
Just on the bottom, share. Should be a green button.
Thank you.
From above.
Working parts.
Perfect.
Somebody's like, I don't know the body so well, but. I worked with it a lot longer.
Right. Thank you.
You bet.
Your voice out today.
All right, so right now we're just getting some clarification, Mary, on the epiphysis of the bones. Which bones have epiphysis that generate Okay, the epiphysis of long bones such as femur, tibia, humerus contain red marrow, which generates white blood cells. In adults, this red marrow is also concentrated in flat bones like the hip, sternum, ribs, and skull. So we got the sternum here. So it looks like definitely on those flat bones, we should probably be able to, but maybe just trying to keep the long bones something simple. I do know when we tap our thymus, remember this houses your killer T cells. It's kind of like, you know, they start in the spleen and then they go to special ops school, and then they congregate here. This is where they hang out. This isn't necessarily, according to some, making more, but what are housed here, you're going to stimulate. So if somebody coughs on you, right, or near you, this is something to do. You could tap the spleen to mobilize if you don't have your device, right? Go ahead and send some of that love out, because you just walked into something you don't know what it is. Won't hurt, may not help, it won't hurt for sure, right?
For the face, to help move things out, absolutely, yeah, down here. We'll pat it right down here, because remember, they'll come here, just in front of your ear now, and then come down. And you could, and when you see how to do a lymphatic drain, you know, it's gonna come down here, all of this is gonna come to these loopings right here. So you can flush it out this way, and then you bring back, you've got groupings, these are the larger groupings, so that you can, you know.
No, last time, I never get up to 2 in the morning. I really like this. Except for last night.
Last night? What did you work on?
Well, I think it's when you had to work tummy area.
Oh, yeah, so you was it sticky? Was it sticky? Oh, yeah.
But I have never.
Something was.
I was exhausted. I didn't sleep last night.
What? Oh, the back rib. That's a big one. Did you do a foot detox?
Yes, I did.
Oh, good.
Yes, it was a 20-minute warm with
Warm to hot water, it doesn't need to be burning. Very good.
I don't know. All I know is that it was like, oh my gosh, I got a car tomorrow, and I'm gonna make it.
You're gonna make it. So we're gonna continue on. We're gonna give the thymus, liver, and spleen a little love. I want you just to feel comfortable doing this. Okay. Some people get a little squeamish about an organ. You don't need to be with this device. Okay. So what did I say about the thymus? What's housed in the thymus? Yeah. And so the thymus is where, and specifically the killer T for thymus. The thymus is where white blood cells have, where they go when created, and to treat bones or store waiting to be released. From these suprasternal notch downward, front of the rib cage, you've got a gland, which is literally the thymus gland. Make sure that you clear any sticky spots. 30 seconds should be sufficient. So if you have a run, like I do. I'm sorry, what? Would you do the thymus on our back?
Yeah.
No. Well, yeah, but I think we need to see the collarbones. What do we need? I think you're maybe just as a yeah. We've always done it on the thymus. Alright. On the. Yeah.
This-
So what you're doing is you are moving in a downward. Okay, you can certainly work out a little sticky, but remember just to finish downward. And then that's sticky there.
Eating the. That was also.
And vertical. Mhm, yeah.
And we're still on 77, correct?
We are, no, you should, if you had, because you don't have 60 on yours, right?
Yeah. Which is Genesis.
Yeah,
Yeah, you need 77. Oh, actually, we're an organ, so, yeah, you be 77, we're moving the organ to pay attention. You would then transfer, if you have it, to, Sonnet T90 or 77, if you have it. We were on 60, except for the Genesis. And what did you do for your Bosnian? 77 or 90?
77.
Or 90.
Or
With the pinnacle, right? In his previous books, he did not, one setting, but it wasn't perfect. So I really like when this one came out, showing various devices and how close you can get.
You go all the way down that stern. It's like-
Yeah, so I got a bronze, so I just.
Just got as far as I could and.
Oh, I see.
There's not so much on it moves.
Yeah. Mm-hmm. So we don't tap fast. And then the liver, did anybody put theirs on? Who did the liver yesterday? Did anybody suggest doing the liver?
Yeah.
I'm sorry, I'm in the wrong chart. Okay. Yeah. Yeah, and how long did you do it? Okay.
Like forever.
Out of curiosity, have you done the liver before?
Yeah.
Did you ever have a change in color for a time of your bowels when you did?
Okay. You did?
Oh, yeah.
You had a change in color?
Yeah, they went a lot lighter and more. Yeah.
Okay.
More together.
Yeah, well,
Came out.
And don't be surprised if it's super red, because, you, when you're using fMRSI or vaso, you're really flooding it with circulation.
There's a on the right side of your-
Right side,
up underneath the rib cage, so feel for the rib cage. And it's a large one.
Just do a thing over the page.
Yeah, all the way across, and the gallbladder, here's the nipple somewhere, and some of you can press your gallbladder. It may actually be a little sore, if you feel that. You can come in. It's right, it should be under your rib cage. Yeah, the rib cage protects it, so. Obviously everybody has one, but it is kind of interesting on occasion, like when I would assist in autopsies. Anatomically maybe it's correct, or the bones would be different, or. That's when we go over to the livings. If there hasn't been any change, it's just a matter of how big they are, how muscular, how much scar tissue. And then the pancreas is right, and then the. It's right behind you. Yeah, behind the liver. So reading on the liver, because this will help flush things out. Because we're doing something like 500 processes. Yeah. And remember, it comes down a little bit, portion in the lower left quadrant, you have your, what first, your appendix. And, you can press down there, if that's feeling a little sore, give that some love, especially if you have a cold, because That's gonna help mobilize some things, but if it's feeling a little sluggish, you want to stick right there.
Yeah, right.
It's sticky. No, I'm not really sweaty. I'm okay over there. Oh, do you need a device? Oh, you got a device.
No, good. I was just concerned.
Here's one.
I follow this one.
He's doing it. He's got one.
All right, good.
Okay. And we'll, because we have an extra, if you guys want to use this, Adele. Okay.
Maybe it'll switch each other.
So a question for you, this is really fascinating, looking at the book and all your lectures. So you got part two where you're building the white blood cells, you have 4 days of that.
Well, no, and you'll repeat
Right,
as needed. Okay.
right. So then after you finish your part two, then you do part three, or you do this, and then a second day you do this.
So this is day one, include this. Day two, you can include this. Day three, you can include this. You can do this just on its own.
Nice.
This is day one drinking.
Yeah.
These can certainly be standalones.
Okay.
You could have a common cold and do these, you're not concerned about white blood cells,
Yeah.
okay? And then we're, there's the respiratory piece, which can be done at any time you walk through smoke, again, you walk through somebody's cough.
So this could be done, part three could be done anytime.
Almost everything could be a standalone, as you, here's what I want you to do, everybody take a look at the front of their book. And I want to walk you through something, if I haven't already repeated. When you get to know this table, so get to the table real quick.
Can you see Mary get to the table? Page 3, yep, table of contents. In the beginning is the beginning, introduction, right? And then it talks about the fascia. So our first probably hour or so of the day was talking about chemical. Remember, speed is crucial. All right, chemical versus mechanical, the collagen, the fascia. So that's a lot where that is. And then you're going to go into how are we going to apply this electrophysiology. You are doing applied electrophysiology right now. Applied being that you are applicating it. You're not just, it's not just a curriculum of long words. Yeah. Yep. And now go to chapter 2. Yep. Well, but right now you are applying the science of electrophysiology. That is what your certification is in. A lot of people can't use the word applied. They've taken a microcurrent course online. You are applying it. Yeah. But when you see the applied, it's going to talk about, we've already done this, the neuropeptides, the reason why microcurrent can make an impact, why it can help. Here are the benefits, okay? Pain paths, active zones, what to do with them. And then chapter 3, core techniques. If you learn these core techniques and why you're utilizing them, and there's, probably looks like a good 30, I don't know how many there actually are. You're going to be able to look at, let's look at page, I'm going to go down to 75, chapter 5. All of these condition-based, these are chronic conditions. You're going to know how you can help. When you understand, again, the 4 rules of microcurrent, scar first, inflammation next, hidden pain if needed, alignment. And then you can go into some of these core techniques when you understand what they're going to do. Oh, he has, so mine was leukopenia, vasopenia. They basically told me you will have, they didn't want to call it leukemia because I had so many others, and it could have been, all of these other things. But let's just say it's non-Hodgkin's, it's, we'll just say leukemia. That is a disorder of the blood. And what could we potentially do with this and nutrition for disorders of the blood? Are you starting to see the picture? Well, it would be everything. You're going to want to feed it. But can you begin to see the vision that you could be a part of in somebody's life? So those core techniques, if you don't worry about, oh, how do I fix carpal tunnel? How do I do diabetes? Learn these core, and you can do anything here. And you can certainly go here, but sometimes people want to go to a condition. You'll go way farther, you'll do and feel more confident when you learn these core. That, Dr. Hache has created. He didn't create these himself, but by putting these together along with, utilizing things like the Meridian assessment test or we're using AO scan or the cytoscan, whatever you're using. This is just another of your tools that you can layer upon. Always include nutrition. I focus, most of us aren't getting the basic 90. So I do like one thing of three first, and then I'll do some add-ons. Now, I love their Juice Plus. It's a little gummy.
Recording in progress.
It's a little gummy to me, right? So when I want a little something, rather than something that has other stuff in it or has zero value, but you guys, I can be too anal in this. But you know what? I really do focus on things that have purpose. Do I ever? Absolutely. I've given myself grace. He's given me grace, and it'll be gluten-free. Yeah. No, I don't. Now I don't enjoy a pizza that isn't. But yeah. But like this morning, I had a little, probably not even, might have been a quarter of a gluten-free muffin. But yet I had protein this morning. I had protein, and yeah. But I am looking, I feel so good. I was at a period of time, I had MS, my father and grandfather had ALS. So, but they said, nope, yours is MS. I had hyperthyroid. My eyes were super buggy. My mother-in-law one day says, do you think maybe you might have Graves' disease? I was like, what? Why would you say that? She started to notice in our family pictures that my eyes were buggy. I was incensed. What? And sure enough, she alluded me to it. Like I went back and I had hyperthyroidism for quite some time, was unwilling to take anything. I thought, until I can't handle the symptoms, I'm not taking the medication. Well, an option is for hyperthyroidism is if they will remove your eyes, drill out the sockets, and then replace the eyes. Yeah. And it was, I can't remember at what point, but then I was introduced to nutrition. I mean, even when I was a triathlete, outside of protein and branched amino acids, fitness and nutrition, they're not working together. It's like one or the other. Many of us have been in that camp. There's some very specific things in fitness, and that's where I was. I didn't think I needed. But when I started and learned about the essentials and started getting them in my body, all of these changed over time. It was 9 months for my labs of 12 years had changed. This treatment sounds a lot better. Yes. But the first thing I did was just add nutrition. And obviously things like my liver and the white blood cells, the microcurrent was key. I truly believe, because I was on the nutrition when I had that dip with my white blood cells. Quite possibly, I just I didn't have that electrical charge.
So basically, we're in the core techniques.
Those exactly for the folks that will work with me and learn those first. Something will come up to you, and you might not have the whole protocol, but you'll know to do these three things. So, and I'll share. Michelle told the story about her sister. I didn't really have an exact of what was going on, but there was pain, there was swelling, and there was something else. Give me a minute. So the first thing I did is, where's the pain, and did she have any scar tissue right there? She was in so much pain, and it was respiratory. So the first thing I did was address the pain. I addressed the respiratory front and back. And I mean, even right there in the office, she was like, oh my gosh, what did you just do? She could walk about 3 steps. Maybe 4, and she had, and if there was something to lean on, she was leaning on it. She had to extend her time getting to and from work just to walk from the parking lot into the building. And by the time I saw her, I think she was had been on about 4, 5, 6 weeks of, and they didn't know, and whatever they did do, she was 2 months out, and I mean, her respiratory was pretty.
3 hours in the last, and the hours that don't matter. We can't do anything for you, you don't know.
Yeah.
They run all tests. Echoes, pulmonology.
Right.
And then not, you know what else to go, that's how we found you. Because we didn't know what else to do, and since we might want to hang on.
Right.
We didn't know what else to do, and now, like, that's the first place I went to Central.
Margaret.
Scars.
We have a question about scars.
Yeah, so we did this particular case. The lungs were the issue. So we treat scars over the area.
Correct.
But
Front and back and under the side. Remember, imagine everything under the rib cage is lung. Just treat it.
Yeah. Do we address when we have some do we address scars all over the body?
Not when they're in an acute situation like that. No, I'll worry about the stuff on her legs, her hips, whatever. Let's get her out of that immediate distress. If you take the time. So the question was, if somebody has all of these challenges, do you address the scar tissue throughout the entire body? And in my opinion, no, you address the acute situation first. And then as you're working through some things, I might start looking at the scar tissue that was, over here for this particular procedure. But in that immediate, I dealt with the respiratory, the swelling, and she had 3 areas of pain, and they were all actually on the, so the heart and the lung meridian have 2 points that are super close together. And so I treated both. I had no idea if it was heart or lungs. Everything kept coming back. It wasn't either. But something was going on. She also had, I noted, lymphatics. So prior to her leaving, I treated the lymph nodes here, and we gave her a little love down here, because what I'm trying to do is clear them so that she can pee that out rather than it circulating. That makes sense. She had gained 40 pounds in almost 30 days. So she was holding something. That's my guess. Yeah. And but she dropped how many pounds?
20. Very.
Yeah, she dropped 20 pounds. And we did get her on some nutrition that she wasn't on at all. She is in a work-life style that she eats out probably, I think she told me 5, 6 days a week. So, I encourage some different choices in what she's eating. Remember, even when it's a good restaurant, they're there to make money. They might create a great atmosphere for you. But a lot of times they are utilizing the most inexpensive ingredients because it's like a 3 to 4, 5%. Your husband was in it. It's a minuscule profit. What's that?
So where can they make a difference?
Yes, where can they make a difference in their profits? Exactly. So
So I have a question where we're talking about scarring.
Another question about scarring.
A lot of people today has tattoos. Is that considered
Yep.
scarring?
Yes, absolutely.
And they have, lung issues.
Yeah.
And obviously, they can treat the whole area. Would you want to start where the tattoo is, or do you want to end with the tattoo?
So that's a good question. I am assessing the whole person in the moment with the idea that I'm going to attack these scars if they will allow me. But remember, when your client comes in, if they are in pain, address the pain, and then just say, I need to take care of the scar tissue. So I did have one gal, she had a mole taken out, and she was having right scapula pain, typically without that mole and that scar, which went very deep. I would have started with what we're going to do next, which is the collar zone, and that's the neck and shoulder protocol. I would have started with that because oftentimes that scapula, where's the nerves? I just want to show you nerve. Give me a minute. 4, 5, 6, and 7. It's not on here. Will run under the scapula. 7 being towards the bottom of the scapula. So I already knew she had this problem, and so I want to treat the area and then go to what I believe to be the root cause, right? Well, she had this mole that was so deep, so I did this, and she got some relief. I said, if you've got the time, I'd like to at least begin treating that scar. No, that's okay. No, I think she let me treat you. I got this much time. So I don't believe I dosed her, can't quite remember, but I just got in there and was painting that scar. She was like, oh, that's helping. Oh, that's helping. And I said, well, I'd really like to get in there and dose zero. I was probably dosing, and this might have been the second time, but I want to say we were closing in on 6 or 7 minutes. She's like, she didn't understand what could happen forward, but even just the painting. So we got some relief, and then she allowed me to go to the scar. Okay. Did that answer your question?
Yes.
Any questions, Mary? Yes. Nope. So the question is, many people are having titanium put in, different kinds of metals as replacements. And would the protocol be anything different? No, you're still going to treat scar, and then obviously any swelling, and everybody scars differently based on, and we know based on the nutrient level in their body. They may have more of the things, and so you're like, wow, this person, let's say they don't do anything but proteins. Wow, their scars look really good. And then you'll have somebody else who does what we call fractionated nutrition. They take a ton of supplements, and it looks like, keloidal almost. Either way, it's going to still be the same. One will require a little more work. And then especially something like that, you want to dose zero. You get them out of the discomfort paint. They're going to have greater motion. Their pain should begin to decrease, but ultimately you do want to still dose zero that whole scar.
When is the use of the body?
So some contraindications, just as a reminder, we touched on a few of those, if not all, on Monday or the first day. But let's take a quick look in the book so that you can come back to this. And when you get your user's guide, it will actually say if you have any electrical stimulation. Okay. First trimester of pregnancy is one. Electrical stimulation. I'm trying to remember what it is, and it might only be in your user's manual. How about I look that up? We'll break. because it's time for us to break, and I'll see if I can't locate that for you. But when your small user's manual, when you purchased your device, does anybody happen to have that in their bag? Yeah. And so we'll take a look at that when we come back, and then we'll go to neck and shoulders, also known as collar zone. And so it'll be page 37 when we come back, collar zone. All right, what time are we coming back, Miss Gina? We have 13 minutes. Sorry, took up your time.
Yeah, now you got 12.
Recording stopped.
It's so funny, my student, because we need the renting for her and the renting unit that I would go to on. I took my sister. We rented unit at home, and I would move my sister twice a day. And it was funny when we started. No, wait till I end. No. Wow. I would have loved to have the DD talk that. And I'm involved like that's my space. I'm like, okay, I know it's good for you, but really, I don't believe. It's a losing all of it. And talk about that. So then I do like other like DD talks out, not just talk about that. Yeah. And then I do like some other things.
Well, I knew that the magnesium salts work because oftentimes we see those in alternative therapies, and like, well, there's got to be something to
Magnesium salts to bring it up, because you guys like magnesium salts, that's they're different.
Oh yeah, I
magnesium. Well, my birthday, I'll use magnesium salt and a leg. There's a detox, and then that's
I
I know there was that difference either until we started doing it. Absolutely without magnesium, and there's still magnesium, but I've actually playing with it.
yeah, one is
Fluoride versus
putting fluoride
versus I can't remember it right now.
into
But it works. And I was
you can for your healthcare space.
I've been doing massage. So good. Doing massage 2001. And then assistant. And then bone. And then I work in the food. There. It's okay, hold on. And you utilize them, their prescription for their for 20 years. And it's all like, I'm it's like not had doctors. So okay, or
So Gina?
Yes.
I was just gonna show you something. We, I had changed the schedule a little bit. Yeah. So I was gonna show you, let's see what our difference is, so we can write it down. Oh, so none of this is on there. I didn't catch that. Oh, I need this in there. Okay, so I'm gonna make it small.
And I was just about, and I was satellite. Get everything's space.
It might have just been a morning. Her tissues, carpal tunnel. So we got that part right, thank goodness. Yeah. I guess I didn't send her the update, or it was overlooked. Complete survey, blah, 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 schedule subject to change.
Subject to change. So, are we still doing our 345, our 245 knee and bring in our,
Right there, starts with 3 hard tissue carpal tunnel and repetitive strain. Her mom has repeatedly injured this.
since she was like a teenager?
Yeah. Okay. You're gonna do 350 or what?
And the boys have
I've seen them participate with Microcurrent myself. And but you're doing the nutrition too, huh? So maybe that combo.
Yeah.
And that's a vision.
Animal cookies.
I know.
Got this one. Right?
I don't see.
Yep.
Oh. Okay.
Yep. So,
Yeah, that's a good thing.
just like change. So.
Yeah. Try 350 in the beginning. Just tell her, yeah. And it could be she's misaligned.
I like my grandpa.
So that sciatic, that nerve runs, and it may not run straight down here. That's the Achilles right here, and then the this gets. So that's why we put it here. Well, if you do both sides and then pull away, yeah, no, she's level.
Right.
But if you had to do that, you get some really.
Have a little more.
As a group.
And so when I was 30,
Do you want to take your glasses?
Right.
Things are ready, so we gotta make a reset.
Okay, and then called AJ and I saw Ace on there.
And I said, I can't figure it out. I said, there's this yellow. And he said,
it was covering. But you were talking about this yellow.
no,
That's
this
you.
yellow.
Oh, that's what happened yesterday, remember?
He goes, what's that yellow? He goes, we said that yesterday.
Yes.
I went,
Duh. It's so obvious, right? That's too funny. Well, thank you for your, you were very tenacious.
So you're big long out of everything. It's like, well, that was weird. The devices would do that.
Right.
I tried to do mine and it goes, no.
It's nice to be wanted. What did I say we're coming back to? 44? 40, what was it? Actually, we're gonna have to move through, I think we. Was that good? That wasn't too much time? It's a lot, but those protocols are, and we're gonna do a shoulder grid, but, Yeah, I'm probably gonna keep it short so I can,
Most people won't even attempt this. I think it'd be a good thing for you to do on Laura. Anything that you can dose on her and kind of bring stuff back online, even though they might say, well, that's not an issue with her condition. As the condition had worsened, other things will be impacted and it's creating other symptoms. So, I think I just had it, 37? I think it's 37. 37 collar? Yeah, collar zone, yep, that's it. Yeah, collar.
color zone, which will include the collarbone.
Well, this has been in my head, I'm going to have ADHD. More than I got that, this is, you know,
Yeah.
and I noticed, on this, the installation of, the concept.
It's pretty colors.
You can do this. You don't have to have patients do it. Yeah. Well, I know the words in you got one or two things. You can take a survey, something, you know. Celebrate. What you was, oh yeah, your history when you first. You want to read it, you don't want to, and now you use it for the rest of your life. Has been symptom. But why do that? Some things, you know, I have a 20, you typically don't care about that. The fitness coach number is the, so 109. And probably around 1 she called me. I said, yeah, I do that. She said, so here, now it's just too much because it's so it's a natural. Previous surgery at night, she doesn't she just slowly titrates like a quart, or with it every 4 hours. So she's like 2 she should down 1.5.
Right.
And I said, do that for a couple days.
Okay.
Okay.
So then, you cut it off.
Yes, yeah, that would be.
Would that help with?
No, anybody, absolutely. One cat will 4 times a day for 1 month.
Wow.
1 ounce.
Or
Well,
in the picture.
you can certainly it is, so mix it in them. But yeah, I think again, you know that,
Right. Apple in your, in the report.
Yes.
Just apple in the kid all day. That's what I'm saying. I think the apple may need to go
Ready? Ready to get started? Everyone ready? Grab your seats. Ready? Ready? Yep.
No.
Grab your drinks. Get ready to start.
Recording in progress.
All right, we are on Thank you. Okay, if we go to page 37, we're going to do a quick overview of collar zone. This would be something that you would use for somebody. This would be part of the migraine protocol. Anything that is bothering the head, neck, shoulders, or arms. This is going to be gridded out for you, but you don't have to grid it. Remember when in the beginning we were doing hidden pain? This is hidden pain, but we're just going to look at the entire section. Okay? So basically, these are those four little boxes. I'm not. I wasn't. It was going off. So I just want you to understand that this looks like it needs to be, all aligned, and what you're really doing is the size of your wand and the placement of the balls. You're literally just going to almost go each size across and down, so that you feel confident. I've touched everything. This is gridded out, but don't let that. If you don't have a grid, we're sending you home with a page. You can copy it if you want. This is it right here. But I think I might have showed you, or I will show you. Let's just say along the side here, you can just kind of mark, and then you just go on those marks. You're just looking to touch every little part, or feel confident that you did. Because when it's hidden pain, this is why you would do the collar zone grid. And again, it could improve. It could be something like migraines. If you've tried the other protocols and migraines are still, simmering. Also helpful for those that have at least once or twice long-term allergy symptoms. That sinus, the running, all of those things that we just went through with the immune system. Sometimes it is something holding something, and we think we're going to be working one tissue, and maybe you impact the lymphatic, and that was in fact it. Okay. This is I have two. One is written out for those of you that do not have a display. So if you want to pull out your stopwatch on your phones, this is where you'll get that dose, and you'll dose 0. So we're going to practice that. This will go quickly though. Okay.
You also have second hand.
Yeah, and you have that. Thank you. Yes. Sometimes we're so used to our digital, aren't we? So before we get started, do you have any questions?
Yeah, the book says the velocity of light pinnacle says 60 megahertz. This is a velocity of light pinnacle. Does that mean that's like the light evolution and the pinnacle?
No. So a velocity of life created the pinnacle. So they're using the full name, not just a velocity.
Okay, because some of this is where it's a little confusing.
This way you can see that you can use a different device, and it'll give you that settings name for that tool. And then they'll.
So what power are we using for evolution?
Yeah,
60. Yep. 60 hertz. And agreed, I'm not clear why maybe that's not in here, but you can certainly use, and that's what I create, that's what's created here for you. 60 hertz on the evolution, Paul, on my grid, Paul.
Oh,
So this is the one specific to the evolution.
oh,
And I'm gonna leave that up and I'll help those that have the pinnacle. Because you have the display, and sometimes one feels harder than the other, but they both, it's just a little bit of a learning curve once you know it. Yes. Oh, thank you. Did you find the page? Oh, may I?
If you can just share the screen, that'd be great.
I assume it's flows, one of the area it flows to be.
User guide, there's a little thing, yes, a little tiny. Mine. Put your name on everything, especially if you're gonna come to class.
Okay, where's the share screen?
Hit the green button below.
Oh, there it is. No.
In evaluation, starting from one, take your
Take
initial.
that off,
and.
and there we go.
If the two is higher than one or more, take it to dose. Take it to dose.
Thank you.
Perfect, thank you.
You're welcome.
Now we need to get up the presentation.
Okay. Thank you for your patience.
No problem.
I can close this out, right? All right. So we're going to be doing the color zone on page 37, but as promised, we're going to look at the user's device under safety. This one right here is the pinnacle, but it's this really small one. So it is not about the small book of protocols. Okay, this will be very specific to the device itself, not about how to use the device. If we take a quick look, at least on the pinnacle, you'll see overview and then safety instruction and warnings and contraindications. Now, I have not seen this, but it does say to reduce the risk of burns and other injuries, read all the instructions and use as intended. Again, I've seen somebody say, ouch, but I've never seen burn or anything like that. And I used to see 10, on occasion 12, 15 people a day. So some contraindications. Do not use if you have a demand type cardiac pacemaker, implanted defibrillator, or implanted metallic or electronic device. Such use could cause electric shock, burns, electrical interference, or death. Do not use while pregnant or nursing. Do not use this device if you have undiagnosed pains and symptoms until the underlying cause has been determined. And then there's some warnings. Again, talking about pregnancy or delivery. Now, it's interesting because they actually do use TENS units for delivery. And micro, so, they'll place one back to help alleviate the pain. But this is a protection for the manufacturer. And again, we're working on the body's own natural microcurrents. Do what you are, comfortable with. We do know after the first trimester, people have used this if there was some pregnancies. And And even like after open heart surgery, there are many that have stated, they go in and they treat those scar tissues. And we can talk about that. Continued use of the device can over-irritate the skin. The device will automatically shut off sleep mode after 16 minutes. And there is an override on that. Stimulation should be avoided over the carotid artery, as well as the thyroid. So we're passing over. It's actually just sitting there and stimulating. Okay, and that's why when we're looking at little wings, the SCM, your carotid is more up front, and you are coming behind, or you're above, or at the brachia of the low of the carotid. Okay, when we do little wings.
So for sessions with individuals, it seems that it would be worth form they would sign that individuals assigned individuals, so they're aware. Sometimes in the discussion, fly over people's heads, this is the this is
So Linda is suggesting that maybe, if you decide to work with clients, that there should, you might want to include a form. We are non-invasive, and I have not yet seen anybody doing that. But yeah, you'll want to make sure that it's at, your comfort level. And actually, I shouldn't say that. We actually do have on our form, and if I have one, I'll share it with you guys. I just remembered, it does actually list all of those possibilities. It's got a lot of other stuff on it too. And so, yeah.
Mary has a question. How do you override 16 minutes if you want to use during sleep? I know how to eliminate it.
You do?
No.
Oh, yeah, she wants to. Yeah. I'm going to grab an evolution. I'll show you how it is on a Pinnacle. So my device is off. And what I'm going to do is, let's just say I want to override the time out. I want it to run all night long. I'm going to press the plus sign and then turn it on. And if you can see, you'll see it says time out, sound on. You should be able to do the same thing with the other devices. Let me know. And so on the Pinnacle, also the plus minus are on different sides than the evolution. So give it a try, see which one I don't remember. So test one of them, turn it on, and see if it's your sound. Sound is still there. It might be your minus on the evolution. Yeah. It is the minus. And you still have sound. Whose sound is that? You have a little bit different chirp, don't you? Tanya, okay. I wonder if that's only on the Pinnacle, and I just haven't noticed that. We can certainly check in with Avazi and see if you have a timeout. Or if you guys want to go on to the pain-free for life, you should all be in the VIP. Does anybody not know about the VIP community Facebook? VIP Pain-Free for Life support group. And I'm going to bring it up on my screen. This is.
So Mary said, how did you do the evolution?
Yeah, it doesn't look like the evolution is working, Mary, in turning off the timer. So I'm going to show you, maybe we go in and ask. Yeah, so we're going to go to, oh my gosh, sorry. We're going to go to the VIP group. You entered it. Here it is. Everybody recognize that one? Do you recognize that? For those of you that have a device. So there's two, there's actually two. One is called Pain Free for Life Support Group. And that is in fact a group, that's where we all started, but then we had so many people that didn't own a device, didn't have understanding. So those that had a device, that's where the VIP comes in. And there is also a Pain Free for Life Support Group. There's still good information there. It's just that the teaching and training is a little bit different because many of those folks might own other devices, and so there was a lot of, well, you can't do that. And, well, hold on. We're talking about a specific device. Okay? Those are people, it's right here. VIP members, Pain Free for Life. And, yeah. And I can certainly invite anybody if we are Facebook friends, if you can't locate it. This one would be for those that already own. And it'll ask you something like, what's your email? Where's your pain? It doesn't matter where it is, just say back. And, you can say, Yvonne Ray invited me, and jump in. Yeah, it'll be pending. Okay. But there's a lot of great information here. And I would encourage you, if we go over to the search, I'm just going to write in, turn off sound, turn off timer. Let's just see if anybody's already, well, it's Canada apparently. Canadian Thanksgiving is this week. So that's why for them, the Black Friday is the first. Yeah.
Well, according to Google.
Mary, looking at Google.
Evolution, you have to open up the device and take out the little beeper.
Okay.
Avoid the warranty.
Yes.
Google.
According to Google, on the evolution, you'd have to open up the device and take out the little beeper, which would then void your warranty. In your books, you Avazia is in Texas. They got a great lady. Her name is Mo. She works front desk. I think it's Ben that's in the back. You could always call, is there any way around this? My apologies. I know it happens on this, and I thought we had worked it out on the evolution, but obviously not.
No problem. Thank you.
Yeah, thank you. Yeah. But I did want you to make sure that you guys were connected with some of the various communities. Oh, wow. We have somebody that was working on spider veins. This is Donna. She is the operations manager here. Everybody give Donna a round. Just for taking care of us. No, for taking care of us so well this weekend. Thank you. And her Achilles tendon is much better. Here, come right here.
I had an injury a long time ago. I was
Ask the question when they ask you.
Go ahead. They're not gone yet, but they were so bad that, but I think it was from an injury I did about 20 years ago that I hit my shin so hard that it was, my bone was bruised for probably almost a year. It was, if you touched it for that long. And then Gina is beautiful. Just worked on me, and the spider veins went down so much.
And to stand on your feet, how do you feel that?
And to stand on my feet, it's so much better.
Gina, what did you apply? What did you do?
First off, gave it a little bit of, sorry. What did I do to make her spider vein go away-ish? Be a little less visible to her. We started out with giving it a little love with the wand, and we kind of just, we did it at 77. Yeah, totally. We did it at 77. Give it a little love, gave both love. Then I put the pads on for a little while. So she's been doing some of her work here in the office. She can't just sit. So that's when these pads are really nice for you to stick on you, stick on, family member or whoever that's having an issue. Let them do about their day. Next thing you know, they come in, 20, 30 minutes later. How are you feeling? She goes, oh, I've been busy. So we did the other leg, because you always want to treat. We've gone over and over more times we can say, you want to treat the side, you also body mirrors itself, you want to treat the other side. Then I went ahead and I just took the unit itself, worked on the spider veins, worked a little bit on the Achilles tendon, a little bit on the bottom of the foot. Spent some time chatting, and then all of a sudden she felt good. I went to 77, and then when we switched over and she ran the pads, we did 77 for 15 to 20 minutes. Then we switched to the 350. That's the unit I used. And that was for the pain, the scarring. And then once we switched out of that, I did the Sanacycle blue stem. And just kind of finished up with that. And I think that's when we started seeing a lot more of the dissipation of the veins, and while you're talking and working on someone, it's nice to look down and go, oh, where did it go? Where did it go? So, and my new friend,
if you choose to use vessels fall between 11 and 13. So for those of you that have the evolution, what's your first setting?
11.
Yeah. Now it's a rotating algorithm, so it's not like you're on it constantly. It won't be quite as. But hey, give it some love with 712 and give it some time, obviously, and see if that doesn't impact what you're working on.
I just want to get her out of pain with the Achilles tendon, so she could go about doing the rest of work today. I actually had these, and what I did is I wrapped this around, so it went around the Achilles tendon, and then I went up back with the other one.
Come and do that.
Oh, sorry. I took the Achilles tendon and I wrapped it around and then I went up the back of the calf.
Here, put it on that one right there and I'll shift right there.
Oh, okay. So we just did
Go
this.
to the other side. Go to that side. Can you see that, Mary?
No, she's out of the picture now.
There.
You can stop screen sharing and then you can see.
Can you see her now?
You need to stop screen sharing.
Oh, she could. Okay. She can't.
I
You
see
can-
the screen.
Can you see Gina?
You're gonna.
Not on the big screen. I can see her on the small.
The
mini.
small one, okay. Anyway, she's placing some pads.
Yeah, I did see that. She
Okay.
was in the screen at that time.
All right.
Okay.
How long did it take in the number of sessions, would you say? I know she kind of was wearing it all day for some days. Did you hear that? Mhm. Sound is gone.
And the only reason why for these boxes, and some people will just draw this bottom line. So you could do this. Once you get better, you'll kind of have a placement. And how many grids am I going down? I believe it's 3. So there's 1, 2, 3.
Actually, there's 3 down, 3 down, 5 across.
Yeah, and so 1, 2, she doesn't have the same length. She's got the width, so now I'm gonna come, and then there's one more, 5, 6. You guys see what I'm doing?
Yeah.
I don't have to do that, because look, there it is. There, I'm just gonna follow that, come out, and then there's number 4, and then number 5, okay? And that's what you're doing. I mean, if you just did a bunch of lines, once you start to do this, we're just checking everything. We're exhausting. This is a hidden pain protocol. Okay, and then we'll do another. So you've got 1, 2, and 3.
So Mary's asking a question.
Yes.
Go ahead, Mary.
No, I think that was from before. I just asked if how long it took to do the spider vein protocol in terms of number of sessions or just length of time.
Can you give results totally?
I haven't seen it. I've heard that, and I think it depends upon the person, maybe the length of time. You can certainly regrow. Remember, those spider veins, if they're the capillaries, you can't rebuild the capillaries. The body, we need angiogenesis to grow new ones in place of. So
Explain that term.
angiogenesis, the ability to grow vessels. Yeah.
And can the microcurrent help that?
Oh, absolutely. Remember the guy with 70% vascular insufficiency? I should tell Danny to pick him up. And you guys, Mr. Happy Feet, yeah, he's on my Facebook. Give him a chance to meet him. What setting should I be on?
For the life cycle, 60 under assess.
Okay, so they're all gonna be 60, is that correct? Except Genesis? That is 60, yeah, that gets confusing. And then where am I starting?
You are starting with So it says in evaluation mode starting from 1. Take your initial reaction and record it.
And so that 1 is gonna be right next to the spine, but not on the spine, okay? And then I forgot to get the power level, so remember, you don't need to press. Let me know when you feel this. And I go for about 5 seconds. And release. Boosting. You already feeling better, Paul?
I'm not feeling anything.
Do you feel better from what you just did?
Yeah.
So that's inflammation relief. Anything?
I'm just now beginning to feel the tingle.
Yeah?
Yeah, but it's very faint.
Okay, and that's all we need, doesn't need much. So, I have a grid, did the grids get passed out this morning?
Yes.
Can somebody grab one, we'll get you a repeat, I just wanna show you how to use the grid. Is that you, Gary?
Sure.
All right, what's my power level? My power level is 140. And then let's take a look at this grid real quick. It's gonna show you when she said at the start. So, in the series, you start right on either side and then you go down, okay? And then in.
And does it matter if it's left or right?
If you mess it up, it doesn't matter. We are just looking for the highest numbers that you can figure out where is this hidden pain. Okay, ultimately.
Okay.
But it certainly can play a small part. So, I went to reactions. For those of you that with the evolution, you start your timer. And I'm not getting anything, probably because I'm right in her hairline. Are you feeling that, Adela?
Not really, was thanked before.
Now you are. So the initial reaction is 19.
So 19 there.
Yep.
Which is good, isn't it?
Does anybody remember the average numbers?
23.
Mid-20s.
So
What happened? Little low right now. Okay. And then I'm gonna go down to the next one. I got 26. So is that one or more higher? So I'm gonna go back and dose this one above. Tell me what it says. Is that what it tells me to do?
Take it to a dip. So go to 2 and take your initial reaction and compare it to 1. If 2 is higher by 1 or more, take it to a dose.
Yes.
If 1 is higher than 2, take it to a dose. Continue looking for one higher than the previous one. At number 12, take it to a default dose. Whatever default.
So we're at 30 seconds and there we go. We got the dose. Okay. And on that dose, make a slight dash, a slash, and then that's gonna be 39.
And is that number 2 or what?
Number 2.
39.
39. So, well, I did go back up for a quick second and I remember, no, that's higher, it's not. I want to dose at 19 anyway, because that's low, but we're gonna follow the procedure first. So we had 19 and then 26. 26 is higher than 19, so we'll dose in 26, and we're right at her C7. Okay, and then with the slash, that slash is your ongoing reaction, and what that told us was, it too started at 26, but it went to 39, a little bit of the workload. It took me 10 times before the electrical reached the brain. In a sense, what it's telling me.
So I'm listening with the time.
With the time,
That is
exactly, yeah. Okay, going to the next one, 23. Is that higher by 1 than the last one? What was the last one?
26.
All right, so what am I looking for? I'm looking for anything 27 or higher. Is that correct?
Yes.
Okay. So now I'm gonna go up to the other side of the cervical and remove a little bit of hair, so I can try to touch right at the skin. I got a 29. What was the number we were looking for?
27.
Okay, so I'll dose right here. And on my pinnacle, it does show that there's a double 10. Do you feel it? Okay. Oh, it's, so it might be in that hairline. You couldn't dose it. It went straight to 0. Now, if you did a different number here, you just treated. So what was the number I just got?
29.
So it's down to 28. So we're not gonna write 28, because it just got a treatment. I still need to dose it. So if you get a all green light before the blue.
Right. It didn't mean right.
Okay, there we go. Dose, get 39.
And this would be, this would write down in the window where it's like drops, right?
Yeah.
Okay.
And then with the slash.
So, and just an FYI, what did I say the block was? Did anybody happen to remember? 11, 11?
Yeah.
10, 10. It is now 611. The lower, this is your XY cofactor. So I'm gonna go down. So we just got the brain's connection. Something's going on right there, and the brain said, yeah. All right, I got a 30. What number were we looking for?
Anything 27 or higher.
All right. Well, and was 27, 29, I got
Oh,
29.
29 or 30.
So this is higher, 30 as I remember, or higher. So I will dose this. By chance, Adela, do you have anything that goes on with this side of it? I got a Z. Hang on,
Anything on this side, whether it's scapula, shoulder, arm, fingers,
like disability pain, that kind of thing.
well, something that maybe keeps coming back or that's just there.
Well, you worked on it before and Paul's worked on it and I've been working on it.
So it is this side?
So both sides.
Okay.
I've had problems, but today I don't seem to have any problems.
So it comes and goes.
Yeah.
All right, I got a D at 42. Anybody want to try to do this? Paul? So here I got 23. So I don't, yep, I don't need to do what? Don't need to dose, and then I got a low battery. I need, just grab the other pimple. Let me straighten that out real quick.
There's another pimple. Yeah.
So she was 23. We're just in the second row or the third row now?
We're starting third row.
So you're gonna come up right here. And we're looking for what number?
Anything up 30 or higher.
So you're looking for 30 higher, arrow right. There you go.
Give me the-
Thank you, left. And that's it. Soon as you touch, it's gonna go into reaction, right here, that box. Now, lift it off real quick and just. There you go. Tell me that number.
21.
And so we're looking for what or higher, Paul? 30.
We're looking for 30 or higher.
Yep, so you go down to the next box.
You need to put the power level, and just power level or not. Did you switch out?
Oh, thank you, yes, we did switch out, so let's power back up, she was at 140. Let us know when you feel this out.
Oh, no, so-
Feel anything?
Yeah.
I hear it. So I know that we're attached. And sometimes I'll just pull it out.
You can go up right-
That looks a little beat up. I
Yeah.
wonder if that's a,
You can go up.
let me know, feel this? Feel anything? Again?
Della, you awake?
Yeah.
No, my wife.
Can you feel it?
Tired.
I'm sorry, I didn't sleep. I felt like this, like a little bit.
Oh, yeah, I didn't see anything. Okay, so we're in this third and now that one.
We're at 22.
Mm-hmm.
22.
So now we'll go, so that was, we should have went down one more row, huh?
Well, it says it's just a 2.
Yes, okay, good, then we'll come right back up here.
Yes, 2.
23.
Nice, areas of resistance. It picks up.
Okay.
So watch it, because it's a fast number.
Okay.
So,
23 again.
and then go on the other side.
Well, one more.
Oh, we've got one more?
Yeah.
Okay, I didn't draw it, so we'll come, yep, right here.
So this is 23.
Mhm, yep, I know.
Still 23.
And so if you were doing this, you would just have the chart somewhere and you're writing them. Okay?
So,
And sometimes I just engage the patient, have the patient.
That's just 27.
Right, that's okay. It's- and
Right here.
then- yeah.
And 23.
Mhm.
and you're supposed to ghost that, right?
Mhm, correct, so stay put until we get D. And then tell me what your XY cofactor is.
Is that at 116?
That's 1516.
15, 16.
Yeah. So if they are equal, it means that they're equal and I can't do anything about it. Some call it a block. Okay?
He's at 15 now, it's 13, 14, it's toggling, that's pretty cool to see it toggle, isn't it?
Yeah.
You can literally see it trying to break through, he was back and forth at 13, 14, 16. Now he's going down to 12, 13, 12, 13. So,
We're at dose 0.
and then you dose 0, perfect.
Okay.
Mhm. All right, and then dose. Oops.
Dose.
And then what's our number on that, or do we have
He had 28.
a dose?
Oh, I'm sorry, yes, 30. Sorry. That's talking too much. Now you'll come to this side, and if you want to come around.
Absolutely.
So we did this side, so you'll start, you might have to part together a little bit.
Here.
Yep, check the numbers. Go ahead and give it to him.
So 19. Or change.
Well, I did just jump to 42, it's toggling, see how it's a Z?
Yeah.
So, who's got it? We're just gonna do a, she might be a little dry. And you just wanna be. I'm gonna mess those numbers up. You don't want it to be wet? Okay. And she's likely to be higher. No. Nope, she shouldn't budge. See what happens?
So I see 82.
Yeah. Not likely to be that. We saw that it was low like the other side of 19, but then it Z'd.
Yeah.
So we'll just give it a 19.
Okay.
But I would treat that. Yeah. When it goes that low, you want to come back and give it some love. Okay. Outside of pain.
Yeah.
Okay. What's the next number?
This is this one right here.
Yep.
So 29.
And what number? One or higher than the last? So what's our highest number so far?
On this side, or is this in general?
On this side.
There was 19 and 29.
Okay. So we're looking for 30 or higher?
Okay.
So she's at 29?
Yep.
All right, so you can go to the next one. You don't need to do anything.
Showing me 22.
Okay. That's not higher, so go ahead and go to the next one.
Which would you?
Right there.
Up here.
Yes. Right, see, that's the end point, there you go.
Take it out.
Mhm.
36.
You could teach a lesson on this.
So, are you gonna stay there or go? Should I stay? Should I?
No idea.
We're looking for anything higher than 30.
I think you're staying.
I'm staying, and then I'm staying, I'm dosing.
Just dosing, and then you'll give Gary the ongoing number of 63.
Where do you see that?
Right there, 65.
Oh, 65. Oh,
It's moving as the longer you stay,
Oh,
but it's right about the time that you dose. That's the one
I'm
you
gonna
dose.
have to get used to that. I'm gonna have to figure
So
out
that's
screen.
double in a pretty quick time.
63 and 5.
Well, it kept moving. It was 63 when it actually dosed.
So when we dose, we're looking for the letter D.
Correct.
You can go
D,
0, D, 0.
D, and then the C, and hopefully you should have a 0 here.
Mm-hmm.
That's interesting, every once in a while I have 1. I just kind of stay on.
And I think that's.
And it seems to clear if I just stay on.
It's a great free energy. I think you can that.
We're dosing the highest one, and then we'll come back and zero the highest on both sides. Now, could I dose several of these? It's called the, we'll finish, remind me of the 3x3. For any of you that are, look through us tonight.
So then we're going down one.
Did you go down one? Or you
No,
started?
I'm staying. Because it has said dose 0.
Yeah, well, we're not going to, we just dose.
Okay.
31. And this is how fast it could go.
Okay.
So now we're looking for something more 37, right?
20.
Okay.
Back up to the next one, 23. These are the numbers, 25, shift 25 areas. 22. 25. With a double 13. And 22. right.
more.
What? And one, that's right, I didn't draw enough. So one more, 23. And 23.
And you're dosing.
And then I'm dosing here, if you wanna hold Paul. Oh, it's Z, so you just lift up and put it back down. And you dose at the end, just giving it a little extra boost there. Go ahead, dose again. Try again, lift it up. Worst case scenario, this is your wife. It's your back, leaving a little saliva.
This keep staying here.
Yeah, we're looking for the dose, and it's, you can see the timer's going, so it's moving, it's working, so you got a connection, and now it's trying to get to the brain. Here you go. 25 seconds. A D at that number right there.
31.
31. We're dosing the end.
Okay.
Okay, now let's look at our grid, and I want to show Paul this. So you're gonna look at your grid, and based on these flashes, which one on the left side and the right side have the highest numbers? On this side, 42. What would you say over here? Yeah, so this one, the 63, we did add a little bit of gel, so I'm gonna actually select a second number as well. Because with the conductive gel, really does make it so it's kind of like a little cheat. So that phase, which number we're gonna go over. So I've got a 36, there's only one other area, so I'm gonna do 36. Which was that last one, which is larger than that. Okay, right. So for her, Paul, what would you choose on this side?
Can you get out of the way of the camera?
There you go.
Here.
Yeah, we're after the slash, your dose, which is your highest dose number.
Here.
42.
Right.
So where is that on the body?
So right here.
Right here. So 1, 2.
Yeah.
Right. So we'll dose 0 this one. And then stimulate it, and then we'll dose 0 a second one on that side. And we don't write down the numbers, we're just gonna dose 0. Want to tell us what it says, Linda? Yeah.
So look on this series, this is on the shoulders.
Yeah.
Look on this series for the highest dose. Take it to 0. How do you take it to 0?
You're gonna do Z? No, you just hold it until it goes. If you remember, the D is from the affected tissue to the brain picked up, I get a D. Ring, one ring. And then the D says you picked up, now the electrode is going back down to the tissue, that's zeroing it out. Yeah, you're gonna close that loop. So now, from my access point to the breaker box and then back, it's been cleared. I have electrical there. Or you won't. On your pinnacle, it'll tell you, you will or you won't. By that XY coefficient.
So that was a very good explanation. And I think the women really help.
So it does 0, I should say easy 0.
It means that, so if you remember when we look at the display, for those of you that have a pinnacle, I'm gonna pull this up while he finishes there. Give me a moment. Do you remember where I am? And we're taking a little extra time here. I hope this is okay, or you guys, we're good. Okay, all right.
Page 22, right?
If you look on page 22, you'll see your display.
Right there.
So you got the D, the Z, and there's the 0. So
I
you're
just
good.
don't see the D, but I see the Z.
It did.
All right.
Maybe. What is it? Tell us what it says.
We're looking at the initial reaction. So it's for the X and Y coefficients. That reveals 2 numbers.
and then it goes to D, which is equals dose, and then D equals 0. So readings are assessed in the following way. Readings under 25 are considered degenerative. We are, is this what you want me to do? We are normally only concerned with those below 20. Readings between 25 to 35 are considered normal, healthy tissue. Readings over 35 are considered inflammatory. The higher the number, the worse it is. This is a 1 in 6 initial reaction. To prepare the device to dose, set it to assess 60 Hz.
And then if you'll read, this book actually doesn't go into what I went into yesterday. Remember I was talking about that? So, you do have it in one of your slides, okay? Yeah, and so you just need to, here's the ongoing, the coefficients X, Y, and then the ongoing, and that's the information we talked about yesterday. All right. So what do we do next with this? What page are we on? 37. All right. What's our next step?
Forehead.
Forehead. All right. Now, I don't typically mark the forehead. But you can if you want. So when you have you turn around, okay, lay back. And you lay back. You're welcome to put a shirt on if you, we would need to get to the back again. You turn around and just.
So that was considered a treated area?
No. Right now, we're just exploring. Yeah, where is this, where's this hidden pain that keeps bringing my wife into discomfort? And then I gotta make dinner.
One question. When you talk about using the timer on the evolution,
Yes.
how do you compare that from an initial reaction?
Good question. You are gonna go from, you're gonna get the blue for dose. So those of you that have the evolution, you're gonna get the blue for dose. And so that's one time. So when you go to the next number and you dose, that's another time on your stopwatch. And for dose and zeroing, you get the blue and wait for all the green. So now you'll have the D, let's just say it's 37 seconds or 37, not seconds. Yes, you would be seconds. And you're gonna make a slash. And maybe that next number is 63. Okay, that would be the ongoing reaction for the dose, for the zero.
Okay.
Did that answer your question?
Yes, and then you do it for the next area, and then you compare or no?
Yep, you do. Now remember, you're only zeroing towards the end. We didn't zero until the end. We went and looked at those that we did dose. We looked at those high numbers.
Okay, and what's considered high? For the evolution?
Anything above the ones as you're moving through the tissue.
Okay.
And I know we have another appointment together, so let's dose zero together.
Okay.
With your device, okay?
Thank you.
You bet. All right, where are we? We're on the forehead. So just write down the center. It's literally 1, 2, 3. So all of you want to place your device there.
No, am I resetting anything here?
Yes, your power level. Thank you.
Okay.
So reset power level.
How do you do that?
Oh, no, this, you could have tension here, absolutely. I mean, how many times has a massage therapist said to me, man, you got so much tension, you know? Even, remember, sometimes that tension is scar tissue
And imagine if you with little wings can release that scar tissue and impact their tension headaches, their migraine headaches.
But too much.
No, that's about right.
So the book says 1, 2, 3 here, and then this shows 1, 2, 3 on this side, so,
What am I missing?
well, so is this 1, 2, 3, or is this?
So, yeah, you start with this, this is where you remember on the back, we start, on this one, we start with the client's side that there says, is hurting. When we go to the forehead, you're gonna compare, but you wanna, continue, so they do have it marked as on the right side, 1, 2, 3, and then you go back to the middle, 4, 5, 6. And what did I say, 1, 2, 3, I missed the 4, 5, 6.
No, well, but on the other side, right?
Yeah.
Right.
You're doing both sides either way, I'm not entirely clear why that is 4, 5, 6. So it doesn't matter which side we start with. I want to start on the same side typically, that we started with her, and that would have been the right side, so we'll start on the right side. So from the back, we start with the side that's more pain. Yes, and that was problematic. Yeah. Go ahead.
Alright.
And what'd you get?
At 20.
Okay, go to the next one.
Didn't change. At 20.
And she said, do you feel that at 92?
I feel that. That's fine.
So that's not higher or lower. So go ahead and go to the next one. 21 is 1 or more higher. So you'll, and it's the end, so you'll dose.
I'm dosing.
Okay, good.
Alright. So the D up here. No,
Yeah, then you're supposed to compare your zeros on the shoulder area and then the forehead.
So once you dose, you'll come this side.
so is that when the D appears? That's when it's considered a dose?
Yeah.
Okay. Little indentation mark. Alright, you're at 20. Ready? And that's 20. Yeah, I'm showing 20 right across all 3 spots.
Okay, dose that.
No, 19, whatever.
Yeah, you got 20 in the beginning, so just dose that.
So it says Z0.
But you did get your D, right?
No, I think I got a D.
Oh, okay, and then 0, I can see what happened, he kind of slid it down, didn't he?
Did I?
And so you use a fulcrum,
Oh.
just a finger like that, so that you stay stationary. 21.
Fulcrum.
What if they have a small forehead? And then you can't eyebrow on the hairline.
You try to do the best you can to separate the hair. No.
Yes. See, it wasn't easy, it's a no.
You had much water today, love? Do you put salt in there or electrolytes? You could be flushing out your minerals.
Well, that means,
You're not hydrated.
Or sometimes, remember, if it goes right through you like that, it's not actually entering the tissue. So that's where you get into, just add some little salts or minerals to your water. And you shouldn't be peeing, but you likely moved something yesterday, so that could be a factor.
And you want your urine to have color.
Yes.
Yeah,
Concentrating. Maybe not just too light.
But mine's a little clear sometimes. And I'm like, oops.
Really?
So you can see with hidden pain, you can take a little one.
Yeah.
We're dosing, right? Yes.
Yeah.
And what was our dose? 43?
It was.
And now if you want to flip back over when you do your adrenals.
That's it for the forehead.
That's it for the forehead.
And then now
we do that. Yeah, so what you do is you compare the two doses. When you're at home, it's okay. I might go ahead and dose both because adrenals could use a little love. Ideally, you want to, these numbers will reveal, oh my gosh, the forehead really has the biggest problem. So it won't harm her if I'll find the numbers first. Well, let's just say they're pretty high, but not as high as the forehead. What number are we looking for? What dose are we looking for?
No idea.
It's.
Okay. So 43.
Yeah.
And I'm sorry, and then what you do is make a zero. So somewhere we'll make a zero, and then you know, boom, boom, 3 numbers.
And then I did get that else, and then the product.
So one way to find an approximate of where the adrenals are is you look at the rib cage. Right about here.
So you're on top of the rib cage or right below?
I'm looking for the bottom of the rib cage. I'm sorry, it's shoulder blade. I'm sorry. Adrenals are underneath the rib cage. Whoops, okay.
And then it's shoulder blade.
Here it is, our shoulder blade is right here. Am I right, this is your shoulder blade down? Okay,
Elbow back.
That's what I am.
Arm back.
Yeah, one might be a little bit underneath.
Or arm back, so the shoulder blade pops out.
Oh, there we go, you keep that. I forget about that one.
Just relax, relax. They're right there.
Okay, this is my other one.
Just relax your arm.
Now, one will be, and I think it's the right side is slightly lower.
Yeah, one of them is slightly lower than the other.
Yeah, so which, look at this. These are pretty close, I actually marked it here, he felt it with it back. So, and then from there, what does it say? 2 or 3 fingers? Can somebody read?
Well, I'm trying to find that. That doesn't really say.
Sorry, look on the chart.
Oh, okay, center, shoulders, 2 inches down.
Oh, it's not using fingers, it used to use fingers. So. Are you on the adrenals?
Well, that sounds a little.
Maybe 2 of yours, 3 are not. So it's approximately, what is it, 2 inches? Here you go. And then so you'll get the initial reaction, this is the initial reaction, this one. And then you'll dose the highest. And we'll see what it is.
No, that's it first, my back.
Can you see what's going on, Mary?
Go back.
Okay.
Yes. Thank you. Yes.
You might want to get better contact with the one.
That's like right on.
Okay. Yeah, now I'm feeling
She's at level 228. Okay, so I got.
Now you're gonna touch and get your initial reaction and give that to Gary.
Gary's 30.
That's the left side of that.
Yep. The right side is 22.
it.
The 31. Is that better?
It's jumping.
Yeah.
If we take that 22. It's still not quite, it just was 30, right? Just 30.
Yeah.
It's still low, so you're gonna take the one that's higher and take that to a dose. And if you're at home, take both of them to a dose. Take both to a dose 0. Our bodies haven't had this much love in a while. It will not negate, you're just gonna take these numbers and compare. So what was this one? Oh, we're waiting for the dose. So in a minute, as soon as he gets the dose, we're gonna compare the adrenal dose to the forehead dose. And then we'll actually dose 0, the highest of those two. Okay?
That's a 39.
And it's 38.
38.
So what was it on the front side, Gary?
43.
So you'll dose 0 to the front for now, especially since we're losing our time.
Yeah.
But if you're at home, you can take both to a dose 0. Again,
Okay.
easier for your client, but you can do these for yourself. How do you results yourself? I've done it, just hold, yeah, and you get close.
You'll get a long one.
Go ahead and have you train.
I had foot problems in the past and back problems, so I've used the dowels.
Oh, she's made things, yeah.
One. And you have a long stick. So there's not.
Well, I think the calcium, this third,
The front,
yeah,
forehead.
yeah, 1, 2, 3.
On the side.
Correct.
I'm dosing or zeroing?
Dose 0. She's good, test it. Now, I'm gonna present something to you guys, and I'll let you kind of run the schedule. So, we spent a little more time on this one. So that means we missed the abdominal and the using or understanding of PEMF devices. If you'd like, maybe we can do a working lunch. Everybody grab their lunch, we can get here, or do you need a break? You guys decide and let me know.
I shoot for break at least 30 minutes.
Okay, how's that?
At least 30-minute break.
Perfect. Did it go DZ or just Z? Yep, put it back on. It's not finding
A connection? You've got a little bit of this if we need to.
Coughing on patient.
So Mary, we have missed a little bit, so we're actually gonna do a partial break for 30 minutes and then come back.
Perfect.
We'll jump into what we missed, which was NSTEM and information about PMF. We may not have, we may not have time for animal discussion.
Okay.
Well, you're 15 minutes ahead, so if we do between 12 to 12:30 break, we'll catch up on time.
Oh, so we're gonna take break right after this, so 12 to 12:30.
Yeah.
As soon as we dose zero, we'll be, what?
Perfect.
She's just a time keeper. I've known her for 50 years. She's a director.
Yeah.
The 4-3.
Oh, really?
Yeah, so they're not equal.
Oh.
You really want, this is your X, you want X to be lower. And how do we release the patient? Ideally, when it's 4 or lower. So she's locked there. She gets with my client, I would say, we'll check you in 4 days. Did it open up? Did you feel another thing to hurt? Getting too high? Yeah, so things were opening up, and you were just showing a lot. It was unequal. You were 4-3. So if you were my client, I'd have to come back in about 4 days.
And then what?
Yeah.
Let me just finish. Real quick, I just do want to say, so she dose zeroed, on the forehead. And it still showed with the pinnacle that it was a 4-3 or XY cofactors. And that technically is considered unequal or a block. So if she were my client, I'd have her come back in maybe 3 or 4 days. It could be next week. And we would check that again, let the body process what just occurred. And we may need to, we'll check and see, is it still blocked? Ideally, on that XY cofactor, when you are 4 or less of the X is 4 or less of the Y, I feel I'm comfortable to release my client. This is as good as I can get the tissue, because the body will take and open things up. All right? Did we miss anything? That was a lot. It felt good. She's ready to go. She's ready to learn. Well, and look what we did with her adrenals. Right? Everybody give a power pose.
We're doing 12:30.
We're doing 12:05 to 12:35. Going. Or you're welcome to bring your lunch back, but we'll get started at Pacific time, 12:35. Thank you.
Recording stopped.
Did you see Paul?
I haven't seen him.
Yeah,
No.
he's perfect.
She's on a mission.
I know. Yeah. Between me and Kathy, we'll get you some.
Absolutely. And also Michelle said that there's.
She is? Oh, good. Yes, yeah. Oh, yeah. And anybody in the area, if you want,
Whatever,
you wanna put it on the next up there?
but.
Sure. Oh, I got a couple of little facts I didn't have. Oh, no. Did this drop?
Furthest place in
Oh my God. I think I know. Oh.
I didn't realize that this was even there, so it's my fault.
I thought
What else is it?
Okay.
It's funny.
It's funny, I thought I actually gave you the mouse back last night.
This one. You need anything else?
No,
You missed all the fun.
No, I heard. That's good, but you guys are fun.
Adele's adrenals got a little love.
They got-
She liked it. She didn't sleep well last night, so we did a protocol on everybody, and it could potentially be that. She was up just releasing stuff all night long.
Yeah, I know you.
So. Going back, sticking around. Hope you get a 5 and then you get a 4.
So. I brought a priority mail box. For you to put that for stuff coming in, so we'll give you that.
Is it somebody give you?
You want, so you want to take it home?
Yeah, well, that way it's out of here.
Okay.
Okay.
Is that a deal?
Yeah.
All of this. So.
Although, you bring me, I'll take it because there's really, I don't want to show. We'll present it to
Might
you.
not be. So I think you can fold them flat. Oh, so when you.
Oh, okay. We have a short break today, so.
You need to eat. You need to get pee, and then you need to have something to drink. Anybody else? This weekend.
Okay, time. In 7 minutes through.
That? What time are you at? Oh, yeah, I forgot. All right, you may go potty. Oh, thank you. You may release the Kraken.
You were neighbors for years, right? We did long. So you guys, right after I had the daughter. And then you started this. Shortly after we moved over from one house to another, then husband was just a construction. That was supposed to. And then we have voices in Canadian and our girls. And then that's all they want to think, but it's. They still friends. Oh, I still don't know. And at the same time, mom's got held along. And then out. Right? And I don't think. I think the difference between and I actually think
Hello. That's not possible. I heard the girl. Especially on this kind of market. My feelings are so hard.
But you know, I wasn't allowed to dress my spirit. So I said, I can't have somebody to dress my. This is my the animal cookie. My favorite one. This is me. I think I can microdose myself enough today. Right? Don't be surprised the next 2 or 3 days. My husband messaged me and raised his head. What did you do to them? I was just laying around and watch football. We all know they took a picture, right? And then I said, "Did you have something? Did you take a bath?" She took no. I said, so they responded after the little class will go. So he I said, okay. Get work till Wednesday. Probably Monday, Tuesday, I'll be, about that. But you want to 20-minute window again. 20 minutes, you know, what you're trying to reabsorb everything. Okay, so set your timer. So 20 minutes, maybe 2 cups of it, that's something you want to do. But how big your bathtub? It's a queen size. It's a massive bedroom. It's a queen size tub. So is it 2-person tub? Base as well.
I add a little more, or just don't fill it so full.
But I
Like I do more of a sits bath when I'm sometimes. I want to get warm, but I also want more than just my feet in.
I like 2 cups, but you can add more. Because if you're putting that much water in,
Recording in progress.
What do you do?
Whatever you need to do. Yeah. I hope you're around for the end stem. What time are you leaving? Oh, okay. So we are presenting the certification, so we'll give you yours. If you want
No, usually.
So we don't ever have for pain, right? We never have. Because we already know if you were lopsided, so we crack up a little bit, but we can.
All right. All right. How many of you have a hairbrush? Pull out your hairbrush. It's time for a beauty session. And let me know if anybody has So we're pulling out our hairbrush. And while you're at it, go ahead and you're gonna, without plugging it in, pull it through and pull out any knots. It'll come with a pinnacle ore, and you can always. It doesn't typically come. It doesn't come with this. Doesn't come with hers because the settings, unless you want it for your pet. So otherwise, it's not a. It is still a standalone. All of these are standalone tools. You just want to know, do I have a setting to use that tool for? Yeah. And I haven't seen the new one yet, so, let's talk about, because they are making a simpler version, but if it can't do a few things, I may say, what do you want to do with your device? Because this is what you. Well, it won't be the attachment, it'll be the device. Yeah. No, the Evolution does. And you can use a hairbrush on 712, like on your pet. But it's not something you're going to use. I guess you could run 712 across. It wouldn't hurt.
Where do you run 712? That's the lowest setting that we have.
That's safe for the brain. That's
For the
safe.
animal.
Right?
Yeah, I'm sorry. We got two things going on. I'm trying to get myself ready. And do I have a device somewhere? So you have it. Who has the other pinnacle, and who has evolution number 3? What is it? Okay, do you know where the other one of this is? The battery went dead. Look inside your seat. If you could help there.
You guys got batteries?
Look on your seat, Gina. Is it on your seat? Okay.
I did that a while ago too.
Maybe Adele, since they were looking for stuff.
Which no,
That's
solution.
Somebody renting policy of an old right now.
Oh, you don't want to use it? Oh. I thought you were gonna use it.
Then have all use it.
Exactly.
Okay, listen up. Somebody look up NSTEM and somebody look up PONS, PONES, please. All right, we're starting on 52 with the hairbrush. We do. We have a timetable to meet, and I want everybody to try this, or at least feel comfortable. So, with the NSTEM, there is several scientists that have shown and documented how these electrodes can help increase this one's low too. Do I have two low ones? Help increase for brain health. The frequency that we're going to be using today will be 60 hertz. Set your device to, excuse me, sorry, not 60. It needs to be below 60. So 3245 is gamma. And if you have the, which one do you have? Yeah, yep, number 2, it's a second setting on number 2 gamma. Remember on Friday, we did go over some of these brain waves, and gamma has shown and well documented showing how much it can help with PTSD, depression, anxiety, and even people that have a little bit of psychotic schizophrenia. There have been evidence to show that these e-stem devices provide help. Okay, using a microcurrent, again, may not help but won't hurt. And I want you to actually visualize, if I can, get some additional flow through the brain, both electrically as well as blood flow, that right there, has the potential to improve symptoms, right? So that's what we're looking for. I'm going to just talk it through, power up, put it on the head, and you'll see it's got a slight curve. And if you take a look at the picture on page 52, it kind of looks like a watermelon. When I do this, I'm going to show you, I'm actually going to hold my brush down, because when you start pulling through, you might end up like this, and now I only have about 3 or 4 rows of the teeth rather than all of them. Okay, and maybe, Gary, you're going to do this. Maybe I could use Linda. Yeah. Margaret, can I use you? She's got super short hair. She can't mess it up. Could I use you or Paul? All right. Go ahead and have a seat right here. And then you're going to face forward. Yeah. And Linda, if you'll read towards the bottom, according to the Journal of Neuropathy, this technique can help with following results. Can you read that? Yeah. Here, got it. And then, do you mind, so they can hear too? Go up the front? Yeah. Yes. Yep. So power up until you can feel it like you do a wand. Now, don't worry, in this picture, you're going to see there's several numbers on the head. This picture has been updated, and it's pretty much just, looking like a watermelon. There are 7, right here, and then just read for us. There are 7 lines. We're going to go past it. We're going to go through. The center being number 1, and then we'll go to the left, 2, 3, and then just other sides, 4, 5, with just above the ear being 6 and 7. Each time you do a pass, you hold from 10 to 30 seconds on the forehead, bring it back, and feel and find the base of your skull. And you're going to stop right there for 10 to 30 seconds. And much like when we were doing the passes on Pyrgos, you're not going super fast, you're going a little bit more slowly, you're not necessarily stopping anywhere. He's got 1 to 2 centimeters per second. Okay?
I'm gonna just step back. I'm gonna this is how to speak back a little bit, just so they can get, so Mary can see what's happening. Just back this.
Yeah, I see. Thank you.
Okay, I just need to check something.
Okay.
Now you get me.
He's too far back now.
Okay, yes. This is.
Perfect.
Ready? So should I start reading? Okay, according to the Journal of Neurotherapy, the lens technique may have the following results: a decrease in feelings of anxiety, panic, depression, and PTS symptoms. A decrease in sleep problems such as restless leg syndrome. A relief from cloudy, foggy thinking from ADD, ADHD, or traumatic brain injury. A reduction in addictive behavior. Pronounced improvement for those with autism. The average number of sessions was between 15 and 20. And it was not rare to see chronic situations start to resolve after only 10 sessions. That's to think.
Can you read that one more time? Can you read that one more time?
Okay, the whole thing. So, according to the Journal of Neurotherapy, the lens technique may have the following results. 1. A decrease in feelings of anxiety, panic, depression, and PTSD symptoms. 2. A decrease in sleep problems such as restless leg syndrome. 3. Relief from cloudy, foggy thinking from ADD, ADHD, or traumatic brain injury. 4. A reduction in addictive behavior. And 5. Pronounced improvement for those with autism. And they say usual number of sessions was 15 to 20, but could be resolved as soon as 10.
Yes, yeah, treat once a day. But you can treat yourself. I mean, I have had, that is a little too high.
No.
So as I pass, you start and end at the exact same points. You'll see like I came to the side and then I come back to the center and back. Okay, so the points are the same there. You can certainly, yes, you treat every day. Ideally, you don't want to treat more than once a day. You don't have to have these symptoms to not treat. I've done this and you'll find that, give it a week's time, sometimes sooner, better clarity, better focus. Again, if all we look at is the idea that we are restoring any lost electrical, increasing blood flow, those two things right there, can you find an improvement?
Sure.
So I'm just barely coming to the side, and usually, sorry, but that. Did you see my brush lift up? So I just kind of hold the side when I'm doing it, so that I get as much contact as possible. I'm no longer coming straight down his head. And then I'm around 2, and I'll hold 10 to 30 seconds. Now, the longer or the more I've done this, already I've had to decrease the power form. Has anybody else had to decrease your power? Started to get stronger? You did, So, looking at this way, Paul? No, way. Yeah.
So each time you started,
Each time you started forehead, you ended at the cranium, hold for 10 to 30, go a little bit slower. Yeah. And so I'm just going to show for the camera. So I've done the center, I've done the side, do both sides, and now I'm going to come just above, and then I will come just above the ear. 1, 2, 3.
So we switch sides.
Switch sides. I'm just showing this for the camera. 10 to 30 seconds, and I know mine might be a little bit short. but I'm actually like try to gently come. And then a little bit more like right here. Are you feeling the sensation fall?
I can feel the metal and I don't feel the electricity. I feel electricity here.
Yeah.
I don't feel it on my scale.
In places which it's not a difference, we're not actually changing the brain waves. We're working on the electrical of the brain, whereas the clips do not work on the electrical. Okay? Maybe I should state, they're not working on the electrical in the same way. They can both elicit a similar or same response. This is a one time with the ear clips, you wear longer. And you're also, remember, you're going from one side to the other, not. We are doing this, so. It's just different, the application thing. I have pressure.
Wait. This really comes through this way. There's a lot of pressure on the scalp.
Was I pressing too hard?
Yes.
Oh, I'm so sorry. Oh, yeah. You can use the microcurrent on the visualizers. Many people get the resolution or some relief. Yes. We have not been taught to use it in that way. The only time that I've been taught to use that is when you are using a PEMF model. And then of course you're gonna.
So you just do one rotation and then you're done?
Yes, so this might take 3 minutes. Once you kind of get it down.
Back up to the center?
Always to the front and to the. I go to the center, yeah. So now we try to. And then we'll go right on top of the ear and then brushing it back.
This is the last one.
This is the last one on this side. I'm just making sure that I have the brush down, because you see it or feel it a little off.
Yeah, there's no error here, so if you come past this point, it's like. And then once you're in there.
Feel it out here.
Yeah.
This is even on top here.
Yeah. You can see, I can feel the electricity there.
Did you just do like Hache This? Did you just that little spot? Or did you need to do the whole thing?
Well, the way I see it, I want to pull that electrical, to the front and end point.
It's just, okay. You're doing my it's not, but those are pretty hard roasters.
They are steel.
Yeah, oh yeah. You can feel it. That's
Use next to the sink.
You want to be next? Who wants to be next? Gary, did you notice anything?
I maybe need a little higher at times.
Did you feel any change? And some people will, some people won't, but keep doing that. Yeah, but imagine, if we could again, just even if all we did was restore some lost electrical at our age, we will have had some for one reason or another. One time I was trying to, I had to break my window at home and I was trying to crawl in and I got in the house. Yeah, so, I had to treat that scar and I did use this right there. And then you want to bring it down with it. Michelle? You want to try this?
How do you wash
That's
your
your-
hair from person to person?
So first of all, we use alcohol wipes, and remember, this is actually being sterilized via the electrical.
These kill germs. Okay. So you can use it on residential.
Yeah. I use alcohol wipes. You don't want to dip anything because you'll ruin it. There's little. Correct. Yeah. Yeah, you don't want to spray. You don't want anything falling into those. How's that feel? You feel it. It's coming alive. It's coming alive. And so again, we're just gonna go straight back. And usually I neglect to do this, but I'll brush the client's hair so that I'm not yanking through anything. Oh, okay. So again, there's 7. The next thing that we're going to do, I'm going to actually turn this over to Michelle and let her do. So this is number 2. The next one, we're going to look at the ponds. And there is a book by Dr. Norman Deutsch. DOIDGE. DOIDGE. So we'll do 1, 2, 3, 4, 5, 6, 7. Okay. So you can look up neurostimulation, and if you're interested and get more information about how this could be beneficial for your family, Michelle, tuck that in your pocket and hold this down. So did you see what she was doing? So now she might have 2 or 3 palms. So you hold it down, just the end. There you go. So you know you're getting more surface as you come around. Okay, that just provides for a better treatment.
That's about neurostimulation.
Yeah, that's about the ponds. But I did want to mention for those of you that are interested in more information about neurostimulation, this is called, we call it NSTEM, neurostimulation. And there are a number of different ways that they can do this. And you can look up more than what we just read, how much more this can be effective for people. Okay. For now, we're going to move into, if nobody has any questions for this, and I know I'm moving swiftly. Yeah, so there's a book by Dr. Norman Deutsch, DOIDGE, and he shows us through that book that we can affect the pons, which is in the back of the brain, and that is page right on the next page, 53. And you can take a look. So the pons deals with balance, mobility. Yeah.
vertigo, even extreme nausea, Bell's palsy, other health challenges that include mobility. These, recent reports of the cranial nerve stimulation have been noted by him. It's been a while. It's not like it's brand spanking new. I don't recollect exactly when, but do you remember we talked about where my nerve chart is? We have 12 pairs of cranial nerves. Yeah. So they again come from the brain and then they travel down that foramen and then they extend to the body. The nerves here in the brain, including the facial nerves, these are for sight, smell, sound, right? Also, towards the back, there's balance, proprioception, hearing, swallowing. As a, athlete, that proprioception is really important to people that they have that, where the line of sight and the body are in line. Using both the scalar and or this next one, we can help impact that. So I'm just going to read this. Scientists have long understood that electrical stimulation to the cranial nerves can bring brain cell electricity activity back into balance. Remember what I said? Lost electrical? Even if you don't have any of these. We are aging, right? This correction is due to a phenomenon called neuroplasticity. Everybody knows that word? Yeah, good. Neuroplasticity is the brain's ability to adjust and restructure itself at any stage of life. Our brains are designed to form new neural connections and optimize neural pathways to adapt to new situations. These new connections can then counteract damage and injury, allowing us to move on from pain. Under the right conditions, your brain can, the bottom line, your brain can heal itself. Yeah. So for Dr. Hache, he talks about in our clinics, we see patients active, achieve relief of years of chronic pain, and others who have recovered the ability to not just walk or talk, but to live fully despite debilitating strokes. Additionally, cases of long-standing brain injuries have been cured or vastly improved. Balance problems, dizziness, disorientation, whether these were accidents or negative reactions to antibiotics or medications, such as those using chemotherapy. Microcurrent stimulation through the tongue has provided a way of connection. We have also met children on the autistic spectrum with learning disorders, attention deficits, who have used neuroplasticity techniques to achieve normal lives, and sufferers who have seen symptoms of multiple sclerosis, Parkinson's, cerebral palsy radically diminished. We are bolstered by the ability to reduce the risk of dementia and improve brain performance with this simple approach that anyone can use. So what Norman Deutsch showed us was through the pons on our tongue, we can access the pons area just below the cerebellum. So if you have a tongue depressor with your kit, go ahead and pull it out, and you're going to need your 2-lead wire. With your hairbrush, it was a single lead wire. And if you have a pinnacle, you're going to use 200 hertz. If you have an evolution, you're going to use 121. And I do have an extra pinnacle if somebody wanted to use that for the 200. That is the prescribed hertz. as founded by Norman Deutsch
and his. We're putting brush away. That was for the end stem. I would just let you know we will need to change these. We want somebody it'll be 200 towards the very bottom. But I do have one because I'd like to let somebody else. Okay, perfect. Would anybody like to try this that doesn't have a tongue depressor? Okay. And do you have a 2 lead? Michelle, what do you have? Okay. Yes, somewhere.
You need to sell.
When we just did the end stem, yeah, it's 32.1. If you didn't have it, but you only had 712, that could be an option why you might use a brush.
Okay, it should be, say that as the below 60 hertz with the
So we're gonna use the, can you see this, the tongue depressor? Do you have a tongue depressor? Okay. And you wanna make sure that when you put in your lead wires that they stay in. On occasion, this one happens to be a loose one, because see how that happens? It can fall off, and then you're walking around for 20 minutes. So I'm gonna have captive audience, I'm gonna put this in your mouth, and I'm gonna talk for 20 minutes. No. We're actually gonna get up, we're gonna walk around. If anybody has any challenges with their hands, grab something that you can be squeezing, whether it's something as, just a towel, okay? So here's what I want you to be thinking about. We're all gonna do this, but I want you to be thinking forward about your family member, your patient. We just read several things that we can impact. I'm gonna tell you a couple stories that happened with my clients, and what happened in my clinic. I'm gonna tell you two. The first one had a stroke 12 years earlier. He came in, he had drop foot for 12 years. And he just wanted to be able to go take a walk with his wife again without falling, because if he'd fallen, she couldn't get him up. So for 12 years, they stopped taking a walk. He came in the first day, and it was actually one of our community events. You might have been there, and you know who this is. Yes. Okay. So the very first thing that we did in the protocol was show this, and he walked around for 20 minutes with this in his mouth. When he was done, we brought him back up to the front. He told his story, and now he's going to tell any changes or what he noticed, And immediately, all the other practitioners, one was a speech therapist, noticed his cadence had changed. It had improved. He was talking more clear, more smoothly. Over the next 4 months I worked with him, I had a list of over 18 changes that occurred with him. One of them being, he's been driving since this occurred, and very bright, sharp man, mid-60s. He told me afterwards his speed of thought had improved. And I said, how so? How are you measuring that? He says, well, I've been driving, and as I approach a stop or a sign or a car, I would have to tell my foot to move over. And he said 30 seconds prior to the need. He said it's almost instantaneous. Almost. I was like, Eddie, you're driving? He should not be driving. However, some other, obviously, the improvement that he came for, which was, to not be falling. That did not take as long, and it was approximately, so I think he came maybe approximately 3 to 4 months. But he stopped, falling. He did still have a little bit of a drag when we stopped working together. But I'll have to share that list with you guys of so many other little things restoring independence. And I'm sure it was a combination, but the one thing I want to tell you, when that she said by stimulating the tongue. Well, ultimately over those weeks, we did several things, including getting his alignment correct. We used the brain, the end stem that you just did every day, or had him do it every day, or as often as we could. A couple times he rented a device, a couple times he just came in. Okay. But there's several things that you can do. I had another gal, I may have shared this the other day. These are some of the steps we used with her. She was hit by a garbage truck 41 years ago out on Greenback. Came to me, had the drop foot, wanted to go with Bayside to Mexicali, but didn't want to be the center of attention. She would fall 8 to 10 times every day, and her hands never came out to catch her. So she'd fall. And how many, what do you think? That's a lot of injuries. Several things happened with her. Ultimately, the drop foot, the use of hands. She said to me one time, she said, Yvonne, I went to go fall today. And I'm like, oh darn, right? I'm thinking, she goes, and I had a glass of water in my hand, and my hand went out, set the water down, and she fell against the chair. Her hands came out. She was able to control something that she couldn't do before. Correct. Yeah, she was 40. She was not a stroke. She was a TBI. She was actually hit twice by the same truck. He didn't know he hit her. Threw her 40, 60 feet, ran over her, dragging her. He got out. He thought he had a flat tire. Found out he was inebriated. She was crossing the street to go catch the bus on her way to school. Yeah, and now there is a procedure. It's considered advanced procedure. So if you ever need it, please call me, because technically I'm not saying it's on here, but we do treat scar. Let me just teach you how to do it. Okay, it is considered advanced, so I've got to be. Yeah, and so we do that. But even for Eddie, we didn't. This is just the first thing we started with. Partly because of timing, and we do these community events where you can bring in family people, and we line up 3 at a time, and we let our interns work on them. It's basically, $25, and they get a treatment, and the interns get the experience, and it's a win-win, right? So back to Norman Deutsch, accessing the cranial nerves through the pons by stimulating. we can increase those neuroreceptors. And I will add, there are a couple amino acids that when I started adding them, because I didn't get my certification for amino acids for a couple years later. Wow. Again, another nutrient being added to this. We were seeing even faster results. And remember, the amino acids can help rebuild those neurotransmitters. This can definitely help with resolution, but it will be based on their intake of supplementation. And these are, proteins for the brain. So, taking your Flex Y1, tongue depressor. Again, 121, if you have an evolution, select that, and your power level, do not power up. It's going to be somewhere between 2 and maybe 19. It's really subtle. You don't want to be right here on the front of the tongue, and it's not smack dab in the middle. It is about a third back. Okay? And also, stick your tongue out. I'm just going to go through this. I'm going to stick your tongue out, and you don't want it too close or too wide. So you'll be like looking in a mirror if you need to, and trying to find that where I can help place it. Place that down. Power up, and then power up. Okay.
This is where you're going to go to the cells.
I got the 25 on that one.
So I think over 100
It is. Anything over 100 includes inflammatory. Remember, everything vibrates at its own frequency. But we do know that things over 100 in our devices have an anti-inflammatory component. Does that help? Understand? How many of us have, systemic inflammation? But it is about the cranial nerves. Yeah. Okay. So if you can, at one, well, maybe you can do for a little bit and take off. Okay. Yeah, so oversensitive skin, what does that tell us? So remember on the tissue, the rest of the tissue is affected. The tissue is affected. Try 121. Nope, it'll just be a straight 121. Go arrow up and see if that doesn't give you a different sensation to begin working with. Got yours? What are you on? Okay. Yeah, good.
So I have a question because I have some friends. I remember when I was in my plan, somewhere around my days, I was more sensitive to the flow. So is it possible that we could have something that would be more sensitive to that?
So that's always possible, especially depending upon how long the crown's been there, how the tissue itself, I mean, that's why it is a flexible, this is plastic Y, so you're certainly not going to use anything like this. And obviously that makes sense. I've got some bridge work I personally haven't had, but it's not that it can't happen. But I'm hoping with her sensitivity, and it's not on the tip of the tongue. I need you to go 1/3 back. You feeling it? Hurts or it just feels weird? There you go. You're a little further back. There you go. And you don't need to power up. If you are feeling it one, just stay at one. Now, ultimately, you should be able to close your mouth like Gary. You still want it to stay on the tongue. Now, if you're, you guys keep it in your mouth, if your client, your patient has a stroke, and let's say there's an issue with the hands, give them a ball. I have in my office, I've got a couple of little brain squeezy things. You want to give them something that is part of the symptom relief. If it's about reading, have them read. They can be listening, walking. If it's a stroke, there are some steps that you can look up, but besides just forward walking, backwards walking for stroke, side, crossover, you can help increase what they can do. There's all kinds of these things you can do to look up. I love, these are the kind of things I really like working with. And I sometimes feel like that's why I'm always looking for other microcurrents that have at least, therapists that have at least their basic, because you guys can take care of the pain. You might not be interested. There were like 9 of us at the clinic at one time, and nobody wanted to do what I was doing. I was like, come on. I wasn't afraid. I was very excited. We've got one that she strictly came in. She was a respiratory therapist, and that's what she's doing. Another one, wound specialist. We actually met. I was working on her client, and about third week in, she asked her client, "What else are you doing?" She said, "Oh, I got this gal coming over, and she's doing, microcurrent on me." She said, "I'd like to meet her." So we met. And ultimately, she went through the course. She's got her own clients. You're good. And I asked her, I said, "So how long would you be working on this wound?" She said, "This is a 3-year wound." And you guys probably saw it in the book. We closed that up in 10 weeks. They were going to amputate. They were going to amputate, and somebody said, "You should, go see if Yvonne can do anything." And
with the tongue depressing, you're thinking, are you using the stroke victims?
Well, it depends on what they come to you for. We have one that's recently come in, and right now, if she could just, she's in a wheelchair. Yes, they want her to walk, but if we can get her arms up and over her head, what happened? Oh, she's busy. Oh, for the first time, right here in this room, she started lifting her foot, which your daughter said she hasn't done since the stroke. She just, her foot started to be able to, was it the foot or the leg? It was the foot, yeah.
And then as she straightened her leg.
Oh, she straightened her leg, so her leg had been spazzed inward. Yeah, so by the time she left, it was straightened and she was able to do this. So we'll continue treatment, I think, later on this week with our second session. And we did a little bit of these two things that we just did right now. And then we worked directly on the foot, a little bit like what Gina was doing for Donna. You want to work, this was the causation, this is the result, and bring it to work the two and bring it together so for faster results. Because we don't know what we're working here. I don't know how long it'll take to reach the hand or to reach the foot. So I put it directly to both. Okay? Any questions? I know several of you still have a, what's that? 3 years ago. So Michelle B fills it down in her foot when she has this in her mouth. And you're on which setting?
I was on.
Sunlight 200. She was on 200 for 20 minutes. So again, depending on the symptom relief that you're looking for, besides just general rebuild, right? Electrical and blood flow.
So just by doing what she's learning, sitting here, is this for general, like blood flow, that thing?
it can increase from the tongue if we take a look at page 52, and there's actually other pictures online, and you'll see directly where the connection is. We do this also for people that have had loss of taste, loss of smell, loss of saliva glands, or those little ducts get clogged in some way. And this has been something that just made impact. We've had the tongue alone assist with nasal. Remember, because this actually impacts sight, smell, taste. She's talking about having a Thanksgiving dinner and inviting the guy that lost his taste. Well, the last several years, we've always had a Friendsgiving, and with all the other microcurrent therapists. So if that's something we want to do, I think we may have mentioned the Christmas party on one of the schedules. We have two schedules that went out. I'll try to make sure you see that last bit. But we'd love for you to be able to join us, especially for the Christmas exchange. It's a blast. We don't do white elephant because we all have enough stuff we don't need. But you can re-gift. You can re-gift something beautiful, something that you know, hey, somebody may want this. It's just not my color, whatever. So it is a tasteful gift, okay? We have a lot of fun, and there's usually a lot of stealing. So that'll be sometime in maybe around the second week of December. We don't get too close to your holidays. How are you guys doing? We got a couple more that are finished. So it's 20 minutes or as long as the client can handle. You work your way up, and oftentimes, especially with stroke, there'll be additional saliva, so you give them a napkin. Okay. But even like with you, if you're walking around and in action, you're going to be stimulating some of those pathways for some of these certain things. Balance, mobility. Yes. Yep. We've got a couple things. Little Wings has helped people. Because again, you're bringing down inflammation on those nerves. We don't really know when we start them. It may have occurred during that, but how did it impact them? Did it leave, scarring? Is it a pathogen that's still? But yeah, it's been pretty impressive. Okay, we're gonna move on, and okay, thank you. All right, in your packets, how you doing?
Yeah, I was wondering if we should clean it with alcohol as well, or?
Yes, you take off the tips. Thank you for that. You can clean, you can take off the tips, wipe them down. Just be careful. This is, exposed metal, but wipe everything down. I typically will leave, like I've got the alcohol, the individual wipes, and I will leave it in the sleeve. Some say don't do that. It dries out the little rubber. That hasn't been my case to date. Well, no, because you have, it can go up. So I wouldn't dip anything. And I wouldn't have it drippy. Okay. Because you can lose this. And I think these are like $75. They're not cheap. Yeah. Oxidation. Yeah. All right. So we're going to move on. We're going to talk a little bit about good food, bad food lists. Again, there are some things that will improve your client's results with you. And then you just, tools, sorry. I know. And then you look like the rock star, right? I'm gonna pull that out in just a second. And let me just see if I can pull this up.
How do you approach nutrition if you're not a nutrition certified, you're not a nutritionist, like, how do you do that legal meaning?
Well, first of all, it's just food. So, obviously check with what you're doing. But we will be including nutrition based on the foundations of Dr. Wallach. And we can talk about that in just a little bit. I'm going to try to pull up. Yeah. Yep. Thank you. No, that's MB, that's Michelle, right here.
MB1. This is everything folder. Oh, MB is mine. Yeah, I gave you mine. Yeah, here's. Okay, that's a lot more sense to me. Thank you.
Mary, am I sharing my screen with you? What do you?
Not yet. I saw it a little bit earlier, but then it went away.
I think I hit the wrong button. Sorry about that.
It's like cheat sheet or something.
There we go.
Perfect. I like that sheet.
So you see this in your packet? This is a fun one. And you're going to want to use this with your clients, plus with family. I'm just going to do a brief review because we are talking about good food, bad foods, but these go together, all right? When you begin to understand the tissue types, and yesterday we learned about the 4 basic tissues and how they make up bone or hard tissue, bone, tendons, ligaments, that's considered hard tissue. Soft tissues are things that are mixed tissues, but they are, soft is considered organs, sexual organs, brain, all organs, and I know I'm missing something. Also your hormones, the base of your hormones is essential fatty acids and digestive, that would be epithelial and connective tissue. So that is kind of, and that's your endocrine system. Endocrine system includes the sugar balance.
I don't have it either.
Did it get mailed? Did it get emailed?
No, I haven't seen it yet.
Yeah. So ultimately, with that packet, there should be 5, and you'll learn to work them together. Okay, and these. There is 5?
There are 5 sheets, but that one specifically was not.
Okay, what'd you do with my?
Just go back to your.
All right, there we go. My apologies. We will email this to you, or you can always swing by and hopefully we have a copy. I oftentimes just do a front back copy. You have it from class? Yeah. So this is a fun one. We learned about the tissues yesterday and what they mean. I'm just literally going to go across here as I'm talking, endocrine system or blood sugar. Endocrine includes, depending upon where the doctor went to school, 9 to 11 organs. Some of them don't include a couple of the ones here as part of the endocrine system. Some do. Kind of like orthodontia. Some say before 12, some say after. It's the school that the doctor went to. Hard tissue, I just explained. Bone marrow, which is your immune system also. Tendons, ligaments, joints, right? You want to get the nutrients. Here's the key. Get your nutrients plus some additional. This one's chromium and vanadium. This one's enzymes, free probiotics, omegas, and cholesterol. Soft tissue, epithelial, connective, and I think nervous might actually technically be in there. So, but what you do is take a look at this list, and these actually are extend, and just go through each one, circle some of the things that maybe you deal with, cousin Kim deals with, and when you see I've got 2 here, let's say I got 7 or 8 here, 2 or 3 here, and 5 here. Do you think you can begin to identify their tissue issue? So now, not only with nutrition, but with the microcurrents, you have 2 ways to help them address and improve those tissues. So we're not treating any disease. We are working on the tissue. You improve that tissue, symptoms will change. And things that you cannot reverse, my MS couldn't reverse. I no longer have symptoms. After 12 years, they said, you must have been misdiagnosed. So this is a fun one. Have one in your office or at home, and put it in a sleeve. Use a marker, laminate, and then you can erase it. It's kind of fun, And so for those of you that do use nutrition, use this with your current clients. You're going to educate them so much in how to help themselves. So you're going to go beyond, take this nutrition. I'm going to teach you how to improve your body and that of your family. Okay, quick cheat chart. A lot of it is there, and it is based on that research that we talked about earlier, 25 up to date now, it's 37,000 autopsies. So this is no small deal. This isn't, there's a book out there called the China Study, the most extensive study on nutrition as it relates to disease, and they did 1,000. And then the 1,000 were in China, and this guy actually did 1,700 in China. So that right there was even larger. I don't know, I guess he didn't know about the book or about the research. Okay, so do they not have this either? Okay, so remember I said there's 5? These 2, we will make sure we get to. What are those 90 that they, plus 90 plus that they considered essential? It's written out for you. Take a look at what you're taking. Take a look at what your client's taking. And then you know what you can add to it. Okay? And right here, a couple things to remind. Plants cannot manufacture their own minerals. If it's not in the soil, it's not in the plant. I think we talked a little bit about hydroponics, thank you. Vitamins without minerals are useless. Vitamins and minerals, when combined, create nutrient-dense plants. And remember, they create other compounds like CoQ10, antioxidants, all of these other things. It is these bioflavonoids. It's a compound that was made from the vitamin and the mineral. It's a recipe. Pretty cool. Vitamins coupled with minerals, good fats, proteins, make or rebuild healthy tissue in the body. When we're talking about amino acids, I want you to just go look up protein folding diseases and see what you might be able to help somebody with. Okay. Yeah. So again, according to Nutriball, the original research of nutrition as it relates to disease is so valuable, it's considered a national treasure and can be found in the Smithsonian. The National Institutes of Health National Sciences, University of Oregon, Wisconsin, Washington, and Washington was where, no, Oregon was where Linus Pauling went. He actually had somewhere there was some hand or at least the something about the university. Sorry. The St. Louis Zoo, along with numerous other entities, offer this in their curriculum, including, and there's several, the Gerson groups, etc., and many others use these finding reports in their protocols. So this is when you, this is where you're learning from. So when somebody says, well, what was your background on nutrition? You're learning from these foundations. And yep. And now I'm going to hit the good food, bad food. So you do have those. Thank you. Here we go. And I'm going to move swiftly. So I'm going to first hit the bad food list because a lot of people are like, wait, what? Why? You want to pass on the good list? Did he say pass? Did you say pass on the good list?
No, it said, they said, peppers on the good list.
Actually, you may not like this, Gary. All right. So here's what you want to think about. Does this bring me illness or wellness? These foods bring positive benefits to the body, helping repair and rebuild. All right, tissue to gain greater quality of health. Eggs, there's an explanation of why. Anybody understand why we are not, or believe that we're not supposed to have many eggs? Eggs, when you cook them, if you're having scrambled, you want to have them soft scrambled, soft boiled. When you actually hard boil that yolk, you've lost the nutrient density of it. If you've ever had a hard-boiled egg and had a gray or green ring, I was told that's when you know it's cooked. It's actually burnt. That compound is burnt. Put it under a microscope. It is no longer the same compound. So if it's not the same compound, am I going to get the same results? Yeah. And of course, we believe in butter and guns and salt. No, butter and salt. So some call it the European style. Your animal fats do not go rancid, unlike oils in a bottle. So start to learn to cook with some of these things. Tallow is terrific. I now am using tallow. You can purchase it on Amazon or wherever. But as a skin cream, and it is absolutely beautiful. It's feeding the face. Michelle works at Sunrise Natural Foods. She knows herbs and botanicals like none of us in this room. If you want to talk to her, she's okay. Salt. Every single body in every single cell in the body requires salt. Get your facts, learn to know and understand why. But our salt, which most of us have grown up with Morton's, it's processed. So it's dead. Yeah, it's dead. And a lot of us didn't realize that or know that because of the advent of the computers. Information that was not made available or aware to us is now. And so it's like, well, I've been using salt for years. Morton's, they process it, and here's what's left. Out of 70 plus minerals in salt, regular table salt has something like 10 or less nutrients in them. And that sodium chloride, actually, that compound is different as well. According to the scientists. If you're going to do salt, which you should do, I always encourage Soleil, put a little bit of like a Himalayan, a Celtic, quality. As we do this, I'm hearing people say, yeah, but so-and-so it says it's contaminated with this, that, and the other. Don't throw the baby out with the bathwater. Check what you have and do your research on who's saying some of these things. Pink salt is not Himalayan salt. Marketing allows them to call it pink salt. And in the beginning, most of us had no idea that pink salt wasn't Himalayan. You want it to say from Pakistan. On the pink salt, Himalayan salt is only in one area. Sea salt, though, obviously is from other resources. There's numerous types of sea salts. Okay. Dairy, ideally avoid or limit your seed milks, because they're not actually milk. They're a portion of the fat added with water, and then to sustain it, you can take a look. There's quite a few chemicals in it. So, almond, oat, soy, all of those are seed milks. Okay. Oftentimes there's artificial stuff in them, like I said. So the worst of that is carrageenan. Yeah. And it's a type of thickener. Yeah. Right. And it's considered natural. Correct. Isn't that the one that's coming from a little beetle? Yeah. Then we have nuts. You can enjoy nuts excluding peanuts. Peanuts are a nut that grows in the ground. So they have something called aflatoxins. And there's a mold. There's a type of mold on it. So ideally limit or avoid. Otherwise, other nuts are okay. Rice, beans, quinoa, millet. Your different meats, and this isn't limited to. This doesn't say anything. Now, when you're cooking your meats, remember I mentioned how this changes the compound of the protein here when it's gray or green when you overcook it. Same thing with beef. Ideally, some will state you want it rare. I've heard medium rare. What you don't want is when it's charred. That is a different compound, and it's creating something called carcinogens. So those free radicals that you guys enjoy, or those antioxidants, Paul, that you guys enjoy. Well, and the little berries. If you're doing charred meat, charred fat, which I absolutely enjoyed, that's a compound that creates a carcinogen in the body. So it's just know that. These are good monitor. Yeah. And then of course gluten-free. You want to do gluten-free grains. There truly isn't a oat-free or gluten-free oat. And I see that it's not explained in here. Oats. Gluten is gluten, lutein, and gliadin. Oats have two of those three compounds. Some call it wheat's ugly cousin, and it's been overprocessed. You got another issue on top of that. So make your choices wisely. Well, and yes, some of us can eat from other countries because my understanding, we have more chemicals. And we, years and years ago, don't recollect, 20s or 40s, we did this hybrid of our grains. And there are things that one of the wheats was not considered for consumption. So that's what we've been eating. Over time, as our own immune systems have broken down, it's becoming more apparent. It isn't an anti-inflammatory. As kids, we all were fine with it, right? We had stronger bodies. Today, with more and more, 1970, Nixon said, yes, we will allow these 8 to 10,000 cheap chemicals so that we can make cheaper food because of the gas prices. So there's a link. Now, on the bad foods, pay attention to this. Make sure that you or your clients, your family know these foods sabotage nutrient absorption. They rob the nutrition from getting to the cells, aging you faster via one of these sources, inflammation, a biofilm, acrylamides, carcinogen, oxidation, free radical damage, etc., all equal ultimately cell death. Yes, Margaret. Buckwheat has something called pagophyrenes, and it's the way that I think it was there, and it wasn't so much of a problem, but again, how we're processing our things. As gluten has, they say 1 in 3 will be diabetic, pre-diabetic, adults and children. 50% of our babies are born with diabetes. That was 2024 report. 50% are born diabetic. Remember, mom's got nothing to give. Baby can only take what mom's got. Anyway, you just asked something. I got my last one.
I go out from wheat and it was actually super. So I think the problem is that now they're using glyphosate to dry
Yes. So there are other things here with our resources. Yeah. And remember, even with some of these things with gluten itself is still an inflammatory product, but again, our bodies have broken down. So we're getting more, but they state 1 in 4 are expected to be gluten intolerant or sensitive. It's not, and I've heard this before, we are not allergic to poison ivy or poison oak. We're not allergic to it. It's a reaction called contact dermatitis. Internally, it's enteritis, contact enteritis, which is what's happening with the gluten. Our bodies just aren't, we don't have the same. That's it. One school of thought makes a lot of sense, but either way, it is an inflammatory compound. We can't get around that. How well your body sustains it is really where that's going to be. So all these in one way or another equal cell death. You can read more. The grains have been altered to withstand weather, insects, weed killers, resulting in a gluten protein in our stomachs just cannot break down those chemical bonds on the amino acids. If you don't have the stomach acid, for starters, to break that down, you have an elephant going through your intestinal tract. Imagine an elephant going down your hallway 3 times a day. What type of scarring would happen to your walls? Right? So I want to give you a visual. And even if you can break it down, how many of us are from California and our kids made a California map with flour and water? That's a type of biofilm that then on our little villi develops, and it can't breathe, so they die off, and you got other issues that go on top of that. Wheat, rye, barley, oats, and I said earlier, didn't mention, but when you go in to read all of this, preferably if you do choose these grain-free, oat-free grains, preferably flour has more, still just a tiny bit, nutrients than starches. So if it's like a wheat starch, oat starch, whatever you're getting, potato starch, rice starch, if it's a potato flour, rice flour, it actually offers you a little bit more. Our grains used to have around 6 grams of protein in it. Take a look at your flour. Even if it's a grain-free, it's likely to be around 2 per slice. We ate it for health, not just a carbohydrate. You got fried oils. Who can tell me what fried, just heating oil does? Yeah, do something about it. What happens when you heat?
Turns into acrylamide, causes cancer. Number 3 cause of cancer in the world. They don't tell you that. It's on the CDC website.
Acrylamides.
Fried oil.
Fried oils.
Animal fat oil.
Yeah, because animal fat, and they do know some of the sickest nations are those that do a lot of the frying, those down south. They're definitely not a blue zone. Well done meat, I mentioned that earlier. Processed meats. You can get a processed meat, you just want to stay away from the nitrites and nitrates. Potato skins. You can eat the baked potato, but the skin, when it goes through a heated oven like that, just like the fat that we mentioned earlier, or the meat that has been burnt, what did it do to those compounds? It literally changed. It is no longer a potato skin compound. It's no longer a meat compound. So you can enjoy the potato, just leave the skin. If it's baked, you can certainly boil it. You can, what other ways can somebody do a potato skin? Well, I know we love the crunchy. You can saute. Well, air fryer, it's about the heat. Air fryers are typically above 400. Yeah. So I do believe, and this is what I've done before, it's kind of a steaming of my potato in the oven, and I'm not at over 400. So it stays moist. When you dry it out, there's a drying compound and pulling of the fats that again changes things. Is that about right? Crock-pot, yeah. Carbonated drinks. Now, ultimately, definitely not with a meal. Does anybody know why? I need that stomach acid, right? You want to explain that?
So carbonation.
Come up here, come here. We'll bring her up.
I used to be a 12-pack a day gal. And what this does is it reduces the stomach acid. What do we need hydrochloric acid in our stomachs for? Break down our food. So if you're doing a upsizing everything at McDonald's, that has taken away your ability to digest the food that you're not getting really at McDonald's. But you can't digest it, so you can't absorb anything. So if you're gonna do soda, do it 2 hours away from the meal.
Right. Again, our stomach acid should be like the battery acid in your car. If I take it out, it's somewhere between 1.2, 1.3 pH. I should be able to take it out, drop it on my hand, and it'll hit the deck. It's supposed to be, because think about this. God wanted us to digest everything. And some of you have heard this, but we're coming up on Halloween. Think about the witch at her cauldron, right? And she's throwing in frog and chicken bones and a skull, and she's stirring it up. What's she trying to make? A brine, a broth, right? In the stomach, it's called chyme. And it should be where it literally dissolves whatever you take in, and then now the little villi, those little finger-like projections, can take in whatever comes by. If it's too big, it can't take it. You may or may not see it in your stool. If you're seeing it in your stool, you know it's a stomach, upper GI issue. If you've got floaters, that's an upper GI, that's more gallbladder. That's your Don degreaser. That's why if you had your gallbladder removed, they should have given you enzymes. And if they didn't, go back and get them. Okay? That's your, you want that fat to get dissolved so you still have soft skin and, those good fats for your hormones, for your organs, for your brain. And then many have some thoughts on the amount of sugar. Sugar itself, they did a study with, they've done 2 studies with rats. In one cage, they did water and cocaine. Another one, water, cocaine, and food. And then sugar and water, cocaine, and food. And then I think it was just food and water. And the rats
after I think it was 4 days, that were in the rats with the cocaine and the food and the water stopped to have a drink every once in a while or have something to eat. The ones with the sugar did not. They were like the first group to die. The dopamine hit was so big. They didn't stop. They didn't take in food. So that was actually the group that died first. I believe sugar is okay because God made it, but in the consumption that we now have it in our foods. So there's a various number of schools of thought on this one, 20 milligrams. And then there's soy, corn, reasons why even now our beets, many of our beets, these are used with glyphosate and then hybrid. And hyperthyroidism, avoid eating the cruciferous vegetables as they can impact the reduction of thyroid function. There's not iodine in most nutrients, so get a good iodine. Go see Michelle at Sunrise Natural Foods. She'll direct you to a good iodine. If she doesn't have one, we can certainly help you find one. Well, but those are fried. Yeah. So anyway. Yeah. Well, it is still sugar, so again. So think about this. Everything actually turns to some form of sugar in the body. If my meat, my carrots is turning into some form of sugar. Remember, the body has to turn it into some sort of a glucose, fructose, and I don't remember them all, but all the ones that the body turns it into, but there's all kinds out there. So make an informed choice, and especially if you're diabetic, a sugar is a sugar. But the body, if you're going to do it, make it a usable one. As a diabetic, you've probably heard that we call it dress your carbs, dress your sugars, eat it with a fat or protein. You'll have a lower glycemic. Thank you. Yeah. Spike. Fiber, and there's one that we really like. It's from a gal by the name of Patty McPeak. She does this manna. It's pretty darn good. It's pretty impressive. She has all kinds of documentation about diabetes and her particular fiber. It comes from the hull of rice. It's a stabilized rice bran with a couple other things in it. Patty McPeak. And I've got her number if you need it. McPeak. Yep. Manna. All right. Where are we going to next? She's got a pretty incredible story. All right. So where are we at? And then here are some suggestions. There's tons of proteins out there. Sometimes when people are making a change, give them something to look at so that they don't feel like this is so hard. I don't know what to eat. Right? You're welcome to use these, take these, change these if you want. I'm happy to put your clinic logo on them. But yeah, just some of there's animal sources, plant sources, other sources, and I'm not going to go into it because you all have it. Tips for consuming, cook this, don't do that. We've covered some of it, and avoid drinks. Alkaline water, I will speak about alkaline water for a moment because it's on here. Much like carbonation, it neutralizes acid. Do not drink alkaline water during meals. And also, a lot of people, they have these alkaline, and I do too, I have one, alkaline machines. Remember, those are designed for a very specific purpose. People say, well, my body needs to be alkaline. Well, no, that's not how it was made. It's made acidic to keep out molds, parasites, funguses, and it's not just the stomach. There are different parts that need to have that acidity. So while there is real documentation and truth about how you would use alkaline water, I would not suggest, based on the research that I've done, that it's what you drink always. Always. They drop the pH. Yeah, it'll say people now it's now available in bottles or tablets. I'm not sure how those work or last very well. But it'll say pH water. Have you ever seen somebody drinking pH water? Yeah. So they're trying to, or they'll do alkaline foods. You know, they want to keep their. You can actually go into acidosis in a negative way. What's it called? Alkaline acidosis. Alkalosis. Thank you very much. I got several nurses in the room. Thank you. Alkalosis or base, and where the body's not getting enough. And so, walk with caution and check what you're doing. Again, it also does impact the processing of the stomach and the digestive, as well as the intestinal absorption. If I can digest it, but I can't absorb it, I'm still not getting it either way. If it's too big here, or this has got something covering it. Anybody watch Finding Nemo? So remember the sea anemone, right? So this is your little villi in your intestinal lining. It can get that biofilm on it. Or remember I said if you don't break down those proteins, it gets all beat up. So now it first gets all inflamed in fat. All of this area is a surface area to absorb. Well, now it can't because it's so fat. And then the biofilm comes and eventually smothers. I've seen this during an autopsy. Didn't know what I was seeing exactly at the time or what it meant to me. But it actually has a little bit of a look, moist look, kind of like a psoriasis or an eczema. Yeah. And some of them were thicker, and didn't spend a lot of time on it, but it was very, very interesting. It's like a slip and slide at that point. Here's what's beautiful. And you can look these up. I'm sorry, I don't have one here, but much like on the. Oh. Oh, I do?
Yeah, because that won't see it.
Where's my sharing? Where's my sharing? Oh, stop sharing. There we go. All right. So much like the spine, it has all been mapped out, right? This is why that 3 pathways. When you're done, come look at this and take a look at areas and symptoms that you can impact just by doing that 3 pathways with some consistency, right? But much like the spine, they have mapped out the entire abdominal. So the large intestines, small intestines, they know, so Crohn's colitis, right? Crohn's is on the right, colitis is on the left, adrenals are on the right, tinnitus is on, I can't quite remember, diverticulitis is typically up here in the transverse colon, but it's kind of cool because you're going to begin to learn, you've got pain there, and then you ask them if they have any of these symptoms. You're not asking if they have a disease. Do you have any of these symptoms? What are you going to do? Go in there and give a little love, a little dose 0 on those areas. Let's get that tissue working again for those that are interested in working in abdominal challenges, right? So I apologize, I don't have one here, but they're really neat to see. And so we're not guessing, right? You'll know that you know that you can help in this way. All right. So after the break, we're doing abdominal, and I'm going to talk about gynecologicals because they're so close. Much like the grid that we did on the back and on the shoulders, you would make a grid and you're going to go look for things. When there's no symptom relief or little symptom relief or things keep coming back. Okay? Is that all right with you guys? All right, good. We'll go into, we're going to take a break at 2:45. You guys doing okay? Do you need it now?
No, we're good.
All right. Is anybody leaving early? Okay. What time? 4. Oh, okay. All right. So let's talk about pulsed electromagnetic fields. On day 1, we talked about the bio and non-bio, bioelectrical and non-bioelectrical devices. Things that will connect to your generator, because that's what you have. You have a generator, no matter which one you have. You have a generator. I'm just going to pull out a few devices. You're welcome to use them, plug them in, check them out. I'll explain a little bit of how you might want to use them. I'll tell you which ones we use most in clinics. And, there are one or two that maybe I would choose based on your situation over another, despite how great it might be. Okay? So how many of you have experienced the pad?
The great pad. The baby pad. Everybody? Somewhat or another?
You have one? You've got, okay, Margaret's got one. Roughly 420, 450. Okay. And there's a bigger one. So in talking about PEMF, remember these are non-bioelectrical. They do not engage with your electric. I'm going to show you a picture. Oh, thank you. I'm going to show you a picture. And I think, pictures speak 1,000 words, right? Is that what you're doing for me? Okay. Oh, here, I'll do that too. I'm going to go share again. Oh. Thank you. Does anybody have pain somewhere? No pain? How's your back?
How
How do you try that right here on his back? This is a little more focused. This is the, no, you just place it there. We're putting some PEMF, VHE, and we'll, for the scalar, if anybody wants to try the scalar. I would do blue stamp, actually 350, because he's still hurting. Paul, what's your pain level? 10 being the worst. Oh, okay. Yeah. Well, 350 is anti-inflammatory, and he's at a 5. So let's drop that, and then I would put the pads on blue stem, probably some conductive pads, or he can use that as well.
So VHE works.
Yes.
This covers larger area.
Correct.
And then this is the scalar, right?
No, this is, let me see, yeah, that's the VHE, that's PEMF. Okay, so tell me if you like this visual. That's what PEMF is doing for you. See how it's permeating around her? It's not actually engaging into the electrical, but it creates this, like when somebody walks into the room and you smell them before they walk in. That is, imagine this, if we could see it, this would be called an energy field, but this is what it is. So it's just surrounding you somewhere between 8 to 12 inches, and it's changing. So right now we're standing on things. We are around all kinds of equipment that is putting out a hertz. Most of it, like in the wall, those plugs are 60 hertz. When you use, and this one happens to be a full mat, we have these smaller mats. We've got something that's larger. They generate a field that can literally bring about change. Not as quickly as maybe touching with microcurrent, but they are absolutely wonderful, especially like you can put them on your bed and sleep on them. Imagine we spend, what do they say, about a third of our life in bed, and you're getting this constant love on the body. Okay, so that's PEMF, pulsed electromagnetic fields. Just a reminder, all of these waveforms have been measured. They're all coming from the sun. Some are beneficial for the body, and some are not. Anything that we're talking about, we're using things that are beneficial for the body. They're putting the body in a state of either rest or helping to repair. Any questions? Sauna surf. All right. Well, it was an FDA kind of a thing. Mm-hmm. Yep. Yeah. And yeah. Thank you. That's a good question. The question was, should Paul be feeling anything? He has the Hache on him right now. And this is the handheld, looks like this, but it's more concentrated. Okay, for a specific area. Anybody that's had abdominal surgeries, you know, my mom, when she broke her neck, she was concerned for me to touch her with microcurrent. So she allowed me to do this, and it helped reduce the pain. Okay, so these two, in fact, and there's many types of PEMF. Here are two that happen to plug into your generator. Okay, again, non-electric, even though the word is PEMF, electromagnetic, because it's generating the fields. Is that clear?
So some people have been able to build current. Most I've noticed don't.
Yeah, every once in a while you might actually have somebody who's sensitive enough. Now it's interesting that the healthier that I got, I know that I began to feel something like this. Like as soon as I brought it, I could almost, and I'm going to say, feel the hair on the back of my neck standing up. I just became more aware of the change, and it, it might have been there before. I think maybe the sickness that I had that was playing a factor, and then of course just recognizing, that this can bring about a field. Even our rocks and crystals bring about a field. They're measurable, absolutely measurable. I don't know which rock or stone does what, but they all actually resonate like music. You've got rock music, country music, ballads, right? Old hymns. They all have a state that they can put us in. There are stones that you can take near the body, and they can provide health or healing over time to that tissue. And then there are some that are not necessarily for the body. Now, God made all of these things. And the fact that we can actually measure them, I used to think, oh, brother, I definitely had more of the logical mind, like, let me see that. Let me see the research on that. It's there. It's just nothing I was ever introduced to, wasn't in a field to even know about it. But think about it, they use quartz in our surgical equipment to cut. And that, I mean, well, that's about sharpness. It really is about sharpness. But why was I saying that? Why would God make these things? Yeah, we're using them for everything.
On the pads, what do you use to setting at?
What symptom relief are you looking for? Okay. So if it's more pain, I would start with 350. You can certainly go to blue stem after a little bit. If it's tension, maybe a little bit of 350 and then try 60 hertz, relax. Does it feel like you could, the muscles might be a little too? Yeah. So see if one or both of those makes a difference for you. Oh, I'd put you on 712. She was asking for spondylosis. She's using the gray pad. The blue, go 712. She has the evolution. So while she doesn't actually have bone, she has bone, because 712, she'll hit bone after, and this runs through an algorithm of about 7. And it does not need to be touching on the clothes. You can just, lay it against your shirt and then lean into the chair. I happen to have my little booties, sock booties on, and I'm standing on the pad. They can take up to 400 pounds. There are 2 Tesla coils inside of there. There are 2 Tesla coils inside of here as well. And those are helpful for the, as I best understand it, the power boost of what we're working with. Does that make sense? All right. There are many pulsed electromagnetic PEMF. There's also something called pulsed. So it kind of vibrates. We do not currently have anything like that with this, but they are making other things. They recently, maybe a year ago, came out with the light. And here's what they did. So if you're at all interested in one of these, please see me. Because they did make one where they put, I think it's 4 in 1, or the scalar, the VHE, and the lights. Yeah, so 3 in 1. So rather than like I've got, these are not the same. I've got another one is different. They put it together, and I think if that's of interest, you can. I don't own those ones. I'm not 100% sure, but there was some red, infrared spectrum. Yeah, infrared, but it's on the site. We can certainly check it out. Okay. And again, he's there. You're adding another layer. So rather than buying a different device, they said, let's put this together. And now they've got a couple treatments in one. All right. So, I talked about just doing the abdominal and GY protocol together. What if we took a little break now? And we'll come back at 2:45. How about that?
Come on.
But don't you be late.
Can you hear all this?
Yes, I can. Can I ask you later about just the a little bit about animals, treating animals?
Yes. And yeah.
Do you have slides on that or no?
I do have slides. I may have sent them to you previously, and those are the ones I would be using. Okay.
No.
When we come back, we'll take 10 minutes for animals. I forgot, we have a veterinarian.
Just real quick, so my that's coming, you should hear, any minute.
Refresh my memory, what's going on with your guest?
He has a knee contusion, got a handball injury.
Okay,
So.
all right.
Yeah,
So he was coming for the 3 o'clock?
2:45.
Right, the break initially was 2:45 to 3? Okay,
Yeah.
all right. I think I have 2 people coming for me.
Yeah.
So, well, he gets to work with us, right? Let him know he'll be working with us. Thank you, Mary, I appreciate that.
No problem. Thank you. Thank you.
I'm
And
gonna-
if needed, I could just, look at the slides with you later. Whatever works.
Well, I will get these, if you want to give me an email or text to be sure that you get them. Okay. Do you have these slides?
I don't know.
Okay. Let's make sure.
Yeah, the cheat sheet, and there was a couple other things I had to
Okay.
mention, the user guide.
Mine is all been.
Which cheat sheet?
The one that goes inside the book.
The one for the, so there's a couple cheat sheets. Are you talking about? Oh, for the device, my years of different practice. Okay, yeah.
Yeah, that one. And then also just a reminder, the vet in Ohio.
Yes, that'll take
That could be later.
me a little bit of time. I didn't know him personally, but he was instrumental in telling stories, and I was like, wow.
Right. It may be right around the corner.
Yeah. Do you have any pets yourself?
Not at this time. My daughter has a rabbit, and I guess we have fish, but that's it. I'm moving too much to have a pet right now. But she certainly wants more. So we'll figure that out later. Okay, I'll take a quick break. Thank you.
All right. There we go. We'll be taking a quick look at this when we come back.
Recording stopped.
Here's our test subject for our needs later.
Hi, I'm Yvonne.
Mark.
Mark,
Nice
nice to meet you.
Yeah.
So we're actually taking a little bit of an early break. We're gonna come back, we're gonna have a few moments of pet wellness.
Okay.
And then we'll start getting into, I guess somebody else has a repetitive strain coming, so we'll just switch a few things around.
He's the father of 3 pets.
Oh, well, then you'll be happy to be here.
Yeah, actually, our dog, one of our dogs gives to a pet wellness place in Folsom,
Uh-huh.
where they do acupuncture, they do light therapy.
How about that?
Yeah, I don't know
That's
the name of
excellent.
the vet, it's a vet in Folsom.
Uh-huh.
My wife actually took, we awarded them 2 treatments so far. But it's amazing.
Well, I love that you're, I mean, if I would have known, when we did have our pets, we did some of the traditional route, but he did make it to almost 19.
What we did is she hurt her leg.
Uh-huh.
And we had surgery, she tore her leg. It was like $48 for the surgery. So then 6 weeks later, she hurt her other leg.
Oh,
Something like that. So we went, the Eastern medicine.
Yes.
This work and.
it was a good fit. Yes, absolutely.
I don't want to take up time.
Well, no, visit, say, we'll be back. Well, for right now, probably right there. Yep.
Ready to go? You did, Yvonne?
I just did.
All right.
I'll be back.
I'll be back. Big rock castle.
This is the first microcurrent having one. Yeah, we're passing them. Oh, no, this is just level 1, 2. So,
It's been 3 days. It's gonna.
there's two more.
Oh, that's scary.
This is level 1.
No.
You give me a little note saying I need to get a
Yeah, I'm figuring out what I'm gonna do. I'm gonna make a copy of the video and then you choose. Yeah. And then send you 2 videos.
She does have a YouTube channel, for better YouTube wellness. For better YouTube wellness, and it's you.
Right.
Like you.
Yeah, okay.
They're just like things. This is daddy, right?
You're gonna have that going with this going.
I know.
That's why I was the she worked on animals. Because the I wish I had your problem with the. My 60.
Which are the numbers?
Oh, you wish.
I don't know.
I should be going up.
I don't know, yeah.
Let's see how we down. Can't see it on this one. They did all over the last couple of days. So 67, I was like a bathroom team, like.
Wow.
They're just all over the place. But yeah, it's very similar. I can sleep at night, so, yeah. For 15, so I'm gonna do that now so bad when I get home, so.
There was. You literally float in the water. And then yeah, of course, and then you do the river and you just sit there and float high. No, you're doing this. Yeah, I think they just released.
It's off and then these people are all, you know, you can all avoid.
So is day 3 not recording at all?
It is recording on Zoom. So we'll be available.
So we will be able to watch.
Yeah,
Watch.
right, it's not, well, some of it is streaming to YouTube, but.
Oh, okay.
Because what with me was that cheap, I don't know. I don't know where we started recording it, it was after we reconnected, so Yvonne computer updated today. Kicked her off, and then so she kept trying it on, and she reset her password. These devices, we get into that, so they kicked me off. Of all days.
So the Windows update, is that what it's happened, Windows update?
Oh, she's on the laptop. So it's affecting everybody.
Yeah.
And so then, and then she does this. So this yellow screen. Remember the yellow screen?
Oh, yeah.
This she has over the camera.
Yeah.
And
I do the same thing.
I was wondering what that was.
Yeah, so we can't sit now because
Yeah.
we're paused, but
Yeah.
it was like, and,
They can access it.
but I thought it had to do with her password.
I had no idea it was this yellow piece of paper. It was a two-fold.
Yeah.
It's like I called AJ and said, AJ, what's going on? He goes, my sister's yellow. That happened yesterday. And I said, It's supposed to. So it's two things, but. We can ask.
Oh, how do you get into this?
Oh, well, we know her for many years.
Well,
Yvonne
Yvonne lives next door to Edgar's coach. And so, well, you don't Yvonne before that, I mean, she lives right next to Edgar's coach. And Yvonne is like this pain erasing nerd. And we all know it. And
Like a thing.
So anyway, so I got a lot of injuries. It just started going on. Like I started seeing like miraculous things happening.
Wow.
And then she did some stuff on me. It was like,
Hey.
so.
Me? No.
She's got a major story.
So.
Right.
This is my story.
What did you say today?
Oh, the book.
So I had 15 specialists.
Therapy, as a manager, my husband took care of me. Have a good work to take care of me for 23 years. How did you survive? We didn't. You know, the happy Boston we call that our house. My mother gave that back to me. She said, everyone in the family's read it now, no one wants to keep this copy, so you get it back. So, that's where it was. Got one. That's all I needed, that's all I got, well, not the book, just.
Is Yvonne in it?
So did you sell? So do you?
Oh, yeah, no,
Did you sell publishers? You did?
I did. You still buy them on Amazon.
No, they're so
Okay.
I bought it there for $2.
Oh, wow. Now you can go to Book Baby and still get the ebook. Oh, Book Baby, okay. So this is, but were you doing microcurrent though? No, I didn't meet Yvonne until April. This year, and this was published on my birthday last year.
So who worked on it?
Oh, your birthday, happy birthday.
No one.
Oh, no.
I didn't know anything
Oh,
about
okay.
this. I deal with nutrition only.
Oh, okay.
But I only got to one point, you know, you get to. Yeah. And, I didn't even think I needed anything else, and walk in, you know, we're on a Zoom about nutrition. And she goes, hey, Mom, you said something, and I went, no. 3.5 miles apart, you know, I said, you gotta get together, so she says, well, I don't have training tonight, so I like tomorrow.
So the tree?
And then I was beginning, she said, my hero.
And did you do twisted or something?
I played
That's
pickleball.
right.
That's what it is.
I went to my primary care. Yeah, she's 40.
They used to promote seal. Gosh. I work ML and also just ML for vacation. He and I would travel and do vacation. And so we went into that space. And then COVID hit. That's really like track of everybody. In fact, I come something in my show. Under.
And so what's the sentence? Can you
Oh,
are you leaving?
yes.
Yeah.
What they would do.
Yeah. Inflammation.
Yeah.
It's just more painful for you.
Yeah.
Yeah.
I guess that should probably work twice.
People were expecting you, people were showing you.
And if you have any time yet, if we did it for some time, just about it.
Oh,
School system. We'll see. Yeah.
Nobody got out. They went under.
He's my interpreter, facilitator, minister, chef, chauffeur, mechanic, gardener, caretaker.
I got maybe. I know exactly. Not that you. What do you mean? I'm reading.
You got my husband, right?
It's safe.
Oh, thank God. We can move on below the shower.
Yeah, exactly. It's
He does better.
You just better being God on everything else.
You can check. I thought, I know you think like to pray. That's how you know. Yeah. Yeah. Emphasize. No, you can all right. So, do you think one of these stools?
No, because we're gonna bring our leg up and we're gonna work on it.
You'll see they're dangling. Feel free to your legs. There's another one. There's one over there. Thank you. Well, she has a knee condition, that she had before she decided to have me. So it's going, oh, this time. Yep, we're gonna put her here.
So that's been about 20 years.
Right after 21 years. I'm 56. She's had her for a tiny bit. She's only 7. Okay. Well, that's great.
That's my year. I just learned that.
See that.
I guess I'm gonna get my own book with my own. Maybe say anything.
It's learned behavior.
Yeah.
Defer pain.
I got up 1 hour a day.
Oh.
We good here?
And then when I wake up, I was like, things.
You have a buster. I'm sorry. I'm Gina.
Pleasure.
Here.
Sure.
We're going to need, right? Take the mirror away from. Well, we're gonna have questions in here. So we get it inside and then you'll get it. And Mr. You'll start saying there's trucks. Did you make me pause up real quick so I can just get it set up? Yep.
Recording in progress.
Don't forget this, you know.
Oh, yes.
Was awesome. Yeah, the sticky note. Everything else took an hour and a half, but that took. I had to call AJ.
Would you say something to me?
I had to call AJ Mary to figure out why we were seeing yellow. It's the sticky note over.
Oh, in the beginning. I can see you all.
So are you good with them at such a distance, or do you need them?
You're gonna need this here?
Oh, not yet, I can't see anything.
Oh, that there. And then put it over here.
Are you wanting a wand?
What?
Yeah, wanting wands?
Well, yeah, but I'm gonna start.
Start.
Right. I'm just.
Can we tell Eric back on? Am I sharing? Am I sharing?
I'm back on, not sharing yet.
Thank you, sorry about that.
That's okay.
You're in program and you have to go to Zoom.
Thank you.
Yeah, I'll get set up and then I'll have that. See about
All right. Does everybody see that? So I know you guys are facing the opposite because you're getting a treatment here in a moment. Julie, if you want, we're going to take just 2 minutes to finish up this piece. So if you want to maybe face us, or you can listen from behind. So another thing that you can do with anybody here interested in working on pets? I know we have some on Zoom. Okay, all right. This isn't sharing. Where'd it go? Not see, I know, I see that. Something happened. I'm not sure what happened. It was there. Where'd it go?
Oh, okay, you need to go back to your phone. So if you do the.
There we go. So we're just going to take a few minutes to talk a little bit about your pets and some things that you can do with them. Many of them you'll be utilizing the hairbrush, or possibly your VHC. There are some pads that we can place on the bottom of their paws. You'll want to get them a little bit wet. And there is an entire book dedicated to microcurrent therapy and animal wellness. So I'm just going to, we're going to take just a few minutes and walk this through. So again, studies with the electrical stimulation on the biochemical changes. Do anybody remember how much ATP we can improve? How much ATP production? According to Baylor and Stanford universities. Does that sound familiar? up to 4, I've even seen 500%. Up to, I stick with 4, but I have seen numbers that say even more. It was found that amino acids with electrostimulation resulted in a stimulatory, what are we doing? Effect that was even stronger than the effect observed with the addition of amino acids. So again, working those nutrients and the electrical together. The protein synthesis activity were influenced. And remember we talked earlier about protein folding conditions? We can make big impact. Clinically, choices for animals using acute injuries, for pain control, nerve regeneration, muscle relaxation. For those of you that have a gray pad or the blue pad, what happens at 4th of July?
They run around scared.
Fireworks. So, what would you do with this pad? What setting can you think of that you would use, that you would slip underneath their little bed?
The lowest one you have.
Okay.
Or under their bed.
You slip it underneath their little mat, and you can certainly like to 712. 712 would be most will respond. And then when we were talking about PTSD and anxiety, there was a little time frame I gave you. If you know the fireworks are coming, or you got to go to the X's,
90 minutes before.
you can start as little as 90 minutes. You can certainly start hours before, because I don't know, around my neighborhood, some of these yahoos start 3 days before, right? So you can tuck this under 712 for those of you that have the Pinnacle. There are some a little bit deeper modes, but most will respond to this. Another thing, if it's, let's say it's already started and your little guy is already angst and agitated, you've got a couple choices. Again, using 712, use your hairbrush. And what you're going to do is come down from the neck all the way down to the spine and to the tail, and just paint and stroke. Okay, just try to brush through. If they're just way too hairy, it's not short-haired, or it's too matted, you could use this wand. They won't feel this one. It's not direct contact with the skin, but do you remember the dog that had glaucoma that we saw on the first day, and then he was chasing the ball? On that particular day, you know, those treatments were just done with this. Okay, so this can make huge impact also.
Using the hairbrush, how would you power that up? What would you power it up to?
So remember, if you don't power up at all, does it still work?
Yes.
Yes. Because we also want brain buy-in, for humans, we power up until they can feel it, and then remember, you've heard me say power back down. It's still working. For the little guys, you know, some of the suggestions are maybe 25. Feel it on one of the more sensitive parts of your skin, but I've heard numbers of around 25. Some of the veterinarians may have already figured out what works. I don't know those numbers personally. We should get Crystal on that. Her daughter's
My cat
loves the red one.
Yeah.
Yeah.
Does that give her the same calming?
It certainly can, absolutely. Some of these, when you calm them, they get energy. So do it when she doesn't need it, and you'll begin to recognize how does she respond. Just like we talked about a cup of coffee, some of us can drink and go to bed, a whole pot. Some of us, nothing past 3 o'clock, right? I'm staying up all night long. It really will be about how it's processed.
Mark's dogs will rescue from Palisades fire. So there's probably some animal PTSD goes.
Absolutely, yeah. So there's actually ways to assist with PTSD and begin that brain reentrainment. Yeah. So some contraindications, don't treat animals that are pregnant, have heart problems, no cancers, overbroken skin, we don't want to treat. Now, that's not necessarily the truth with when we're doing wound care. You guys saw some of those wounds, right? Use PEMF instead. We don't treat through their brain, and if you're at the head, we try not to go above 70 hertz, and do not treat immediately after heavy exercise.
Okay, why not? If you move that paper.
There we go. Sorry. Sorry, why not what?
Why can't you treat after heavy exercise? Everything seems to be flowing fast.
Yeah. That's a great question. You're changing the physiology of the body. They can't tell us what's happening. Also, when you begin, and if it's, let's just say you needed to do something and you already have utilized microcurrent on your pet, you'll know already how they respond. Just like for anybody when we were going over all the neurological conditions, I always suggest, whether it's autism, PTSD, overwhelm, have them use it way prior to any of their conditions that might spike them, because now they already know what to experience or what to expect. If you've got somebody that has anxiety, PTSD, overwhelm, and you're introducing something new and it's going to work on my brain, can you imagine where the wheels might start spinning? And this doesn't go in your favor. It doesn't go the way we know the research shows is so possible. Okay. The animals can't speak to us, so we can't actually know maybe what's going on with them. Obviously, when there's pain, when something's broken, you'll see changes in their range of motion and motility. But some of these neurological, again, they can't talk to us. I wish I had a vet here to ask that question also. It's a mammal, so I do understand some about it, but there's some sensitivities I'm just not aware of. Is there anything you can think of why that might be? Nope. Here are some of the tools that you can use. Look at that little cutie pie. There are literal multiple modalities and tool options. I don't want you to feel overwhelmed, but for those of you that already own a kit, you can use numerous things in your kit. I'm just showing a few of them: the handheld, the pad, direct microcurrent. That's not always very easy on most animals, just simply because of the amount of hair or fur that they have. You can use the lights, the red lights, and this is a different training, but it does add, we've got other tools in our toolbox that we can add to your arsenal for your animal, being lights, terahertz wanding, stem cell stimulation, right frequencies, scalar, and then always nutrition, because your goal is to rebuild those tissues, get the bones stronger, the tendons, the ligaments, etc. Here are some of the tools. Direct microcurrent would include the brush, the gloves, the ear clips. Yes, people have put ear clips. I've never personally tried. And they do see these little conductive pads right here. So they actually have some that go on the animal's paws. They have the black, the fabric ones that we were passing around yesterday. They actually have some that they're little booties that you can put on the paw for the animals. But you can also use the smaller conductive pads. You wouldn't put it on the hair. This is
Small conductive sticky pad.
Yeah, they're very small. I probably have this one, in here you can see, you literally have the two sides. There's numerous options, and I do know that there are more out there from other companies. This guy right here, did anybody remember seeing the knee sleeves? Yeah, so these ones are actually wrists. So depending upon the size of your animal, you want to pull those out because those are really cool. In lieu of a sticky pad, you would slip them up on the leg. And depending upon, we've got some pictures here. Who's wearing the lanyard? Who is wearing the lanyard? Oh, so much like Tanya has this little lanyard, there's actually cute little devices that things that can hold these devices right on the animal. But again, microcurrent remember, it just serves as a gentle intervention to help alleviate the symptoms. There's alpha mode, scalar. Oh, you can pass those around. These we can use today. We've got 2 knee conditions we'll be working on, but pass those. We have some that are the size that wrap around the wrist. Those would be the ones for most animals that you would use. Here we have Kathy. If you remember Kathy, she does rescues, and these were feral kittens, and she's had a couple litters now. She took her gray pad. They were all over the place with anxiety. She put this on 7/12. She slipped it into the bathroom where they were staying, and she said this is like less than 3 minutes.
So maybe it doesn't have to be like right up on them, but just kind of get a little closer.
Well, you get 8 to 12 inches from this. So like when it's in the body, it's going to drive 8 to 12 inches. Exactly. They don't need to be sitting on top of it, but she just slid it in there. Exactly. They were, scratching her up, and she was just trying to get them calm.
This size and the bigger size.
So the bigger size will cover, it's like 2 of these. No, it's not. So she's asking if there's a time difference when you have the larger pad. There's no time difference in the treatment itself. It really is just about convenience. We love these because they can tuck under your pillow. My husband puts them in the back of his car for himself. And anybody remember what brainwave he puts it on for focus and concentration? Gamma 3245. And then just prior to coming into the house, he'll drop it down for 5 or 10 minutes to 712. So, he's not coming in full bore, right? Lots of fun things. I use this for all of my classes when I'm in learning mode, or the ear clips. Okay. We're just going to show you real quick. I can't remember if you guys have seen this. So this is.
I'm not going up and down the spine. I'm going top to bottom, like we're doing the 3-6 protocol. So this is a really good calm down one for pets. Just in general, it's working.
Hang on, I was going to see if I can open that up so you can see a little better. So you can see she's using this right here. And just going straight down the spine, she has it on 712. And we see this little guy.
You can also use a brush electrode. But his hair's kind of thick and he's kind of frisky, so. Oh. Seems so good, I don't know what to do. Anytime John gets his out of his house, his dog and cats go all jump in his lap and hide over it. Really?
So we would take this one and make next to the side or my husband's side, and then
My old dog had arthritis in her hips, so I would just piece the area or modulate, the anti-inflammatory.
lay in his crate.
And it always.
So-
I have a dog that I've recently been using the G-Ring.
And this is after about 10 treatments. So for those of you with the eye conditions, I'm trying to see if I can make this any bigger. Actually, it says 3, but I thought it was 1. He survived till almost 19. Yeah. He was 15 years old. He had stopped chasing a ball. He couldn't smell, see, or hear. And again, it says 3 treatments. I thought it was a little more than that, but look at him go.
At 15.
At 15, yeah.
Oh, boy.
Yeah. We did find some real high quality nutrition. He couldn't jump up on the couch or the bed anymore. And that made a change. And then, of course, you know, a couple years later,
He would not see
eye,
me.
all these other issues. So many things that you can do with this. Protocols that are covered. I'm not going to go into them, but eye health, fractures, arthritis, vagus nerve stimulation for your animal that is just overexcited all the time. You know, some of these little guys really have a tough time. I actually treated and worked with a type of parrot, a caw. Macaw. I understand they lived to be 60. He was 30. Always at the feed store, and the feed store got robbed. And so, at least 5 or so years prior to me meeting him, it left him with anxiety, and he was plucking all the fur out. I said, you know, I can certainly try, and I'll do what I can. We use this device and this device through the cage. And then we included something called a little bit of Arthrodex, and that actually didn't come in for at least 2 weeks or so, which is food for animals. And I'm trying to see if I have the picture of him. But the hair started, the feathers started growing back. Yeah. Here's one of these little pouches you can get from a different company, but you can see he's got the little pads right here, kind of like what you saw yesterday. So different ways you can use those silver thread lining, but just different ways that you can begin to treat them. This was the particular animal food, and a human could eat this. This is safe for humans. And there we go. I'm just going to kind of stop there. Does anybody have any questions? No questions? No questions on animals? All right. Mary? Can she hear me?
Yes, you can hear you.
Yes, that was great. I gave you a thumbs up.
And I can certainly get these to you. Let's just make sure that you remind me. Okay?
Sounds good. Thanks.
All right, so we're getting ready to get into, can somebody look up repetitive strain injuries for me? So when we're talking about any type of injury like repetitive strain, carpal tunnel, plantar fasciitis, what's the tissue issue there? Well, that's what's happening, but what, thank you, you're correct. What would be the tissue? That is, we need to, okay, also known as hard tissue. Because remember, what is the cycle of bone? It literally, the cell begins, and when it gets the right nutrients in the right amounts, you got ligaments, tendons, and then cartilage, and moves into bone. So kind of falls under hard tissue when you go back and look at some of your other handouts. Okay?
Soft tissue again?
Soft tissue is organs, brain, go top, brain, organs, and then sexual reproduction, as well as any, like if somebody's got ED, endocrine, but also remember that's hormone too, because the base of hormone is your good fats. So if you've got somebody who's having a hormone challenge, check the amount of their good fats, check their gallbladder. Are they digesting and are they absorbing? Okay. And remember, your gallbladder, kind of like your stomach, squirts out that Dawn degreaser, helps the fats, all fats, you want them to get absorbed, breaking them down into tiny, tiny molecules, right? So
And once again, if you don't have a gallbladder, what should you be doing?
you should be taking enzymes that are specific for the gallbladder, and that would be called bile, ox bile. Ox bile would be one. And there's many companies out there that will. There's a ton of enzymes specific though for the liver. You want ox bile. You can certainly add, the papain, the pepsin, the other things. Those are a little bit more stomach. But ox bile at a minimum. Your skin will be better. Your brain needs those fats. The organs need it. Okay. And so go back to your doctor and say, you took this out. I want my Dawn degreaser.
You know what I found out about a gallbladder is he never went in surgery on him. 3,000 gallbladders were removed a day in this country right now. So you talk about people looking for help, because a lot of doctors don't tell them about nutrition. All of a sudden they come looking sick, the microcurrent with the nutrition, important for our suffering.
Everything okay?
Yeah, I just.
Okay, should I look at that? I'm gonna go into, we're gonna come on over. Who has, did you find repetitive strain injuries? Okay.
Did you find, are you gonna? Yes.
Carpal tunnel,
Carpal tunnel? That'll work.
86.
86, all right. And gallbladder, by the way, is on 99. Acute problems. And I have helped those that they were so inflamed, please take me to the ER. I know I gotta go to the ER. I said, well, let me just see if I can't calm you down before you go. You never keep somebody, away. And we dropped the inflammation, and of course, they went ahead and did what they were gonna do. And they said, yeah, it's a gallbladder, but it's okay. It's not that bad. So the goal, we just want to keep that inflammation out. Something
Stop sharing your screen.
with Mary, so she can't see.
Just stop. She doesn't need to see this because the camera's gonna show.
So what do you need me to do?
Stop sharing.
I thought I did. Oh, I guess not. Yep.
Thank you. All right, there we go.
And you said 87?
86.
Thank you, 86. How many people know what people that are dealing with issues on so we are in right now, it's called condition based. So what does that mean? That means that if you know your core, you're going to be able to help just about anybody, right? So know those core techniques, and when you see this, all these condition-based, these chronic long-term, they are going to be just layers of your core techniques. Does that make it more simple?
Yeah.
Excellent. All right, let's talk about carpal tunnel syndrome, plantar fasciitis, and sports-related injuries. Because again, the tissue itself is what we're looking at. So not only are you going to address the tissue using your microcurrent, but you also want to have them leave with some nutrients for rebuilding. Somebody want to read a little bit about what's going on carpal tunnel, and then we get started. Do I have a device and a wand?
Treatment, description, something.
What does it say about what we can do with electrical stimulation?
So, the 5, there's no thought that carpal tunnel syndrome to be triggered by a combination of risk factors, including the risk fracture, repetitive motion, and rheumatoid arthritis. In the treatment method, symptoms typically manifest in the forearm or hands and progress through the entire upper extremity.
to the paraspinal area of that. Feeling paracesis, the beta, therapist, close, should be calculated with independent for the clinical. But now it's such a body to an anti-inflammatory move for the chronic pain. Modulate P50 hertz, reduce the thin, defibrillate the organ. So, and then symptoms. Yeah, that's good. So carpal tunnel and plantar fasciitis are inflammatory conditions of the hand and the foot, and it can include the Achilles tendon. What tissue are those three things most comprised of?
Heart tissue.
Heart tissue, which is tendon. Yeah, your bone therapist would go in there and start plucking it, right? Okay, so for these conditions, the first thing you gotta do is scar tissue and anti-inflammatory if they're in pain. Remember, I can't get to the pain as well if I don't first treat with scar tissue. 4 rules of microcurrent. Okay.
Yes.
We just saw Donna earlier, her Achilles tendon and the plantars, both tendon issue, a hard tissue issue. We got microcurrent specific using a 10. You have 10. Also on 712, it will just take a little longer as regenerative or blue stem. So I'm moving quickly and let me know if it's too quick for you. All right, and I'm okay. I'll slow down if I need to.
If we want to record it, we don't wait to record it. It's just on, Zoom. If anybody's wanting it, so, just click on and record it.
Okay.
I was recording.
Excellent. So, I'm gonna come around, maybe just slide on this side and, because it's this knee here.
Yes.
And so, Brian,
Mark.
I'm gonna slide on this side of you.
Okay.
So, help me out here.
Sure.
I got a little. And I'm gonna have you tell your story real quick. What's going on?
So it's born in 1971.
You need it, sorry.
So I was playing pickleball and I felt fine. I went home in the evening, I felt fine. I woke up in the morning and I got the other day. And at that point, my knee was swollen, had some inflammation, and I really couldn't put any weight on my leg. So,
And this was what, like 5 days ago?
no, this is almost 4 weeks ago.
Oh, 4 weeks ago.
Yeah.
Okay, so when you have this much hair, sometimes, like my athletes.
You need that one.
Yes.
The razor.
You could use the brush. Leave it out here. You could use the brush. My athletes know before they come over, they might take some scissors and clip things or shave. Yeah. Well, I see a lot of them with shin splints, especially the younger ones. So I got it 7th grade and it's fast.
You should get the little ball out, stick your face in it.
So stand up for a minute and let me know, is there a range of motion that you are limited with? And you said a pain level of at 10 being the worst?
10 being worse, probably 5.5, 6.
Okay, pretty daily. When does it get higher?
It gets higher throughout the day, and then I'd say.
And how high?
Probably up to like a 7.5 or 8.
Okay.
And to the point where I can't put any weight on it,
Yeah.
and I really favor my other leg.
Yeah.
And then when I'm off of it for a prolonged period, it feels better.
Sure.
Or if I'm ever sitting down and the leg is bent, it seems to slip it out quite a bit, so I have to have my legs extended. Yeah.
So I'm gonna do a little toggling, because I'm gonna need a little time with you on treatment, but
Sure.
first thing I wanna do is see if I can identify the highest points of inflammation. Go ahead and sit down.
Yeah.
Pull that up. And so where is your source of pain? Give me 2, number 1 and 2.
Number 1 would be the inside of the leg, like right here.
Okay.
And then it seems to kind of migrate back around So it kind of radiates to behind them.
Okay. So not a lot of blood flow in the knee, especially the front of the knee. Most of it's going to be behind the knee. I'm just going to look and register some numbers. So right at his point of pain, I have 25. Yeah, that's normal.
Okay.
Now, we could also have, do you feel the current?
Yeah,
A little bit of tingling. I mean, I'm just gonna check it right around. Let me know when you feel the tingling.
Fairly.
Okay, is that a comfortable level right there then?
Just fairly. Oh.
Not too right?
No.
It never needs to be uncomfortable.
That's your.
Yeah.
What's this?
But that's a good, that's a real life.
So I'm at 150 for the power level. So right now, I got 20, 25, 27. So nothing, it's like, that sounds like pretty high pain, but I'm not seeing the numbers, are we?
Right.
24, 28 was right here.
That was more sensitive.
Yeah, this tissue is more responsive. It's less affected.
Really?
Yep. So, and that number doesn't seem to represent. You're special. I got 24. So I'm gonna go behind the knee. Remember, he said he's feeling the first pain here, but remember, you've got a band that comes around. So this could be referred pain from the pulling of back here, right? So I'm gonna go above the knee and just see what I find. We got a 32, 36. Level of inflammatory response. How much? 34, 26, 30, 30, 22, 50. Almost at the end point that he said this is number 2 spot. Okay, it's behind the knee.
Yeah.
This is, and a lot of times if your knee's been bent because it's warmer and there's more blood flow. Remember, there's not a lot of blood flow right here. I've still seen numbers in the hundreds, well, in the high double digits. And that's usually when you're kind of go, you can't call it, but. So I'm going down just a little bit lower. I got 39.
Now, if you didn't have the pinnacle, if you had an evolution, you'll have those numbers.
Timer, stopwatch.
And the timer would be until you get the dose.
Yep. That's one way that you can. So I'm gonna go back to that 50. I've kind of searched around. I didn't grid or map anything out, but I mean, I was literally kind of, going 1, 2, 3, 4, and then I went up towards the hamstring. It wasn't getting worse going up. So if some of those numbers started increasing, I keep going up to see if there was something. Remember, we got referred pain. Now I'm going to actually go over to the other side because what am I looking for here? Good. Did you know that one? Yeah, mirroring, right? So this guy was actually kind of low at 21, 22, 23, 30, 27, 22, 22, now I'm going to go to the back. 32, 35, 39, 40, 41, 41, going up a little bit, 32, but the numbers not going up. I do see a few areas of block. I got a 17, 17, one prior to that was a 10, 10. But where's our highest number still? Yeah. Mhm. Yeah. And that's like try it because I gotta work on this side. So what do you think what would be the best course of action? Remember, you just getting this down and the information down, he's gonna feel good, but if we can do a little bit more for him, a lot of times it's, you're gonna see just a better response. What should I be doing?
Yeah, 350.
So this is a new recent 350. Unless he told me I injured this knee several times, I can always do scar tissue, but right now I just want to address that inflammatory response from his.
So if he had like an old football injury and now this is a new one, would you go back to like 7?
Well, yeah, it's following a nerve.
Because the hamstrings, I mean, the calf was.
Oh, you're twitching? Oh, yeah, I see it.
So with the old scar tissue, would you go to scar tissue first?
If he told me about a prior injury, depending on how close it was to what we were working with, I would certainly include that.
Sorry. Oh, you know my foot is.
Was it too high or just it traveled?
Almost way too.
Oh, okay, then I'm gonna power down. And watch what happens each time I keep having to power down as we remove that inflammation. Kind of like pouring the beer, you wanna move the foam, but it's the meat of things, right?
Okay.
The tissue is responding, it's showing me, this is the biofeedback, responding in real time when we look.
It is sensitive.
Was that?
Go ahead.
Okay. So where was he? What did I tell you? What was his power level?
Yeah, 50.
111. And look how he's responding. Did you see I was holding it there? So he was getting a little love, wasn't he? Even though I didn't do anything.
So switch that then.
When you work in the bed, you always work in the bed. How'd you try? Oh, that was 91.
Oh, wow.
Yeah, I was feeling less busy.
Well, I made anything.
How's that?
Let's try it.
Now, I was just at something that's just below it, 22. That's how, how's that? All right, there's 51, and right where I was is now 39. So that brought it down some, didn't it? So again, right now I'm just, giving a little love on SonoSurf 350. You gotta bring down the inflammation. He didn't tell me about any previous injuries, so I'm not anything about scar tissue. Could he have some? Absolutely. You're how old? So he got a little age, he's probably twisted or something. If he owned one of these, I'd say, not yet.
We're gonna get some love.
After November 1st. Black Fridays now.
There you go.
Now I'm gonna. I'm gonna use Does that feel different?
No, same sensation.
But this is where some of the pain was. I didn't notice it really. Now I'm pain a little bit. So interesting, a lot of times people will give you 2 points, but he was very clear. He said the travels over here. So much like carpal tunnel or plantar, we have a tendon that goes from one side to the other. And so the actual injury could be that this particular band also in here. It's not really in the origin or the insertion, right? It's what we're pulling on. So I'm going to do about a minute right here.
This is gonna check with the dogs.
We would be using, different, same device, but just a different accessory, depending upon the care of the dog.
Same thing.
Yeah, absolutely, still the same, yeah, you're gonna work inside of that zone.
You're just painting around that.
I'm just painting right now, I mean, this can really drop some information.
And what do you want?
I'm on really good, that's all I've done so far. Besides just getting a quick assessment. Always with the other side, of the limb, because this will take some brunt, even though he's not feeling the pain. And sometimes it'll be like an onion. He's like, well, that was better, but this now hurts. Well, it was hurting, but somebody else was screaming louder, right?
So what's the after therapy that you do this about the water?
Somebody want to tell him about a foot soak?
That's all good.
How much? How long? 1 cup to a pail with 1 water.
That's
For a foot soak? Yeah, for 20 minutes.
So you know, you
Well, it's releasing toxins that are. And what's on the bottom of your feet? Large pores. So that Epsom salt will help you pull some of that out rather than go through your liver and kidneys. Go ahead and stand up.
But
Walk around the table once.
Also drink some water.
Yeah, and normally if you came to the clinic, I'd give you some electrolytes. Because one, that makes the tissue more conductive. For us, same, better, or different?
definitely better.
Alright.
Definitely less pain.
Good, so it was a 5 a moment ago, where is it now?
You still feel it, so I'd say probably 2.5, 3.
Okay,
But the other thing I noticed is like the stiffness. Got a lot more stiffness before,
right,
so more flexibility.
yeah, well, with that information, it's gonna generate that. So what would you might do next? You can paint a little bit more, or we can do what, and do what we call an unattended PMF, or what is actually more conductive than a PMF, and since he's gonna sit here, he doesn't have to dash out the door. Sticky pad.
What about his hair though?
Yeah, so that can be a little tough, so that's why we have those sleeves. I actually really prefer, I seem to feel like sometimes I get a better conduction with those sticky pads than I do with the sleeves, but Ms. Gina, if we can get those damp,
Yes.
that would be a conductor. She's gonna use the sleeves.
Oh,
Okay, so she's gonna get those on you.
Sure.
In the meantime, I'm just gonna let you paint this back side and the side here, and then I want you to paint the other side. You got like 30 seconds each, and then she's gonna tell you. Okay, I'm gonna slide over here, and we'll take a look at Shirley and see what's happening here. Let me grab something.
what are you getting wet with the salt water?
And go get water. Yeah, this is gonna cover a big area.
So what is she doing those?
She's just gonna go put warm water on it. She's gonna get them wet.
Oh, really?
Yeah,
Okay, give us some.
you never wanna put them
You put the
in
device in your emergency, put this on your plant.
the washing machine.
What was that?
You just gotta put it in the washing machine.
Okay.
Does somebody have the other pin? There. Oh, yeah, I mean,
Really now the advice is not to wear those while you have an injured leg.
Definitely.
Just the bill. Just give her an ankle on top of everything else.
All right, because it's weak.
Oh,
She's
she's
ready for it.
she gave it to you.
Yeah.
Yeah, you should be wearing these yeah.
Shoes.
What you're doing here, Mark, it's all mirroring, so even though this is the painful side, you want to kind of even up things on the, so you have balance.
Okay.
This is Shirley, and she too has a right side knee pain. Tell us what occurred or what's going on. Well, it's a lot of years. Well, I don't know where to start. Injury when I was probably, I'm thinking about 14 somewhere. And what kind of injury? Okay. And so does it keep coming back or do you keep injuring it?
It went away for a long time, and,
Okay.
but I noticed it's like the physical, we were going in and out, in and out, then it got really bad. So if I do anything where I'm putting a lot of pressure on it, that's when it comes back.
Okay.
But this is different. It doesn't.
It's different than when it comes back.
Different. Yeah.
Why does it feel different over the years?
His body changes, aging.
Aging,
Mhm.
tissues degrading, right? Wear and tear, exactly. So I'm gonna actually do something a little different with her because it's come back several times. I'm actually gonna check her alignment. I'm gonna address the pain, but by checking her alignment, you can get her out of pain, but if she's out of alignment, pretty cattywampus, it will return at some point. Does that make sense? Remember, it's all about angles for those of you that play pool, right? So if you'll slip your shoes off, and what you want to do is get something that you can watch them walk a little bit of a distance. So I'll move this for her, and Shirley from here to your hubby and back, just walk your normal walk. And one thing I want you to pay attention to is, am I walking on the sides of my foot? Am I heel toe? Am I inner, walking on the insides of my feet? Or, you might just feel it all over. But I'm just gonna be looking, and I can already see.
They're just all broken. I know, just like me.
So I'm just gonna have you stand in front of this and I'm gonna see, tell me what you guys see. No, face, turn the other way. Right side, left side, or even?
Yeah, the side up a little bit. Yeah, the right, yeah, she's not up and down. This leg is a little bit at an angle, at least,
Okay, look at the shoulders.
What do you
Loosen her hair, but loosen her right.
And just look straight in.
The right shoulder is lower to me. That's all I see.
Okay, what's the consensus you guys are seeing? Right is lower, and which knee?
Right.
Okay, so that means this hip is higher.
Yeah.
Yeah, and she's in the
right foot.
twisted my pelvis. Okay, so see that right foot? That's a tendon issue, all right? And it's a compensating. So at some point, she may come back for the ankle. Does your ankle ever bother you?
No.
Okay. Yeah. So I'm gonna go ahead and do a quick, because our time is limited, I'm gonna do a 2-post. So remember you treat the high shoulder, right? Because you guys said this one's high or low?
Low.
Okay, so I treat the high shoulder, right? 2-post.
So we're doing 4-post?
Nope, I'm just gonna do a quick, unless somebody wants to, actually, somebody who wants to come up and do the other side? Let's give her some real love here if we can, but we got short on time. So you're gonna go to 60 hertz. Who has 60? Let me know when you feel this.
And she's very sensitive, by the way.
Yep. You feel that? I need to know. Are you coming by or are you? Oh, you gotta grab your device. Oh, you're doing the other side as quickly as you can. Let me know about this. You feel that okay? Not too hot?
Yeah.
Okay. And I'm gonna do one more thing. Go ahead and raise your hands over your
I
head.
can't raise.
Oh, okay. All right. How far can you raise it?
Right there.
Okay. All right. All right. And what do you have underneath here? So I'll just do the best I can. So right now on a 4-post, I'm just going to do 60 hertz on a 4-post. On these adhesions where she can't lift her shoulder, what would I use? You might
Scar
remember.
tissue, slow.
And or 350, you need the inflammatory, and remember 350 is deep
Will
scar.
350 do scar and inflammation?
Yes. Now, when you gotta go really deep, like abdominal scar tissues, 77 offers a range that just provides greater restoration.
It provides greater restoration, 77 provides greater restoration.
Yeah, it's got differences.
Yes.
So now I'm gonna do this. So what you wanna do, you always ask your client if they can come in loose clothing. 60. Yep. Mm-hmm.
We found that one.
And you're actually doing that hip. I've already done that shoulder. It's
Feel
a little tricky.
Did you all be up?
Sixty.
If I'm going to take
It's-
it.
Yeah, you just plus, right now you don't like to feel that.
Sorry, it's a little bit snug here.
It starts burning those down.
You know that.
It's at 8 like that.
And when you can't come this way, so remember when you're doing an alignment, ideally, right here at the hip,
Okay, good.
how many inches? 9 to 11, 9 to 12, a dinner plate, and you're gonna go around. So you wanna come into the minor and the major, right? As well as the front and down the leg. Where,
But not to 60.
yeah.
Because that's the reason why we.
Yep, I'm coming this
I'm
way.
coming over.
Yeah.
60,
Keep going.
we're just relaxing these muscles.
So, do you just keep going? Yeah.
You may go under.
Okay, I think one mile, so just a little relaxing. So that hopefully we'll get a little shift and change in the alignment. Why are we using relax instead of 350?
You got 14.
Yeah, I think it's 7.
And what do you want, 77 then?
Are you on 77? No, 6 there.
That's relaxing. Now, why 60 versus 77?
Plus, because of the very body. When they relax, then you can pull them.
You get well.
Where they eat.
77 is so relaxed. Could have done that.
We're doing the best we can with all this clothing.
No.
7 is.
Yes, I know.
I'm under 100 spot.
Everything under 100 is anti-inflammatory. Yeah, so remember, when you're doing alignment, you've got a ball and socket, right? Our goal is to relax everything around it so that it can move. Every muscle is attached to 5 to 7 others. You know, if I had time or we needed, with that adhesion, I'd probably do a little bit up underneath here as well, but we're really about the need today. We can certainly do more, but we're trying to stay focused, right?
Yeah.
So as soon as Linda's
I'm
done,
trying to get her out of pain.
I'm gonna have her walk around while he's set up. He's getting some love right there. What setting are we on?
It was
He's
a
at,
sauna.
he's on sauna 350.
Okay, just a reminder, you wanna lock it in.
What does the lock-in do?
Well, lock,
Oh.
after 15 seconds, it'll revert back to your last
Oh,
choice.
Yeah.
Yeah,
on the pinnacle?
not to, it'll be your last choice. Yeah.
Somebody had.
Evolution.
So the beautiful thing about this is, because we know it's tendon, I'm gonna work 14, a little bit of muscle and a little bit of tendon. Okay, it has scar and anti-inflammatory plus regenerative. The Sonobio 14 is muscle, the Sonobio 10 is tendons and ligaments. Go ahead and, Shirley, go ahead and walk around the table once or twice. Feel a little lighter, Sam? Better or different? Would that relieve any tension? Okay, so it's not. Okay. Yes. So see here, it was playing into the lounge. Yeah.
I noticed that.
Well, she's not having a really hard day today. But she does believe that her alignment is playing into her pain. So point to where the pain is, where you show.
Well, most of the time it's like right in here.
So a lot of where that bubble is, okay. So a lot of times, what is not at the front of the knee? Not much.
No blood flow.
Not much little blood flow, exactly, there's blood flow. Take it a different one.
Okay, here you
You feel that? Can you go low? You feel that? Little bit. Yeah, 38, 32, 35, 35, 85. Thank you. Just trying to make it so people, I'm just checking these tendons and ligaments. So remember, you've got some tendons on both sides. So I got 46 over here. All right, and we're gonna move up a little bit, 37. And Shirley, I'm gonna have you scooch a little bit off the chair so I can get behind your knee. 47. 43. Now, she was bent. These aren't too far off the front. Just gonna check the other side. 46. 52. Right in that same spot. Right there, let's see. Actually, 42 over here also. 51. What was I over here? 36? Yeah, 38. So on the opposite side, about the same point, I'm 51. 54 just on the other side. Can I have somebody come work on this side? Go to 350. And actually, let's go to 77. So it's just your second because we're making the assumption she's got scar tissue because this keeps returning, right? He had an event. You see the difference? I didn't check his alignment. He was playing pickleball.
At his age, and it's current, right? It was a current event, it just happened just recently, right?
Yes.
So it's number 2, Linda, just so you know.
So you're dealing with.
Blue relax.
So 57.
Well, no, we're actually gonna do. Actually, do this one here. I'll explain the difference.
So you're working with her with some serious deep tissue issues, that's scarring.
Maybe too far. I don't know. So this is just blue relax 77. This is in the evolution. All right. So we're just gonna first paint.
So now there's 2 77s.
Yes.
Okay.
You feel this? Not very, okay. We don't need you to feel it super much, but just a little bit. So we're just gonna assume. And is this about the same spot that you typically have that pain over the years? No, this is more recent. Okay. But is the spot similar? Is it always around the same?
Now it is, yeah.
Okay, do you have sound over there, Linda? No, on the skin. When I first started, there was no sound. Right here on this knee. What does that tell us?
Maybe the connections on both balls.
You can check the connection, but mine was okay.
The balls need to be on the skin both.
Yeah, but when there's no sound,
Check your connections.
check your, the tissue is greatly affected.
Oh, that's another reason why.
Right, remember, yeah. Mm-hmm.
Now, Yvonne, it is swollen joint might be a symptom of black clot in the vein. How do we know that we are not dealing with something?
Well, I'm pretty certain it's not that because she recognizes.
Yeah, in her case, but in any other.
Well, do you remember the gal that called me and she was hurting in the groin? The first thing I said is, I can't, we can't touch you. She did have a PMF device, but you can do that, but we wouldn't want to touch her with this. You ask them some of the general questions, have you been flying? You look for a plausible way that it might not be a deep vein. But if you at all suspect it, have them go get it checked out first, or they can use their PMF device. I also would have them do like a nattokinase with niacin. Niacin will open up the vessels. Nattokinase will melt any old stroke, any blood clot, stroke or not.
Is it one product or you buy two separate?
Well, the company Longevity has actually these together. Otherwise, most companies are not putting those together. So I'm having less resistance, and just so you know, earlier, Natalie, when I was not hearing it, it was really smooth. So different than sticky. Remember, sticky and sound are indications, sound being, can you hear the humming? True. Can you hear that? It's humming. It wasn't earlier.
So this is, I get a lot of Z's.
We're painting, so.
I know I was painting, but I'm still getting Z's.
You only,
I don't know.
because you're painting,
Yeah.
you're not in a stationary, you only get the DZs when it's in a stationary. Otherwise, it's always looking to give you information, but in motion, it can't. So we just disregard those.
Just forget it. This is
Yeah,
emotion.
it's in motion.
Ignore it.
Correct.
Well, it's not set into a reaction.
And it's not setting a reaction, but it is always looking, that flex, split shift.
So it's not stationary long enough to actually make connection.
Remember, what happens as soon as I touch this? How many signals does this register? 3 million plus?
3 million?
Oh yeah, 3 million signals per second. How fast is electricity? It's instantaneous.
So keep moving, it's not.
Correct, and you keep moving, it's not gonna connect, right?
Are you feeling this at all? Any little electrical?
Any current, we call it current. Some people kind of are, they can get nervous when you say electricity or electricity.
I can't understand.
Not until she kicks at me.
Okay.
She kicks at me, swats at me, that's why you're doing it, not me. It get a little deeper over there.
So I'm gonna go back and check, see if I get anything here. So I got a 41, 37. So that was just scar tissue, and now we're gonna go to 350 just to do some quick anti-inflammatory. 350. Yeah, so on surf, 350. Now let's see if we can hear any sound.
Okay.
What are we on?
No, it's still.
And I want to change it. You should have 10, and then I want a little bit on 24.
Okay, so this is 14, so now you want on
10, yes, please.
And then 6 minutes.
Actually 10 minutes, then go to 10 and 6 minutes. But go ahead and walk around.
So watch this one, get to 6. And maybe you need to adjust.
I mean, not as No. You should be devotion. Sometimes, and so sometimes, because they put on baby oil and lotion, and I hear the sound, are you making a connection?
No.
So it's not them and it's not your equipment, it's what's layered over the skin.
Well, that's where you want to take your wand and go over it to here, see if.
Okay, let's listen.
Yeah. So is she, is one not pressing hard enough?
Well, I'm not pressing that hard, but
Yeah.
let's just check all your connections. Mary? What power level are you on? 350. Nope, so you didn't power up. So watch, go ahead and power up, I'm at 78.
Oh, that's why.
So stop right about 50.
Oh, wait.
There it is. Here it is.
Around, back.
Yeah, so come on out.
So do you hear it?
So follow
Do you
me.
hear it truly?
Now I can. All right.
We'll hear that.
I can hear it.
Surely. The neighbors next door can.
Okay, let me know if this is too high, so now I'm gonna go back to the back of the knee. Is that too high? Not too much?
Okay, you
I
want
can
to
do it. It should never be uncomfortable. It's you. Okay. I just.
He's not the best, it's like it's too high.
So not a lot of information back here. I have 40, but that's not actually a lot for the back of the knee.
What is a lot for the back of the knee?
Well, I'll usually see higher numbers simply two reasons. One, there's moisture.
Yeah.
You know, so we get that.
It's warmer.
It's warmer, you gotta kind of take that into consideration.
Yeah.
But it kind of lets me know, so what's happening here may not, like his, be wrapping around.
Isolated.
It's more isolated, exactly.
So definitely could be a buildup of scar tissues for the isolation.
And then we're gonna, what we used to do is I would go through, you know, the 6 minutes that he's on and the algorithm, we go through each and every one of those steps. Take us about 40 minutes. 35, 40 minutes, sometimes a little longer. We'll put some pads on her and run with set it and forget it modes.
Yep.
And then I'm gonna have you stand up, see if we elicited a change. Just by dropping information and addressing some scar tissue.
Would this be a time that you want to do a knee brace, or is this a time that you don't?
So, well, I was gonna do something, probably with her nice smooth legs, I might do the conductive pads.
In a better grip.
Well, a lot of people really swear by those, I'm still, there's some ways and the tissue and.
I couldn't connect that very well last night. That's what, is the sleep better than that, or different, or the same concept?
Well,
I like to sleep better. Yeah.
I couldn't make that, I kept missing
Yeah.
spots on my knee.
I feel you.
well, did you get your knee wet or on the pad?
I sprayed both.
Good one, Barbara. Same, better, or different?
And how are shoulders?
I know, I can see that. She's gotta get by, okay, come back.
I want to see her hold the camera.
I'm gonna do that. Same. Oh, so what pain level is that? Well, today, I didn't have any pain, so. So when you say about the same, what, tell me what it is, is it pulling? So if it's not pain, normally it's hard to explain. So it'll be like a pinch. And then it feels like my knees gonna slip up, which it did used to do. Okay, and so the tendon's a little loosey goosey. And so then, like, if I'm on it all day, kind of like him, it walks up, you can have my knee's stiff and I can't bend my knee. And it's all sore, and it just locks up where I can't even move it. Raise your arms. We didn't do, I only did relax.
But I know you did the.
Right, yeah. She likely has, you worked once on adhesions or more than once? Okay. I'm just wondering, well, let's see, we're gonna put something on it and see if we can get some blood flow there and make a change. Okay, ideally, if we can make a change, sometimes for some people that change is a little slow. You guys have seen how quickly some things can work, right? Let's do, I like to do the hip pads. So we have both sides, so bigger pads. She's got a lot of tendon work here, and she's talking about it slipping. So rather than just work on your one spot, let's see if we can shore something up while she's still in healing, right? We're not a one-hit wonder, though sometimes we can do one-hit wonders, but you know, that take for some a little bit more. So the two pump. Oh, for those who are asking about the eye mask without the having the goggles. Well, so we don't have a lot of results from this, but because what they did was place it around all the meridian eye points, there is the belief that this could provide, and you know, for $30-something, it might be worth.
Versus 500.
Oh, migraine, yeah, versus 500, right, give it a shot, you know, depending upon what your, I haven't actually used it on that for anybody before.
Yeah, you want to come back with her, you good.
No,
What questions do we have? Thank you, Gary.
We have Margaret meeting.
What time is Margaret meeting?
Now.
Oh, that's so classic.
Okay, good.
15 minutes, okay.
Oh, what am I doing?
I'm tired. It's been a long day.
Well, hopefully it's been a fulfilling day. If anybody wants to, you know, while we're sitting here, just kind of having these guys sit around, maybe fill out your surveys. And I will be, I'll tell you, for those of you that are, you know, opening new clinics or going back to clinics, the unattended will increase the number of clients that you can help. It'll also increase your, you know, your revenue simply because you can see more. Many of you have been to the clinics, you know, I'll see you in the spot and then I'll put you out in another room or the waiting area, but yet you're still getting the treatment, but it's not my hands on.
Right.
And so, I'm very glad that I did it. So I'm just letting you guys know. And then sometimes, like I said, the fact that we used to have to, no other device right now except this one, you have to run through all of these programs for some of these more comprehensive conditions.
That's the one you use for the eyes?
No. We're doing, that's it right there. So this is one of the face pads.
Yeah.
We cut it and then we kind of soften it. We use it a lot on the hips. So imagine you go one underside or top bottom for a hip.
I use it for the scapula.
Scapula, or, you know, it's just a nice large one for the back. I think, is this what you put on Paul? One of these?
Yes.
Yeah. Please go right ahead.
I could avoid easily 2 of those lines, so.
I like a whole body.
Now you can use your, just know with your 4-prong, your power is now split between the two. So you might treat a little longer depending upon what setting you're on.
Although you have $1, you really don't want full quarters. You really want that dollar to be strong on its own, right?
That's a good way to look at it.
Yeah.
So
What level do I
and
go
then she
to
has
now?
a lot of those.
Oh, where are we?
10,
Pattern
10.
10. We've done 14, 10,
10,
and I'm just thinking if I should do 7 for some cartilage. But let's just have him get up and see where he is.
Okay. All right.
So when you have a patient that has a lot of low.
Well, he actually, he has been
Thank
walking
you.
around. Yvonne, he has been walking around.
How's it feel?
Good. Yeah,
Less than 3?
it's probably about that, 2 or 3. I mean, he has got a little bit of
So
that.
greater range of motion?
Yes, for sure.
Yeah, so you're gonna look for 3 things, actually, I think it's 4. Frequency, let me just get this plugged in. Frequency of their pain, if they wake up every morning with pain, maybe now they're waking up and the pain doesn't hit until noon, okay? So frequency duration, it always hurts from noon to till the time I go to bed. Oh, it didn't start until 3 and it was ended by after dinner. So frequency duration, the intensity, oh, it's always a 7, always an 8. It was a 6. That's progress, right? That's progress. And range of motion. I can go this far before it hurts.
Yeah.
You know, it still hurts, but they're going maybe further than what they were doing. Okay, so those would be 3 things that you know, and sometimes we're focused on pain, we forget some of these other improvements that are occurring.
So it's frequency, duration,
Intensity and range of motion. I had one lady who was really struggling, but so, did you guys see the mallet toes in the pictures? She painted in blue.
Oh, yeah.
So when we started working on that, I had another lady we were working on. It was either the knee or the hip, and we were kind of struggling with her a little bit. But then she comes in and she says her toes had been curled under, and they were no longer. They were like in a state of spasticity. She didn't know why. I don't know that it was hammer toe or not, but that I was working up. You remember, everything flows down, and she had a change. And we can't always control where this is going to help, especially when you're working in the trunk. The body has its hierarchy, and it will always attempt, if we're working the organs, to improve the tissue that is most vital, and that's the brain and the organs, right? So we're going to work a little bit of tendon with her. Let me know when you begin to feel this truly. Okay. I see one. Does anybody else see one?
Yeah, it's not fully attached to. And it's touching.
Oh, no, that's okay. I saw this, and for a second I thought it had slipped out.
Oh.
Okay.
damage just from all the years that you've dealt with this?
Sure, but she did feel it pretty low on the Y1. On the Y1. So I'm just gonna reposition to double check. Good tonight. Go ahead and stand up for me. And then want to go to what down. Sorry, the last one, I just see where you are. I'm gonna do either that or so you can feel it. So
It's on
There
Zoom.
you go. You feel anything? And are those wet?
Yes.
Did you feel anything in the beginning?
Yeah, oh yeah, 13.
Maybe we can get a little scripts on him, right at the point of
Yeah.
pain. I just back here, I just wanna make sure that he stays moist back here for connectivity.
Peppermint. That's perfect with that.
Okay, yeah.
Right. You're okay, so I have it on the.
Usually just like, wait.
Well, because I think all the oil stay on the
Oh, that's true.
off
Are
sleeve.
those pads
Yeah.
sitting off into lotion or something?
That's what I'm thinking.
I know, I'm trying to just.
What about the gel?
Yeah, the gel could be something. Another thing you can do is, when you have that situation, you use something that's most active, give the wand to the client and have them hold, and you can have them move it. That'll actually be, it'll treat the, direct area a little faster, but I also wanted to treat the surrounding tissue would be ideal.
Yep.
But you do what you can in the moment.
What about the small stickies? They're like those little ones, we keep the little stickies?
Sure, yeah.
Is
Let's see if we get a little better conductivity. Thank you, that's a good idea.
And always make sure when she hands you something that maybe it's turned off.
Right.
Who likes to shock you? Oh, wait, we don't shock.
No,
We love.
yeah.
You're just-
Feeling a little bit more?
I know.
You feeling a little bit more? Or bend the knee a little bit?
No.
Okay.
Is that the peppermint one? My question was, won't the oil be on the fibers?
Good point. You can hand wash these. You don't want to put them in the washing
For the
machine.
oil.
They turned it up.
Ooh.
Oh, I didn't say that.
Well, and so that's conduction. Hydration is, you just saw conduction in action.
No, it's.
The jokes.
Oh, great.
Gary keeps getting ready. I didn't spray this one.
Yeah, boy, you're.
Oh, we did
Is it bothersome for you, Gary? I'm
Just
so
a little bit.
I'm sorry.
You
No.
still have Dr. Pepper and you have full bench.
Can't because it's bad food. No carbonate.
Yeah, here.
You can't see, it's not me. So in a minute, I'm gonna show you a great picture when you're working with needs.
It's random.
Wow.
Well, it is on it, and this one is Vaso, it's on an algorithm, and what is this one trying to do? What's Vaso or fMRSI trying to do?
Oh, yeah.
Yes.
Yeah.
Yeah.
And it's funny.
I gotta feel it now, and all of a sudden, boom.
Yeah, so it's going through that algorithm.
Okay.
Yeah, so.
So
Keep that
it's
on.
probably the lotion.
Yeah,
So at this time, it's time to soak
Yeah.
the water.
Is she not feeling that either?
yeah.
Oh, wow.
That leg's dead.
Yeah. Oh, that's interesting.
Pretty quick.
See, I'm gonna use that.
Are you feeling it anymore?
I'm feeling it. There's a little something there.
You say water?
Choosing to be a little
Soap water.
water.
Soap water.
So in the meantime, when they have you hold this. You feel this? Yeah, I'm dead. You feel it? I haven't felt it earlier.
You like tallow? What kind of lotion do you have?
Okay, I feel it.
A mega lotion.
It's called Gold Bond.
Oh, it is a real thick
This
one.
is really.
It is thick, okay, that's good to know.
I want to show you a picture, so whenever you have a knee, you're gonna feel a little more confident about where you're working. Am I sharing? Shall I share? Okay.
I'll do the other one. Oh, that's okay. Never mind.
I've got these, I have these in my,
You're gonna like water before you can get home and install it,
She'll not work.
We have
You can feel all mine. Okay.
that you're taking and then I'm not driving and.
I start wearing diapers.
okay. Can you see this picture okay right here?
Yeah.
All right, so with Shirley, her high numbers are actually right here at the ACL, this area, or the ACL is actually right there. This guy right here. Oh, let's see what it's doing.
Yes.
We got connection. We
Yeah, we have liftoff, yay. And then this isn't showing, so I typed in something very specific, so it's not showing me all the other connections here, but she's somewhere right here. And we've got something that's just, swelling. She said that her knee moves. So these ligaments right here, remember ligaments go bone to bone, tendons transverse from the bone into muscle, right? But she's a little loosey-goosey here, and we can look at her ankles also. Her ankles are starting to, so that's a tendon that is overstretched and thinning. When you've got plantar fasciitis or carpal tunnel, different minerals are missing from the body, but that'll be shortening and pulling and thickening. So that they can, and you've seen like the Dupuytren's, right? You can feel that thickening. Yeah, different minerals are involved. They're the same tissue issue. You just got to get enough of the nutrients. And then, of course, there's a little bit of cartilage in the knee. So I want to be sure, I think we treated you with bone a little bit, right? So also, remember, you're on the pinnacle, you have bone. That is the only setting that has cartilage in it. Okay. But look up if ever you need, and this will help you just be more precise. When you're working. Well, the vaso would be different.
Oh.
Yeah, you did 3, and so we can have him stand up, walk around, and wait, Margaret, hold on. Okay, we're gonna say congratulations to Margaret. So let's get a little picture. And I'm just gonna do a quick read. This certifies that Margaret Goose has successfully completed all required coursework and has demonstrated proficiency in the curriculum for basic microcurrent level 1, basic microcurrent level 2, mastering the foundational principles of microcurrent applied electrophysiology with biofeedback, using the methodology of Dr. John Hache and the nutritional foundations of Dr. Joel Wallach, presented and given under our hands this 26th day of October. From me and our administrative, Ms. Michelle Busey. We couldn't do it without the backhand. I just want to say thank you very much. Where is Michelle? And she's been doing a lot of the audio as well. Thank you. And then where's Miss Gina? You guys ragged, haven't you?
You know, we're. Oh, Lord.
Thank you. Oh, you're discreet.
Camera now.
There's another.
Right?
It was fun. Thank you guys.
Thanks, you guys.
We all are. Okay. Oh. I wouldn't walk around before I take those off. Once we might add an extra to the back, it's just see how you feel. Same, better, or different?
Oh, a lot better.
Oh.
Wow.
Yeah.
Get him on testimonial now.
It was great.
Where's your phone
I
now?
know, right?
Yeah. No, that was awesome. It's amazing. Yeah.
Sorry.
Good news. So
Mark, go ahead and just gently give a little bend. I don't want you to overextend. You are still healing.
Yeah.
And that'll be one of the things with your clients is they feel so good, they go play golf. Or they go do, and then sometimes they re-injure. You are still healing, but as long as we can keep, remember, inflammation is a precursor to pain. As long as we can keep you at lower pain or more pain-free, it just has a faster opportunity to heal. Take in some extra nutrients. If we happen to have a packet of anything that we can give him to take home, do a foot detox tonight. Half a cup to a cup in a foot bath, or 2 cups in a bathtub. And any nutrients, we can put stuff on you that right now you're getting up to 400 or 500 times blood flow. So yeah, give him that. That's fine. Give it to him if he can take it. That's fine.
This is 90 essential nutrients for one day.
Oh, thank you.
Yeah. So give him water.
Juice plus, veggies, what do you think?
Yeah, that's fine too. Yeah.
You know the rest.
Yeah, but I put in, while this is going, give him some water, at least take, 2 of those, maybe in 20 minutes, take the other 2.
That'd be easy.
Yeah,
Okay. I
you
have
see-
water in the front, yeah.
Perfect, yeah, and so, you okay to tell us a little bit about you came in pain as such, and now you are such?
Absolutely.
Would you say like, take a couple, 2 or 3 days and just kind of.
You guys come stand next to him. Cause this is this,
Oh, thank you.
are you okay if they share this?
Of course.
All right,
I'll let Paul be the man.
Would you like me to do that for you?
I'm just a supportive wife.
all right, so, Mark, tell us what happened when you came in.
So about 4 weeks ago, I hurt my knee playing pickleball, although I didn't know it. Excuse me, I woke up in the morning, lots of pain, lots of inflammation. I could hardly stand on my leg. And so I know Paul and Adela, they're a group of friends, and I just mentioned the injury to him, and he invited me down for this therapy. And so I came in here, my pain level was probably a 6.5 out of 10, 7 out of 10, and I had minimal flexibility in it. And then after doing all the therapy, I'd say my pain level now is probably about 2.5, and I have complete mobility, which is amazing. Like I actually just did a partial squat, and I didn't feel any pain at all. So this was my first therapy session.
And what type of therapy is this that you just received?
Electric microcurrent therapy. Yeah.
Well,
I did the one, and I did the sleeve, and I got up to the point where it was like 250 power level. And it was a tingle. It felt good though, and I feel great right now. So, want to go out and play some pickleball?
No.
Play some basketball. Yeah, and then I'll be back. Thank you, Paul. Yeah.
Academy, Paul, what's going on for you with this?
In terms of just learning the system. So we're just learning as much as we can about this, and hopefully we're going to see what we can do with this in the future. We're discussing all sorts of possibilities of what we might do with this, and working anywhere from family and friends to opening up a clinic someday, so who knows? What the future holds.
Well, very good. Big claps.
Thank you.
No, thank you.
So we cannot get any further. Still not, because she fills it with the base, but nothing with the pads.
Okay. And get better shit later, the
Yes.
So we'll just do, the one,
Dog.
Hey, Glenn, real quick, so the recommendation that 2 or 3 days, just kind of just relax on the leg, not doing.
well, because we don't have an image,
Right.
so we're making an assumption based on what you said. Yeah, I'd give it a couple days, especially since pickleball is, pretty active and strenuous on that. I'd make sure that you, if there's any, just the inkling of some small tear or something, hopefully it was just an overstretch, give it some love. You already take supplementation?
The only thing that I take is glucosamine.
Okay,
My wife bought like a joint supplement.
okay, glucosamine, and what about some gelatin in there? Glucosamine and gelatin are really good together.
Okay.
Yep.
Yeah.
And then I might go back and talk to Paul about getting some additional vitamins while you heal. You'll heal faster, you'll be stronger,
Okay.
and you'll be able to play hard again. But if you just restore to where you were,
Yeah.
and did you just jump into it? Have you been playing for a little bit?
No, I've been playing like 6 or 7 months.
Okay.
So a couple times a week typically.
Yeah.
And so.
And there's been no problem in that area.
No.
Yeah. So we want to keep it that way.
But I mean, even doing this, I could feel it. But
Yeah.
even now I can do this, and I was like with zero pain when I do this at all.
Good.
Yeah.
How long can you expect that to feel that way?
So, the company says that they can do, pain relief up to 12 hours, but we'll see people go days, but sometimes somebody might come back the very next day and they note pain someplace else. Again, sometimes that was just masked from the other more, stronger pain.
Right.
But we see things that we don't typically see with chemical reactions in the body, okay?
So
I've had people not return. It just, everybody's body is different,
right.
but we dropped the inflammation. We didn't treat any scar tissue. And you don't want to treat scar tissue in the first 72 hours of an injury. This happened how long ago?
4 weeks ago.
Okay, so, he got, Sonobio 10, 14, and 7. So all 3 of those treated scar tissue on those specific tissues. So he did get scar tissue 3 times. Okay, along with inflammatory and then regenerative in 18 minutes.
And is that a typical treatment typically where you do that, like the scar tissue, regenerative?
Well, because it's been so long, a little bit of scar tissue, absolutely. Typically, scar tissue, this was a recent event. It's not like you had long-term build up over time. It keeps happening.
Yeah.
Kind of scar tissue. That has a little more layered effect.
Right.
So I would have treated you like I did her in that way.
Oh.
And that's it, we actually got to see 2 types of.
Yeah, that
long-term.
very different.
Analyzing each individual patient, because every patient's different, and then applying the therapy.
Exactly, and those will be those core techniques. Know the core techniques, and you can begin to then muddle through. All right, this didn't work, or this only brought it down this far. And that's what I'm sitting here doing with her, because I'm getting little change. So.
Yeah.
And in 3 days, it's like, oh gosh, it's really hurt again. Would he come back to see you?
So you got a couple choices. You can come back and see me. Oftentimes, when I have an injury like that, a lot of times I don't have to see them maybe one more time. I do use some of those stem cell patches that I might give you 2 sets to walk away with, because what it'll do, it keeps the inflammation down to continue the what's going on. So like, if you woke up tomorrow morning and there was some pain, I have him immediately put those on, just keep that information down for as long as you can. He's still staying off of it, and then maybe even possibly the next day. But now he doesn't have to come back to me. You know, and now he's got another tool that, hey, can I swing by and get a couple more to hold me? You know, you'll find some people, they've got more time than they've got money. Some have more money than they've got time. And you will not have enough time to treat. And that's what happens. That's why I'm doing what we're doing.
Right.
Because I can't treat everybody. So like these stem cell patches have been great. Or the pain patches, the military pain patches. They have helped you extend from seeing me.
Got it. Yeah.
You'll pay me more than you did the $6 for the patches.
Yeah.
So does he take those patches with him now, or if he experienced the pain, did he come back?
I don't believe I have any here, so I can't offer it. Did you have some? She had some. Oh, so, and that's why you put a rubber band, and that's why you put a rubber band on it, and you turn it off. I touched the plate. I shot the plate.
This.
And, okay, did you see how I jumped and she didn't
No, I
get that
didn't
one?
Wow.
I definitely want you to put patches on mom for me,
Okay,
but,
here, let me just
I
see.
realized I had a couple with me.
That is crazy. You jump like that and she doesn't even feel it.
So that, we were at full power.
Yeah. Is that an inflammation scarring?
I don't believe, what we're gonna try, did you clean it?
Yep.
You cleaned it? Yeah.
Salt and water.
So we'll see if maybe we got a difference. Anything wrong with this? Steve?
No.
If I know I'm gonna put patches on, I actually will put it on before I treat. Because then you know where to go. Okay, so there's no chemical in here. This is just it's light.
Yeah.
So much like my ring, they put little tiny crystals on here. And when I shine in the sun, I get a prism, right?
Right.
Well, you remember geometry and math in school? They can now produce your own anti-inflammatory in the body via light.
Wow.
So it's a signaling molecule. These were designed for the Navy SEALs back in the late 1990s. It was a patent until, I don't know, 2010, I'm not really even sure. Now a lot of people, and so you've got a lot of pain patches, there's certain medications on them. Menthol, eucalyptus, this isn't anything like that. And I probably patched 200 people, and I think I only had about, to date, 10 that didn't respond. Some of them was about hydration.
Yeah.
A couple of them, you kind of find, is this on the nerve line or the meridian line? And that's usually why I patch before, if I think I'm gonna send them away. Okay, I'm
That's what you
between.
guys in the gym do that. Wear these patches all over together. Yeah.
So you're down to a 2,
Yeah. 2.5.
so point to where the pain is, still same spot?
Yeah, it's right here, but honestly, ever since we were doing the therapies, I seem to have more reaction behind the leg
In regard to,
to the pain.
it's dropped, but you feel it.
Yes.
Okay, so these adhesions are not that great. I'm just gonna fold. You can use a piece of tape. We're just gonna check something.
And you weren't feeling it behind the legs
What level
much.
is it?
Yeah.
What level is that?
Right now, 2
Okay,
is super low.
now he's got a little bit of hair. So,
Not
I'm gonna
anymore.
place the brown on the point of pain. And then like a clock, this is the center of the clock. We're gonna go, 12, 3, 6, 9. See what gives him the most relief. Because again, it could be a meridian, it could be a nerve line. Go ahead and walk around. Same, better, or different? Give him 10, 20 seconds. It's heat activated, don't put it in your pocket. Okay, yes.
The pain level's gotten so low, that's,
Just since putting that on?
well, even before that, that's kind of hard to decipher.
Oh, got it. Well, that's how you would use it.
Okay.
And you want to just, again, think about 12, 3, 6, and 9.
Points and block.
Yeah, and you go back to the one that gave you the most relief.
Got it. Yeah.
Okay,
Makes sense.
all right, so you can take those off.
Put them on tomorrow morning. Take them with you.
But unless he starts to feel pain tonight, you know, we just want to keep the inflammation down.
You get 5 of them?
Not today.
Okay.
That's just what I had in my bag.
Around the 12.
Correct. Yes, so you're gonna go around and whichever place gave you the most relief, you'll come back
Back
to.
to, right.
Yeah.
And but the brown stays the same.
Yes.
The brown stays where the pain is.
Right, and this is just the point.
Yep,
where
and
you
you
know,
just, yep,
1236.
yeah,
Okay.
and those are approximates.
Got it.
Now, if you wanted to buy more, where would you purchase them?
I can get you some, I can get you a link,
Okay.
or Gina can get you a link. All right, so we're gonna move
I
on.
Real quick before I,
Yes,
do I owe you anything for today?
no,
Are you sure?
everybody got enough pictures? We get your testimony, how about that?
Okay. Just wanted to-
Send us, say, tag him or do whatever you do.
Full invoice, you don't worry.
The bill's in the mail.
Oh, the heat out there, okay.
They're behind you.
Yeah, so be.
Vanilla pain
They're
specials.
Oh.
I want my one, I want the. And so we're gonna try to see if we're getting zero change with Shirley. And that'll, you know, that does happen occasionally. Or they come back for the same, do I have it?
It only has to stick for. Oh, you
I
should.
think I'm taking off.
Yeah. Yeah, they get the razor up.
Oh, so,
What if you take?
Yeah.
Yeah,
take-
use tape or you can put a Band-Aid over it. This,
oh,
Once you've developed where the pain is, 12, 3, 6, or 9.
and you do get, the company says or guarantees like 12 hours of pain relief.
wow.
Some people will do 3 hours, 3 hours, 3 hours, but you're gonna need something like a Band-Aid.
Yeah.
Don't use Gorilla Glue.
And I do mine at night.
Oh, so,
Because I do my lower back,
yeah, so you're not moving around.
so I'm sleeping, and I get up and I feel great. And then but you have to, time out the hours.
Yeah.
So.
Wow, good, cool.
All right, buddy, we'll see you soon.
Yeah, thank you, Paul.
All right, man. Right on. You bet, man.
Yeah. Everybody, nice meeting you all. I'm here. I know. See you later.
Read your commentaries.
Thank you. Thank you so much. Yeah. Absolutely.
Oh.
Drive safely.
The pads don't work.
So this is going through a little bit of an algorithm, so you're.
We're gonna do a review.
So we're gonna just finish up here and let her go. We'll have Q&A and then we'll give you your certificates. So I'm at 250. And she's feeling it a little bit. So for her, for some reason, the conductive pads just weren't working. So, as long as you have enough time to try with your client. People will back to back with girls. Is it this one right here? And as it starts moving things, make it stronger, so don't hesitate. Fill this out, okay?
Thanks for today.
No, I filled this one out yesterday, yeah. We asked her for every day. But is the same questions?
Yeah.
So this is what I want to see variation, that's a cold laser.
I think that's what it's ever today.
Okay.
So another tool I'll just point out, Gina's using a cold, low-level laser. And we got those, Danny got those, introduced us at the Tesla conference. and they went right through his shoes and took away his pain. He used to show up to work, and the guys come around to the microcurrent, they're all taking their socks and shoes off.
The other vendors.
And well, and his partners in furniture. And he found this one, and it goes right through the shoes, so. Helps a little bit with pain. Have you been enjoying it? Yeah. So again, just put some tools in your toolbox.
So easy to carry too.
Yeah.
Do you think the next Black Friday should be the?
That's
On the.
You've done such an amazing job, thank you,
Because Canada, they're
So is it getting stronger? Good. That's a good sign.
Can you, I think that Thanksgiving.
Okay. Well, is it this shoulder? No, we're gonna wait this moment. And then figure out where she's hurting. So I need 6 minutes, okay?
Does anybody have any questions or anything at this point?
I think they're all filling out their surveys.
For a couple of months, probably sent plastic done for a month.
Nice. What part of you living? Are you close by?
Yeah,
What made you say get this one?
well, I liked it because it had the brush and the tongue. I don't know what that is.
That's just the back of the, like this.
It is?
Yeah.
Oh, but it's smaller.
Yeah.
Okay. And then the arrows, and this is really. And so.
You wish you had, said this was the other one.
Never.
Mary.
A little bit more.
Yeah, that's, I don't feel this is many.
Yeah.
A year. And well,
I know I wanted. I think it's what it's doing.
If you want to get your vision up there, first, then hold on.
Yeah, I can help with that, but, also know this, if you choose, the amazing thing about this thing is, if you choose to, upgrade, you can actually turn your device in. And I know for the Genesis, it's full, for the Evolution, it might be a little less. Forwards, whatever next level that was, they didn't have that when I got all of mine. But like you guys, I started with several of the low ones, some of them they don't even make anymore.
I saw that on the website, you could turn in and get it up, you get an upgrade.
Correct.
Yeah.
Yeah. And now I will tell you what's that.
What's coming on the right here?
So, yes, and as I best understand it, but if you get a chance, watch it. I'll try to watch it. I can't remember the time frame. He is coming out with a new chemical.
Oh.
But as I understand it, it's going to be more of the set it and forget it. It may not be your best choice for clinical.
Okay.
Because we can do a lot with. You could certainly sit and hold on any of those set and forget it's on your device. But there will be a few things that are different. And I think that they're looking to, enough people are asking, can I just get some of those Sana bios? And the price was right around 45. So it was significantly, you know, 1,200 less or something. 1,800, I'm not really sure, but, and then there'll be a sale. So, you know, put my code in and you'll get, if there's a sale, you won't get my code, you'll get the bigger sale. And typically, I don't think I've ever seen him go more than 15%, but. Black Friday, Black Friday, yeah, you never know.
What's the point if you have a prescription for it?
Well, FDA states that these are, well, they are class 2 medical devices. And so.
Can we go on based on our own certification to buy, or does?
Oh, no, you know, just put my name down and you got it covered, yeah.
But then I know because when I was filling mine, then it asked for your prescription number. So.
Well, if you're working with me and Rob, it should be covered. So I wasn't aware of that, and I don't know why that's, okay. Yeah, then I can input it for you.
Okay.
And that could be a change, it's had hers for a while.
All right.
So that's.
Yeah, they said it's very popular, not asking for it, we don't know until we do it, right?
Right.
You're aware.
Well, and I think it's,
So,
yeah, we're already working with the company and.
I don't know, this, it doesn't say when it's.
We just got. Go ahead and. Look at it. And I. Part of the theme there.
Oh, I didn't even know there was one in the back.
Oh, I'm just like, that.
No, I'm not.
Okay. That's, well, then ideally, you do have some. Yeah, I like all of that move out.
Really bad.
Yeah.
Right.
That's what that. It's so much. Gonna be able to get a shot. I'm just gonna slide. Have you noticed if you put your feet up? Then you go.
Yeah.
We have a couple more people just filling those out, okay? So she's on, 24, which can help with swelling. And she said sometimes it really is, so something's aggravating it, and then it will stop.
She knows, she's
Yeah.
seen it.
Okay. Yeah, and the other cycles haven't. Have you worked on it?
Well, she's a great relaxing patient that lets me work on her constantly.
Did you hear that?
Yes, I did hear that calmly, as she states it. I'll have to print out. I was trying to do it online, but I'll print out the survey. I think do I have the survey? Is it called the testimonial form? Is that what it is?
Testimonial form, yes, please. It has a little, our mascot bolt,
Okay.
little blue lightning with a graduation hat.
Okay, yeah. I thought I could do it on my iPad, but it's not letting me fill in the lines, all of them.
Okay.
I'll just print it out and write it in and copy it and forward it to you.
So she lost 80 pounds.
Good for her.
Congratulations. And she's been longer.
It's not true, my teeth are still.
Oh.
Well, you know, it all is just
Maybe they also did on the way.
Just throw everything on the table, I'll get to it later.
I know.
okay. Yep.
Okay, so as soon as we get all of our reviews, we'd like to give you your certificates if you don't have any other questions.
You will now. That's rude. I like the, phone idea.
All right, now, and how do we get, can we, highlight Mary?
Yes, if we can.
No, I do everything.
Okay.
He's clothing.
I wish they.
Anybody home, Mary?
Not yet. My daughter is on her way back from India. So my
Oh,
husband.
wow, that was quick.
10 days since we.
Wow.
Do we need
Wow.
to wait to be married at the end then?
How quickly will she be home?
Um,
Are you talking minutes?
well, they're on their way. I'm not quite sure.
Oh, okay. You
There
know,
you go.
well, we'd like to present your certificate. Would it be best if we give it to you now, or you want to wait till the end and maybe your family will walk in?
Oh my gosh. They look like they're still probably a good 10 minutes away. If not more.
It's your call.
We could do it earlier.
Do it first?
Yes, that'll be fine.
Okay.
I forgot to mention in my, review how nice the people are here.
Oh, yay. And,
You on camera?
I'm just gonna ask Donna to come in. Who's there?
We do.
Yeah.
You have the bottom.
Oh. The old days. The projector.
See, I'm on my relaxation now, and so everything's dropping.
I used to train.
So-
Your software.
So, first, I just want to say, let's give Donna a round of applause. You gotta want to talk for everybody, but you want to give.
Okay, you have to move out of the way so we can see, we can see Donna this way. For the camera, we're here.
So she runs the joint here. She was one instrumental in helping me make this happen for you guys. Some of you know that, we thought we were gonna be doing something else and, that kind of fell through. And this came up rather quickly. And she was, instrumental in helping me make that happen. So.
Oh, very nice.
Thank you.
Thank you, Donna.
All right, here, we do that. Over there for pictures. All right, so, what do we got?
Mary?
Yes, we'll do Mary. So I'll let you read.
Sir, show her.
Mhm.
So Mary
Yes.
McWhorter, this certifies that Mary McWhorter has successfully completed all required coursework and has demonstrated proficiency in the curriculum for Basic Microcurrent Level 1, Basic Microcurrent Level 2, Mastering the Foundational Principles of Microcurrent Applied Electrophysiology with Biofeedback, using the methodology of Dr. John Hache, DNM, PhD, and the nutritional foundations of Dr. Joel Wallach, MA Postdoc Pathology, DVM, ND. Presented and given under our hands this 26th day of October, 2025. Congratulations, Mary.
Congratulations. There you go.
Thank you.
And we will be sending you your, t-shirt,
Okay.
probably not the balloon,
Yeah.
and the packet.
Okay, perfect.
Well, there you go.
Thank you so much.
Oh, look at you.
And look,
And
we have,
And we already
And
Well,
then,
that's very enjoyable. Thank you.
Don't work well together.
all right.
Oh, that's the.
So now-
Oh, I know.
Not very cool about
Oops.
They got out of order.
They got out of order, I apologize.
My husband's really
All right.
We'd like to play this.
Okay, here we go.
Yeah. He's enlightening.
Here we go.
Enlightening.
Somebody's,
Oh, it's my dad's watch.
oh, okay.
So Linda Perez Larson, please come up.
Yep.
Yay.
Thank you.
Thank you.
Good job.
Congratulations for your help.
That's a.
Absolutely. Oh, wait, Linda.
Linda, listen. I'm sure that's, we made it.
Right here.
Yeah. They call it the main class?
Oh, that's.
Yeah.
You told me made it and I gave it some.
We need the balloons closer.
Okay.
There we go.
All right.
Well, hi there.
All right. All right.
Yay.
Tanya Tilton.
Oh,
You just heard about it.
oh, yeah. Congratulations.
Thank
Yeah, line that, yep.
It's right here. Hold it right here.
Hold it.
And body cancer.
Huge.
Yay.
Yeah.
Oh, Mary's up there clapping for you.
Thank you, Michelle.
And I'll tell you, Tanya has been instrumental in helping her community, with microcurrents. She helps in all kinds of ways. And I just think, working with people like her really helps make what we do even easier. Because
to you, I'm able to do that.
But it's.
Michael family.
Take it away and treat you.
Well, and she brings in neighbors, they talk to people at the gym and the restaurant.
Community Hawaii.
She was ready to get on the plane.
Oh, I would. Okay, no.
All right. And now we have Gary McConnell.
Gary.
And then Dr. Pepper.
Doctor.
You guys are hard.
Yeah.
The blessed Captain Crunch.
All right. And Paul Sanchetti.
Please, no speech.
Oh,
Thank you very much.
And we're looking at the other, photo right there.
Mhm.
I gotta get John in, that's my limit.
Yeah, but soon now, girl. Thank you very much. Thanks for
Absolutely.
Congratulations.
amazing.
Here you go, it's yours.
Oh, yeah, of course.
Get your bill. And oh, I wonder who this is. Adela.
No speech.
Pictures.
I'm gonna say, this is my speech. I had my girlfriends praying for me on Thursday before I said, I've not been to any class like in umpteen years. Can I even stay awake?
Did it. All right. 2, 3. Take a couple.
Yeah.
Yay.
Thank you.
Oh, good. Well, I hope to see you guys in the future.
Oh,
yeah. Yeah.
You know. I didn't mention. We need to have a 1-year reunion. I like it. It's so good. This kind of reunion where we help her. When she does her 1-year later class, we come back to help her.
You think you're not
Exactly.
all back.
We come back to help you on that 1 year.
Yes. Yes.
I love it.
We don't do the
You got a new building.
More care.
I got that over there.
You'll notice that Yvonne,
We're gonna hire that
I'm
out.
not sure your screen.
so you'll notice that you have a specific certificate number.
Okay.
Yeah.
So each of you has a specific certificate number.
Oh, okay.
Oh,
What does that mean?
it means everybody has a different number. They started with 1. All the way through 2,406 with numbers. Well, and also if somebody ever, part of the reason for doing that is in the event somebody ever claims to have had it, we can go back and look, showing the certification and the date. Remember, we are attempting to be accredited. Helping make that happen, we'll turn in, so thank you, what we did. And the nice thing is I don't think that the Zoom's gonna count for it. It will be about the coursework. Yeah. Your reviews, and so I don't wanna say that because I want you to be honest.
Yeah.
We know that there are hiccups, so there will always be, but, the big thing is I hope that you feel good about the applied part, you got plenty of hands-on, and you really feel like maybe what microcurrent at the beginning of what it's about, because, these were the more basic classes.
Yeah.
But once you start applying a little bit more and you're ready for the next step, it's a go from there. All right.
Possibly a refresher course.
Yeah, you're always welcome to come back for the refresher. Sonia, I think, has done all these classes individually. And you actually find or remember new ways to use your equipment.
Oh, it's on the wall right when you walk out the door.
3550.
We did a refresher course in Florida.
Yeah.
Paul and I are so wide. You gotta get that.
It's not called the Thank you. Will do that.
Yeah.
Sorry.
Are we all off?
No, not yet.
And
So Michelle.
oh, yay. Michelle with 1 L.
1 L. Well.
With 1 L. Michelle with 1 L. Thank you.
And we need a picture taker.
And double L Michelle and 1 L.
Picture.
I'm double L.
She's a tech.
Not
I will do it without you.
Ditto.
All right.
Oh, Michelle? Yeah. Do you want this? Oh. Right.
We're both MB.
That's crazy.
Our initials.
And
Kind of scary.
So we're gonna, let's do Gina. We're waiting for your mom to come back. I think people might want to go.
Oh, no.
You got 2 minutes left.
No, you're not leaving for another 3.
And then let me just have you stand here, and I would like to present yours. All right, Michelle Ford Busey, congratulations. You are now Microcurrent certified.
I told the best story ever of what my
Oh, holy schmoly.
Holding my hubby's hand for the first time ever. Well, I think she might be talking about the ONJ.
You know, both of them. I went
Yeah.
home and since I told my husband about that.
Yeah.
It's really, woo.
And you'll get a free
Hey,
book.
guys.
Yeah.
And I do want to invite you, I have a business Facebook page. It's called For a Better You Too Wellness. We have not yet, some of that social media can be tough, so we don't actually have a Microcurrent Academy at this time, and I may just incorporate the two. But I invite you to go grab some of those pictures. Even though they're not your client, this is the work that can be done with what you have just stepped into. And so you can just either use my words of what happened, or this is what we're doing in this microcurrent community right here in Sacramento, California. For Better You Too. I do have some YouTube. Oh, Mary, your family's there.
Yeah, move up. Hi, this is Ariel. She's in from India.
Left, but
This is our group that was training. They all know.
Hi, everyone. Nice to see you.
here is the certification.
Wait, she's coming
Oh.
back.
Yep. That's the certification.
I don't know what we can see. I see.
Too far.
For better for you.
Yeah.
For better.
Look at her number.
Yeah.
Can you see her number?
What?
For better you.
What number?
Let's see what she is. She got my glasses. It's 10-2-6-2-5.
It's the one before that.
She's I think it's 6.
Yeah.
Number 6. All right.
Very good. Very good. Thank you. Thank you. This is the lady that.
Is it for a better YouTube wellness resource?
Yes. Yeah.
Facebook, yes. About a friend Thanksgiving thing, and you were going to get back to us. What was that?
Yeah. So, well, I was saying usually this is what we do, and then we also have a Christmas exchange. I don't have a date right now for the Friendsgiving simply because of a transition of classroom and the transitions that are going on construction in my home. It's been a little bit delayed, but if that's something you guys want to do, we can probably pull that together. It's typically around the second week of November. Okay, and it is a potluck. I'll do. Yeah. You bet.
Black Friday.
Oh, first week's Black Friday, yeah.
And second will be Friendsgiving.
Yeah, and so whether you have questions on accessories or devices themselves, use that code. It's going to tell them two things. All right, they're working with Yvonne, and I think that may be the way we've got around the prescription, and I'm not really sure what happened with her, but that was several years ago. 15, yeah. So if he's offering something less, you're going to get mine. Okay, you should get mine. That's typically what has happened in the past, but I don't get to control that. But just keep it also for any additional accessories. All right. Thank you very much. And
Thank you, thank you.
Real quick, since you can see on that side, is she focused still?
Oh, yeah, let's see. Stand up nice and tall with your feet together. All right, can you guys tell, where are we? Same or different? Oh, better.
Oh, much better.
We're even.
She is in her shoes this time versus being barefoot.
Oh,
Pop
yeah.
shoes off.
Right. Pop your shoes off.
But even then, her legs are more,
Parallel.
here, whereas before,
We're even.
you could definitely see that on the
Stand-
left side.
Stand on both feet.
Just a little bit, I see.
It's on her right leg.
There we go, take it.
Stand on both
Anybody
feet.
take a before picture last year? Okay, but she's gonna take
Yeah, that's a big difference.
Mhm.
Excellent.
What brand is she been wearing?
They're cute.
Well, that, no, you know, they support your foot really well.
I don't know, I can't remember what.
That's really helping the carnation.
Yeah.
She has quite a fasciitis. Had.
Clark's.
Had.
Oh, okay.
I don't know, Clark are great shoes.
Well, those definitely like help that foot.
Do you want me to put these on over
Yep.
your shoulder?
So lift your arm up. Both of your arms up.
Wow.
Thank you. She said she couldn't lift it up. Lift both your arms up again.
Oh, ask, go ahead and get a picture.
Wow.
Don't lift it so it hurts. Just have it so it's comfy.
Wow, that's, wow.
Better.
Better than a.
Yeah.
Woo,
Now get a picture, where were you before? One more, Michelle, back up, where were you before?
Fix them after I fix them.
Well, yeah, not holding this.
Okay.
Do that again.
So do it one more time, so I can get a picture. One more time.
Yeah.
About where you were before, but about, I don't know. It seemed to be, I don't know, it wasn't higher than your,
Yeah.
yeah. Oh,
Do it again real quick.
Just.
Oh my God. Right? Now I have documentation that it works.
We actually did not use like 350, which is what you would use for adhesions. We used 60 because we were doing the body line. So do you have 350 on yours? No. All right, well, let's maybe get her a little 350 or, there you go. All right, well, you're welcome to stay if anybody, has any questions or wants any work done. That'll be for the next time. Thank you.
Thank you, Yvonne. Thank you. I'll be in touch.
Yeah. Just now.
Gina, thank you so much for everything.
So much fun.
All right, thank you, Mon. Thank you for everything. Okay. I look forward to it.
Passable to the year.
Are you too?
Nice meeting you all.
Nice meeting you.
We'll see you either at.
No, I know you from somewhere. And I look at mom.
I'm one of those faces. I really do. People always say I've seen you somewhere.
Did you ever do any constant travel, like somewhere, like a public
Sitting
stop?
at the store.
Yes, 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 yes. Nice to meet you, Gary.
But did you ever go to networking area?
The bar in.
Thank you.
See you, Linda. Take care.
Because we just gonna get that close. So between Juice Plus and Dream Trips, we were always around.
It was part of the dream travel.
Wasn't it a pizza place?
Like, kind of, little two-story.
Oh, it was on Judas Street.
Yes. That is where I met you guys. I'm even basement friends with you. Foreign. I think that's what
I
it is.
think we are.
I remember you because we like, what are you talking about? Like, you're just adorable. And I'm like,
You were married to me, you don't even work in my house.
isn't that so funny? We're basement friends. I get all this stuff, I'm like, I need you guys in somewhere.
Yeah, you went to our drinker's presentation.
Oh, that was Arizona, what's killing that place, it's been forever.
Yeah, Lincoln Company.
I mean, we had her through networking with the drink trips and she was doing the deal. That was like 10 years ago.
Long time ago.
Oh, yeah.
And then drink took one belly up with COVID.
Oh.
And so we kind of, yeah.
Get it out of that one.
Well, we didn't have much choice, but at that point, we don't have voice. Everything.
Oh, I-
Get loud enough for you on the I said, oh,
Yeah.
I appreciate that so much.
This is like keeping me from my people.
All right,